Good morning, everyone out there in the internet world. This is Nico from Unicorn Riot. We are televising live the Derek Chauvin Trial, day 22, or day 10 from inside the trial with the jury selected. The proceedings will begin very shortly, I believe, in a few minutes. And if you are on Facebook, thank you for joining. Thank you for joining on YouTube and Twitter as well. I see a bunch of good mornings in the chat. Good morning to you all as well. And like I said, it should be starting in a very short, brief period, maybe 2 to 3 minutes. From what we've heard is that possibly we will be hearing from or seeing Dr. Andrew Baker on the stand today. He was the medical examiner for the Hennepin County government or Hennepin County Medical Center that did the autopsy on George Floyd. So be aware, you might see grueling photos. You might also, not really like the testimony, depending on even both sides. It's going to be interesting to see what happens today. And if it's not specifically Dr. Andrew Baker, I'm not sure who it will be. A little update from yesterday. I think we had said that Philonis, George's brother, his wife was in the George's family seat last night or in the afternoon, but it wasn't. It was George's niece, Tiffany Hall. That's a little correction to make. Besides that, I see people checking in a little bit. Superior, Wisconsin, UK, Alaska. Watching from Central North Dakota, I'm guessing. You can chime in where you're watching from. I'm looking at the Facebook.
We have one issue to deal with this morning, and we're going to deal with that off audio and off video, but it will be on the record, and the press can remain and report on what is going on in the courtroom, but it will not be broadcast outside this room. So if you could get the juror for us.
So I personally did not hear everything the judge just said, but from my understanding is that he wants to chat with a juror, possibly off the record. The media representative, the media pool is in there. We'll try to get you a report on that after the morning break. Usually the pool reporters end up sending their pool report during the break, and it usually takes them like 5 to 10 minutes to get to sending it because of they have to go down from the 18th floor down to the 3rd floor, 2nd floor, I believe, and so like they just can't send anything from up there. So that possibly is the deal where they're trying to talk to a juror about social media or sleeping or anything. We heard earlier this week is that there was some jurors sort of nodding off. The last 2 days, or yesterday for sure, there was no jurors nodding off. From my understanding, they were very intently listening to Dr. Tobin, as well as Eisenschmidt and Smock. I'm looking at the chat. Again, thank you all for chiming in. I'll say some of these places that I saw. I see Eugene, Oregon, New York, Champlin, North Carolina, Minneapolis, Green Bay, Wisconsin. And as just a quick update, as you're looking, this is the live feed from the court. You can see the clock on the right side of the court, right side of the feed. That clock is continuing. I think are live. I think they're talking right now to a juror. Maybe the jury. I'm not possibly sure. Southwest Michigan, Tallahassee, Florida, Sacramento. We got to thank you. Appreciate you, and you're welcome. We are only able to do this because of you all's support and viewership and sharing our work and donating. So thank you all for allowing us to continue our work. And again, we will try to get the update as to what happened right now later on, either in the first morning break or in lunch break. As I said, it takes some time for the pool reports to come through. I see a question about Mr. Hall, Maurice Hall, who is basically, I think, locked up right now. He showed up the other day on a Zoom call. He's pled the Fifth. It's your right to plead the Fifth to a subpoena. You have it's called the Fifth Amendment. You can just deny what they want. There's a person, Steve Martinez, a water protector from North Dakota, who's also pleading the Fifth for a grand jury proceedings in No Dapple water protector case where the police had sort of brutalized a lot of people, water protectors, in November 20th, 2016. I bring that up because that's similar in the sense that Maurice Hall is pleading the Fifth. Well, Maurice Hall, so his public defender came a couple, 3 days ago and spoke about him pleading the Fifth. The judge left it to Eric Nelson to write up the questions, I believe. I think it was on Eric Nelson. I could be wrong. And then Nelson was supposed to bring the questions in that he would ask. And the reason why that was because he didn't want to, he being Maurice Hall, didn't want to incriminate himself on any of the questions. And that's where his public defender was standing behind as well. And she did a pretty good job representing him, if you ask me. We haven't heard anything. I have not heard anything from him. Good morning from Red Lake. What's up there? How you doing? Jacksonville, Florida. They're talking about pipelines. We're talking about No Dapple a minute ago. Dakota Access Pipeline. Well, Line 3 is up there, Red Lake. There's even a treaty camp, Red Lake Treaty Camp. Duluth, Minnesota is up there as well. Jacksonville, Florida. There's some movement. Let me see. Looks like the judge moved around. Again, you are looking at the live feed. The audio's on in the live feed, so you will be able to know when they start talking, and I will try to promptly be quiet. Somebody says, love Nico, but I also miss Dan. Yes, we all do. No, Dan is good. Taking a little break for a sec. Toronto, Canada. Lake Travis, Texas. Some more thank yous. Thank you. Really appreciate that. El Paso, Wisconsin. I don't know if that's real, but El Paso and Wisconsin, we'll just say that. Amelia Island, Florida. Canada. Atlanta, Georgia. From Minneapolis. But yes, thank you again for chiming in on the chats where you're from. Again, we have like a quite the international viewership. That's really dope. And go over to our website, unicornriot.ninja, for more information. We do have the trial landing page, which is on the top. You can locate it with the Derek Chauvin Trial graphic. You can click into there and get some more information or get some streams that you might have missed. And definitely go to our Twitter feed, UR_ninja, to check that out. Yesterday, again, if you missed yesterday, what you might have missed was possibly one of the state's best days in trial so far. And I'm going to...
Statement calls next witness.
Good morning, Your Honor, Counsel, ladies and gentlemen. The state will call for their first witness, Dr. Lindsay Thomas.
Raise your right hand. Do you swear or affirm under penalty of perjury that the testimony you're about to give will be the truth and nothing but the truth?
I do, yes.
And Dr. Thomas, if you feel comfortable doing so, we'd ask you to remove your mask. I will keep mine on.
I would love that. Thank you.
And let's begin by having you state your full name, spelling each of your names.
Lindsay, Lindsey, Carol, Carol, Thomas, Thomas.
Mr. Blackwell.
Thank you, Your Honor. Good morning, Dr. Thomas.
Good morning.
Would you please tell us what kind of a doctor you are?
I'm a forensic pathologist.
And what is a forensic pathologist?
Forensic pathology is that branch of pathology, which is a branch of medicine, where medicine and law overlap. So it could be anything with a medical and legal component, could be toxicology. In some cases, it may involve living patients, but as I practice, and as most forensic pathologists practice, it involves what's called medico-legal death investigation.
Does it involve taking care of patients in the clinical sense?
Not living patients, no. A forensic pathologist may be consulted to help with the evaluation and interpretation of injuries in a living patient, but not in a treatment or clinical sense.
So most of your work then is done on deceased people?
Correct.
Any specific types of deaths?
Yes, the state statutes lists the types of deaths that have to be reported to the medical examiner, and briefly they tend to be unnatural deaths, so accidents, suicides, homicides, unexpected deaths, potentially suspicious deaths, that type of category of death.
Do you get special training in how to determine the cause and manner of death?
Yes.
Tell us something about the special training you received.
Well, shall I start back in medical school or just just the end part?
Just the end part.
Okay. I did a fellowship in forensic pathology, which is a specified training program for doctors who want to be forensic pathologists to learn how to do medical legal death investigations and certify cause and manner of death.
So would you tell us what pathology is as a field of medicine?
Sure. Pathologists are sometimes considered the doctor's doctor because we don't directly treat patients, but we provide information to doctors who then do treat patients. So, for example, if you've ever been to a lab and had blood drawn, that goes to a laboratory that is run by a pathologist, a clinical pathologist. So, you know, blood count, chemistries, things like that. Or if you've ever known someone that had a biopsy and was diagnosed with cancer, that's the type of pathology that is done by an anatomic pathologist. So you look at tissue and under the microscope and make diagnoses.
Is a medical examiner a forensic pathologist?
In Minnesota, a medical examiner is a forensic pathologist who is appointed by the County Board of Commissioners to be that county's medical examiner.
So it's a public official?
Yes.
So when you talk about the medical legal investigations, is that sort of a fancy way of describing what forensic pathologists do?
Yes, it's what the medical examiner's office does. It's death investigations, again, where there is a medical component and there may be a legal component.
Is it different from, say, a death in a hospital?
Yes. So if someone dies in a hospital, those are usually deaths due to natural causes. And they may have a medical death investigation in the sense that a hospital pathologist might do an autopsy, but they wouldn't do the full scope of the medical legal death investigation because those are mostly due to natural diseases.
What does death investigation entail?
Well, the way a medical examiner's office performs a death investigation, I think a lot of people assume it's all about the autopsy, the physical examination of the body, and that's really just a tiny part of the death investigation. The death investigation really starts at the very beginning when a death is found, a person is found deceased, or the office is notified of the death. We, as medical examiners, want to know all about that person. What's their past medical history, social history, family history. So we will do whatever we need to do to get that kind of history. Then we want to know, well, what happened, what were their terminal events? What happened around the time of their death? Were they complaining of something? Were they interacting with someone? Were they driving? Were they using, machinery, something like that? And then we'll look at the physical examination, and that part of the exam might include x-rays. It could include getting specimens for toxicology, for cultures, for all kinds of other laboratory tests, including looking at things under the microscope, little sections of each organ under the microscope. So that's the physical exam part. Then we'll look at the laboratory results. So that would be usually toxicology, but as I say, it could be blood cultures, or more recently it's probably been a lot of COVID testing, that kind of thing. And then look at the microscopic slides, and then put all of that together with the history, the terminal events, the physical findings, the laboratory findings, and then that's how the medical examiner reaches the conclusion about the cause and manner of death.
So all of that goes into a death investigation?
Yes.
Do you sometimes interview people also as a part of it?
Yes, the investigators who go to the scene may talk to family members. We certainly will talk to medical providers to get someone's past medical history. We often will interview or talk with law enforcement officers if they were the people who responded. It could be paramedics, EMS, troopers, just depends on the case.
I want to ask you about a phrase you use, terminal events.
Yes.
Could you explain to the jury what is a terminal event?
Sure. So when we're investigating a death as medical examiners, as I mentioned, we want to know as much as we can about this person leading up to their death, because that often, how they lived, will provide us information about how they died. When I'm talking about terminal events, I'm talking about what happened in the period of time around their death, shortly leading up to their death. So, for example, he was out shoveling snow, he came in, clutched his chest, and fell over. That would be an example of a terminal event. Or we know someone was driving a car and went off the road. That would be what the terminal events were.
Do you also rely on training and expertise on how injuries occur?
Yes, as a forensic pathologist, that's one of the things we look at and learn about is when we see this type of injury, we associate that with this type of event.
What does the medical examiner then do at the conclusion of a death investigation?
So the ultimate goal is to complete the information that's needed on the death certificate, specifically the cause and manner of death.
Is a report generated?
Yes.
What's the nature of that report?
Well, one of the main reports that's generated would be considered the autopsy report, and that's the report of the physical examination. But ultimately, the death certificate is kind of the final report.
Now, you told us as a forensic pathologist, you don't treat living patients.
Right.
So if we wanted to have a discussion, for example, about measuring lung volumes or air reserves in someone, that wouldn't be your bailiwick as a medical examiner?
That would not be me, no. By the time I see them, none of that applies, yes.
Right. So Dr. Thomas, are you currently employed?
I work, I'm kind of semi-retired. I do consulting, and then I work part-time at medical examiners' offices in Reno, Nevada, and Salt Lake City, Utah.
Reno and Salt Lake City, Dr. Thomas?
There are places I really like the way the office runs, and I like still to be involved as a medical examiner.
And pretty good places to hike.
And good places to hike, yes.
So where did you do your work before you were semi-retired?
Right before I retired, I was at the Hennepin County Medical Examiner's Office as an assistant medical examiner. And do you want me to go before that?
Yes, if you could tell us your work experience as a medical examiner forensic pathologist.
Sure. Initially, I started after my training at the Hennepin County Medical Examiner's Office, working as a deputy and assistant, then assistant medical examiner, and I was there for many years. And then in 1997, I joined the Minnesota Regional Medical Examiner's Office that was based in Hastings. And then I was chief of that office for 13 years. And we were the medical examiner's office for 8 counties in Minnesota, the largest of which were Dakota and Scott counties. And we also served as an autopsy referral service and medical examiner's office for many other counties in Minnesota, as well as Wisconsin and even one in Michigan. And then when our office outgrew that space, Dakota and Scott counties merged with Hennepin County, and that's why then I came back to Hennepin County.
So over how many years have you performed work or services as a forensic pathologist?
Let's see, 37 now, 36.
And in Minnesota, how many counties?
Oh, gosh. Well, I've been the direct medical examiner for 8 counties. I've worked in offices that have been consultant to dozens of other counties.
And have you also performed those services in parts of Wisconsin?
Yes.
When did you stop working at the Hennepin County Medical Examiner's Office?
It was early 2017. I retired from Hennepin County.
And how many autopsies would you estimate you have performed over your career?
Probably about 5,000 that I myself did, and then hundreds, maybe 1,000 more where I assisted someone else, or I supervised, or I participated in some way.
So in 5,000 or so cases, you've determined the cause and manner of death?
Well, actually way more than that, because as medical examiners, we don't just certify the cause and manner of death for the cases that we do autopsies on. There are numerous other cases that get reported by law to the medical examiner's office where we don't do a physical examination. So, for example, an elderly person falls in a nursing home and gets a hip fracture and then dies a couple months later. That death has to be reported to the medical examiner's office. We will investigate that death by looking at the medical records and doing all of what I talked about, getting family input and medical provider input, but we generally will not do a physical examination, but still, by law, we have to sign the death certificate.
So you're still determining then the cause and manner of death?
Right. We're just not using a physical examination as part of it.
And using the medical records primarily?
Yes.
Dr. Thomas, are you licensed? presently?
Yes, I'm licensed in Minnesota, Wisconsin, Tennessee, Nevada, and Utah.
Do you also hold any board certifications?
Yes, I'm board certified by the American Board of Pathology in anatomic pathology, clinical pathology, and forensic pathology.
Have you worked with any professional organizations over the years related to forensic pathology?
Yes, I've been a member of many different organizations. Minnesota Medical Association, American Medical Association, College of American Pathologists, American Academy of Forensic Sciences, and then I've been on the board of the Minnesota Coroners and Medical Examiners Association, probably 30 plus years, and then I'm a member of the National Association of Medical Examiners, and I was on that board and a member of their executive committee for a number of years.
And that goes by the acronym NAME, N-A-M-E?
Yes.
What does NAME do?
Well, they're the professional organization of medical legal death investigators, specifically forensic pathologists, medical examiners. And as an organization, they provide support to medical examiners, they provide information, they provide guidelines, an accreditation program, an inspection program, lots of ways of assisting medical examiner offices.
Dr. Thomas, have you done any teaching?
Yes.
Tell us about that.
I have been a clinical instructor here at the University of Minnesota Department of Pathology. I've done lots of law enforcement training through the Bureau of Criminal Apprehension here in Minnesota, as well as, oh my gosh, teaching everything from middle school science students through high school and college and all kinds of professional groups, whether it's other forensic pathologists, other law enforcement, you name the organization that comes into contact with death investigation, and I've probably talked to some of them at some point.
Do you have any publications?
That hasn't been a main focus of my career, but I have several, and early on was involved in an autopsy protocol that was ultimately published by the United Nations that's still in use.
So let's switch topics and talk about your experience testifying in courts. Have you testified before in a court?
Yes, probably over 100 times.
And is that predominantly in your role as a medical examiner?
It's mostly in my role as a medical examiner, where I did the autopsy and then the prosecution would call me to testify as to my findings. I've also testified as an expert witness consultant in cases where I didn't do the autopsy, but I was called by maybe in a civil case, either by the defense or the plaintiff, if they thought there was a wrongful death or some question about medical malpractice, something like that. And then I've also been consulted and testified in cases at the request of the defense, again, not where I did the autopsy, but where I reviewed someone else's work, and then I consulted with the defense or testified.
And have you testified in Minnesota courts?
Minnesota, Iowa, Wisconsin, North Dakota, South Dakota, Pennsylvania. I think those are the ones. Mm-hmm.
So, Dr. Thomas, are you being paid for your time and services in this case?
No.
Could you tell us about that? How does it come about that you're not being paid for your time and services in this case?
Well, I didn't ask to be paid.
And so did you reach out to the state, or did the state reach out to you?
No, you reached out to me. And, I knew this was going to be important, and I felt like I had something to offer, and I wanted to do what I could to help explain what I think happened.
Mm-hmm. So what were you asked to do then in this case?
Well, I was asked to review a lot of the materials and come to an independent conclusion about what I thought the cause and manner of death were and the mechanism for that cause.
Could you give the jurors a general sense or overview of the kinds of materials you reviewed?
May I look at my notes?
Yes, if you need to refresh your recollection.
So I looked at the Hennepin County Medical Examiner materials, including the autopsy report and toxicology and photographs and microscopic slides, things like that. I looked at the Hennepin County Medical Center records, so Mr. Floyd's past medical history from there, as well as Health Partners medical records. Then I looked at a lot of interviews, many videos, including body-worn camera videos, bystander videos, surveillance videos, some photographs, still photographs, timeline, and then some medical literature and textbooks.
So were you the medical examiner who investigated or did the autopsy around the death of George Floyd?
No, that was the Dr. Andrew Baker, the Hennepin County Medical Examiner.
Do you know Dr. Baker?
I do. He was a pathology resident when I was on staff at Hennepin County many years ago. And then when he did his fellowship, I was one of the staff people there. And then after our offices merged, I worked again with him at Hennepin County.
So would you have been then part of his training in his early formative years?
Yes.
Do you consider him a friend?
I do, yes.
Have you talked to him about this case?
No, not since right after it happened.
But you did review his report?
Yes.
And as well as Mr. Floyd's medical records?
Yes.
Did you review the history of terminal events for May 25th, 2020?
Yes.
So
what was kind of unique, what was absolutely unique in this case was the volume of materials I had to review. I've never had a case like this that had such thorough documentation of the terminal events.
And by way of the thorough documentation, what makes it so thorough, in your opinion?
Well, the use of videos is unique in this case. Certainly, as medical examiners, we use videos, but there's never been a case that I've been involved with that had videos over such a long time frame and from so many different perspectives.
Are you aware then of Dr. Baker's conclusions then on the manner of death?
Yes.
Your Honor, I'd like to show Exhibit 193 that's been stipulated to subject to Dr. Baker's foundation. So first, Dr. Thomas, what do we see here on Exhibit 193?
This is a copy of the certificate of death of Mr. Floyd.
Okay. And so, Brett, if we could kind of highlight just through the word underlying. Just to make it a little bigger to see. Okay. Based on your review of the evidence and the death certificate, do you agree with Dr. Baker's determination on the cause of death?
Yes, I do.
And is that by the word immediate on here?
Yes, cardiopulmonary arrest complicating law enforcement, subdual, restraint, and neck compression.
Have you, Dr. Thomas, formed an opinion about the mechanism of death?
Yes.
Would you tell us what that is?
In this case, I believe the primary mechanism of death is asphyxia or low oxygen.
So we'll come back to the mechanism in just a minute. Can you explain to the jury what this cause of death means and why you agree with it?
Well, it's kind of in two parts. So there's the cardiopulmonary arrest, which it doesn't provide a lot of additional clarifying information because in a way everyone dies of when your heart stops and your lungs stop. That's cardiopulmonary arrest. But as a forensic pathologist, I would use cardiopulmonary arrest when to differentiate it from a cardiac arrest. So this is not a sudden cardiac death, a sudden cardiac arrhythmia. This is a death where both the heart and lungs stopped working. And the point is that it's due to law enforcement subdual, restraint, and compression. That is kind of what ultimately is the immediate cause of death, is the subdual, restraint, and compression.
And just so it's clear for the jurors, does cardiopulmonary arrest mean heart attack?
No.
Does it mean fatal arrhythmia as a primary cause of death?
No.
It simply means that the heart stops and the lungs have stopped.
Correct.
So another way of simply describing death itself.
Right.
Can you explain what's referred to, looking here at the terms, subdual, restraint, and neck compression?
Those were activities by the law enforcement agency officers involved. Subdual is subduing someone, trying to restrain them is, in Mr. Floyd's case, involved handcuffing him, his positioning on the ground, the prone position, the people kneeling on him. And the neck compression is the knee on the neck specifically. Additionally, there was some back and other things being compressed by the officers.
So if you put all this together, cardiopulmonary arrest, complicating, law enforcement subdual, restraint, and neck compression, what does that mean?
Well, what it means to me is that the activities of the law enforcement officers resulted in Mr. Floyd's death, and that specifically those activities were the subdual, the restraint, and the neck compression.
And does this then also represent your own conclusion?
Yes.
A conclusion you have reached and an opinion you hold to a reasonable degree of medical certainty?
Yes.
Would you tell us what you reviewed in order to reach this conclusion?
All of those things that I mentioned earlier, again, what's sort of unique about this case is that often I would just review the medical examiner case file, and that would provide information about what the cause and manner of death is. But in this case, the autopsy itself didn't tell me the cause and manner of death, and it really required getting all of this other additional information, specifically the video evidence of the terminal events, to conclude the cause of death and manner of death.
When you make reference to something called the mechanism of death,
Yeah.
would you tell us what mechanism of death means?
So, cause of death is what's the thing, the disease or the injury or the process that caused someone's death. But the mechanism is kind of what was going on in the body at that time. So, for example, the cause of death might be a gunshot wound, but the mechanism of death might be blood loss related to that gunshot wound, or an infection that complicated that gunshot wound down the road, something like that. So it's more what was actually happening at the body level that resulted in the cause of death.
So focusing in on the mechanism of death here, how is it that the officers of dual restraint and neck compression caused Mr. Floyd's death?
So, as I mentioned, I think the primary mechanism was asphyxia or low oxygen. And it basically is Mr. Floyd was in a position, because of the subdual restraint and compression, where he was unable to get enough oxygen in to maintain his body functions.
What's required for normal breathing, Dr. Thomas?
What is required? Yeah. Well, there are kind of three components. You have to be able to get air in, so you have to have what's called a patent airway, and that could be nose, mouth, soft tissues of the neck, the larynx, the trachea, the larynx, trachea, bronchi. All of that has to be open. At the level of the lungs itself, there has to be adequate air exchange between oxygen coming in, carbon dioxide going out. And then finally, the way the lungs work is it's kind of like a bellows, that when you suck in air, your diaphragm drops and pulls air in, and then when you relax, the diaphragm collapses and pushes air out. So all three of those things have to be functioning in order to get adequate oxygen in. So, for example, if someone is smothered or strangled, or they inhale a piece of hot dog, or they have pneumonia such that their lungs are completely filled, then their airway is obstructed so that there isn't adequate air coming in, oxygen coming in. Or if someone is in an environment where there isn't enough oxygen, so for example in a closed garage in which an old car has been running, there may be way high carbon monoxide, and in that case they're perfectly able to breathe in and out, but there just isn't enough oxygen. And then the third would be if there's some kind of restriction such that your chest can't expand, your diaphragm can't expand, so the bellows function isn't working. And if any one of those components isn't working, then the result will be this mechanism of inadequate oxygen.
Doctor, how does narrowing of the hypopharynx fit into this?
Well, the example I would give that people are probably most familiar with is sleep apnea or snoring. If you yourself or have a partner who snores, you know that especially in certain positions, what happens is the hypopharynx, which is sort of the soft tissues at the back of your throat, will kind of collapse because there's inadequate air coming, either forcing it out or forcing it in, which is why a CPAP machine works, because it forces air through that floppy area. And if that collapses, then it makes it difficult to get air in.
So, Dr. Thomas, what do you rely on to reach your conclusion that low oxygen was the mechanism of death?
In this case, it was primarily the evidence from the terminal events, the video evidence, that show Mr. Floyd in a position where he was unable to adequately breathe.
Mm-hmm. So how does the autopsy report itself assist you or not?
So the way the autopsy really helps is it's great for ruling things out. So in this case, the autopsy ruled out, for example, underlying lung disease. Mr. Floyd had had a history of COVID, but there was no evidence in his lungs at the time of his death that he had any lung disease that would impair his ability to breathe. And it ruled out injuries to the neck that suggest that the bones in his neck had been broken, for example. And it ruled out a stroke. He didn't have a stroke, so it wasn't like his blood pressure was so high that, you know, he ruptured a vessel in his brain. He didn't have an aneurysm. He didn't have, which is a ruptured vessel. He didn't have an embolism, which is a blood clot. He didn't rupture his heart. He didn't have an old heart attack or a recent heart attack or what's called myocardial infarct. So the autopsy is really great for ruling things out.
Dr. Thomas, just to focus on one of those, you said the autopsy ruled out a recent myocardial infarction?
Yes.
How does it do that?
Well, when a forensic pathologist examines a heart, one of the things they look at is the coronary arteries, which are the vessels that supply blood and nutrients to the heart muscle. And then the pathologist will examine the muscle of the heart. And if someone has had a recent heart attack, there may be evidence in the heart muscle of that damage. Or if they've had a prior and older heart attack, there will be scarring in the heart muscle that shows that area of damage.
Thank you, Doctor. Is it normal as a part of your death investigation then to seek out and to look at the video?
Yes. Oh, yes.
In this case, is there any particular video footage that struck you as more significant than others from what you saw?
Oh, gosh, this case, there were so many. The body-worn camera videos were very instructive because they started, well, and the cup foods video, because they showed how Mr. Floyd was behaving long before law enforcement interaction. Then the body-worn cameras show the early interactions before there was any of this subdual restraint and compression. And then they show the interactions during the subdual restraint. The bystander videos are really instructive, as well as the surveillance videos from the scene at showing kind of during the time of the restraint. So there were lots, I would say.
So in terms of the video footage then either ruling in a cause or ruling out a cause, how did it inform your assessments about the cause of death, having looked at the video?
Well, it helped me rule in a cause and also rule out causes, I would say.
So did it help you determine whether this was what I might refer to as a lights out kind of death, a sudden death?
Right. So what I observed from all of these videos is this was not a sudden death. Mr. Floyd did not, it's not like the snow shoveling where I told you somebody comes in, collapses and, you know, clutches their chest and falls over. There was nothing sudden about his death. So that's what I would have expected if it was a cardiac arrhythmia or abnormal beating of the heart. Typically those are someone really falls over pretty quickly, and this was not that. Likewise, it was not the type of death that has been reported in fentanyl overdose, for example, where someone becomes very sleepy and then just sort of gradually, calmly, peacefully stops breathing. This was not that kind of a death. So I felt comfortable ruling out those as causes of death. And then on the flip side, I could clearly see from watching the video what happens to Mr. Floyd during this subdual restraint and compression, and what happens to his breathing is it gradually becomes more difficult and then stops.
Doctor, tell us, what is the bellows function?
Well, it's what your diaphragm does along with the muscles in between your ribs. So when you take in a deep breath, what's happening is your rib cage is expanding, and that then forces the lungs to open up, and that's what draws air in. So it's when someone is intubated in like surgery or something, it's sort of the opposite of that, because your diaphragm is paralyzed, and so somebody has to force air in. But under normal breathing circumstances, it's the bellows, it's the pulling air in.
So what did the video tell you? What did you see in it that had to do with the bellows function?
Right. Well, Mr. Floyd is in a position, so first of all, he's prone or sort of slightly with his head to the side, and he has his arms handcuffed behind his back. So that's already a bit of a difficult position to be in, the prone and handcuffed. And then with, at times, at least 3 officers on top of him, whether it's his neck or his back or his lower back or legs, it prevents him from moving his body into a position where he can adequately use the bellows function. And his chest is sort of compressed in this position in such a way that he can't adequately expand and get enough oxygen in.
Over what period of time was this?
9 minutes.
So what did you see in those 9 minutes that led you to conclude that the mechanism of death was low oxygen or asphyxia?
Well, initially, Mr. Floyd is able to struggle pretty vigorously when he's in this position that he recognizes as it's going to be hard for him to breathe in this position.
Sustained. That the last part of the answer about Mr. Floyd's state of mind is stricken as speculative.
Sorry. So initially, when he's in the prone position, he's breathing and speaking, and it might look like, oh, he's at that point getting enough air exchange. But over time, you can see that his breathing is getting more and more difficult, and he's saying less and less. And then about halfway through the whole restraint, subdual, compression process, he stops breathing. Well, he first stops speaking entirely. And then again, shortly after that, there's a movement that I believe is what's called an anoxic brain reaction, which is, it looks like kind of a twitch. It's something that the body does when the brain no longer has enough oxygen. So that's the point at which you can tell by looking, oh, that's where he no longer is getting enough oxygen to his brain. And then the restraint and subdual and compression continue for many minutes more. Even after someone checks and says, oh, there's no pulse, they maintain the position. So at that point, his heart has also stopped. So he's stopped breathing and his heart has stopped.
So doctor, you mentioned an anoxic, A-N-O-X-I-C?
Yes.
Anoxic brain reaction?
Yes.
Is that also known as an anoxic seizure?
Yes.
Is that something that a person does consciously and voluntarily?
Oh, no. No, it's something that your body just does when your brain doesn't have enough oxygen. It's why in lots of cases, people who are witnessing someone die will say, oh, they had a seizure and died. Well, no, what's actually happened is they've basically died. Their brain doesn't have enough oxygen, and then they had this muscle twitch that may look like a seizure.
So can we go back to Exhibit 193, and I want to ask you about, that's right in front of you, the other contributing conditions, if we could highlight that, Brad. So do you see where I'm referring to the other contributing conditions?
Yes.
And what are those?
In this case, they are arteriosclerotic and hypertensive heart disease, fentanyl intoxication, and recent methamphetamine use.
So would you explain for the jury, what does it mean, other contributing conditions?
So the way forensic pathologists and medical examiners usually use this is, people often think of it, the death certificate is for that person, that specific person who died and their family. And that's true. It does serve a very useful purpose for life insurance, whatever. But forensic pathologists are also using death certificates for public health data purposes. And so in any given case, we aren't just thinking about this particular person and their cause and manner of death. We're also thinking the state and the federal government collect data on why do people die? What is cause of death? It's how we know as a country that we have, how many people die of COVID, for example. It's because death certificates list that. So one of the things that we use this other contributing conditions for is to list disease processes or drugs that are present at the time of death, but that we don't directly believe directly contributed to the cause of death. But it's so that someone looking at data years from now can say, okay, we want to do an evaluation of all deaths during law enforcement subdual. And how many of those deaths involved someone who also had drugs on board? Because that may be something that is relevant then in trying to prevent these sort of deaths in the future, for example. Or the case where I use other contributing conditions probably the most is the hip fracture case that I talked about before, where someone dies of a hip fracture due to a fall, but they're 84 years old and they also have hypertensive heart disease, arteriosclerotic heart disease, asthma, diabetes. And so I will list those as other contributing conditions. Now, in no way did those things cause the fall and the hip fracture and the resulting whatever pneumonia or whatever. But again, someone from a data perspective might want to know, of the 84-year-old women who die of hip fractures, what percentage of them have underlying heart disease? Because again, from a data collection standpoint, does that provide useful public health information that can be used in the future to try and prevent these deaths? So that's how I would view this. It's very long-winded, sorry.
Sure. No, Dr. Thomas. So in understanding this is further, so other contributing conditions are conditions that may have contributed but were not the direct cause of the death.
Exactly.
Did you consider these other contributing conditions in your assessment of the cause and mechanism of death for George Floyd?
Yes.
And how did you consider them, first of all?
Well, I wanted to look at each one and ask the question, is this the cause of his death? Is arteriosclerotic heart disease the cause of his death? He has narrowing of his coronary arteries. In many cases, that is the cause of someone's death. So I looked at that, but again, it comes down to what were the history of the terminal events. Does this look like the type of death we see, or is, I'm not a clinician, so I don't see it, but as a forensic pathologist, I know from hundreds of families describing what happened at the time of death, that this death does not fit what has been described in someone who dies of a cardiac arrhythmia from arteriosclerotic heart disease. And likewise, hypertensive heart disease. Those tend to be cardiac arrhythmias, sudden cardiac deaths. This is not that kind of death. Likewise, fentanyl intoxication, as I described. And again, I don't treat patients, I don't see living people, but what I know from family members who describe deaths that then later turn out to be due to fentanyl, the death is slow, it's peaceful, they fall asleep, they may hear snoring or very heavy, deep breathing. There's no struggle. They just often are found just kind of slumped over. It's a very slow death. So again, totally different than what is seen in Mr. Floyd's death. Methamphetamine as a cause of death generally is, again, much more of a sudden death. It may cause a cardiac arrhythmia. It may cause a seizure, and by that I don't just mean this sort of terminal anoxic twitch, but like a full-blown seizure. And again, looking from what I know about Mr. Floyd's death, because it's so well documented, that does not fit with a methamphetamine death.
So you reviewed the toxicology.
Yes, oh yes.
How would you characterize the amount of meth in Mr. Floyd's system at the time?
Well, it was there. It's not particularly high. Certainly in deaths that I have attributed to methamphetamine, it's been much higher. But it's not like there's any safe level of methamphetamine, but this was a very low level.
So was the methamphetamine significant in your assessment of the cause of death?
No.
So then, based on your review of the video and application of your work, experience, and knowledge, did you rule out drug overdose as a cause of death?
Yes.
And that's an opinion you hold to a reasonable degree of medical certainty.
Yes.
Now, I wanted to clarify this earlier and just forgot to. Does the medical examiner also complete the death certificate?
Yes, we don't issue it. That comes from the county or state. But as the medical examiner, we fill out all of the cause and manner and how injury occurred and all that kind of stuff.
How many death certificates have you filled out?
Oh, gosh, well, thousands and thousands.
So if we look here again at the exhibit in front of you, 193, in the left margin, we see a reference here to underlying.
Yes.
Would you tell the jurors what that means?
Sure. So let's go back to that hip fracture because I keep referring to that. But for example, someone who dies of a hip fracture, generally that's not a sudden death. What happens is someone gets a hip fracture, they get it surgically repaired, they may get pneumonia or something like that. So then, in that kind of case, we would list the immediate cause of death as pneumonia. The underlying cause of that is the hip fracture that was operated, but the underlying cause of the hip fracture was the fall. They fell, they got a hip fracture, they got pneumonia. So it's something that is used when you have a death that has maybe multiple sequences of events. But in a case like this, you don't need an underlying because it's all included in the first line. It's all due to the law enforcement subdual restraint and neck compression.
Now, the death certificate does not use the word asphyxia or any reference to low oxygen.
No.
Would you have used the word asphyxia in this case?
Probably not. I tend not to use the word asphyxia much because it requires a lot of explanation. It doesn't really offer much additional information unless you have a chance to have a discussion like we've had about what asphyxia means. So I tend to just list, if someone dies of hanging, well, that's a type of asphyxial death, but I wouldn't say necessarily asphyxia due to hanging. I would probably just list hanging as the cause of death.
So to refer to asphyxia or low oxygen doesn't tell you anything about why there's asphyxia or low oxygen.
Right.
Are there findings on autopsy that suggest low oxygen as a cause of death?
No, there's nothing on autopsy that shows low oxygen.
There's no test that can be done for low oxygen on autopsy?
No.
Are there physical findings that sometimes may be found and may be consistent with low oxygen?
So there are no physical findings that show low oxygen, but there may be physical findings that are consistent with a cause of death that may result in low oxygen. So, for example, the hanging, let's use that hanging. If someone is partially hanged, by that I mean they are only partially suspended, so there's only some pressure on their neck. They may have what are called petechiae, or little pinpoint hemorrhages in the eyes, because blood is still going into their head but not able to drain out because of the pressure on the neck. So at autopsy, we will see the petechiae, and we can say, based on the scene investigation and the history, that finding is consistent with hanging, which the mechanism for hanging is a type of asphyxia. Or in manual strangulation, we might see some bruising, or we might see broken bones in the neck. And the mechanism of death in strangulation is low oxygen, but the finding that we are seeing is consistent with strangulation. So it's kind of a fine line between saying it isn't the low oxygen that we see at autopsy, but sometimes, not always, but sometimes in cases where the death is the result of low oxygen, we see specific findings related to the cause.
So if you then see petechiae, it could help to lead you to the conclusion that it was death by low oxygen.
Yes.
But if you don't see petechiae, what can you conclude?
Nothing. So it's one of those things that when it's present, if there's petechiae or broken bones in the neck or bruising, that's very helpful in putting together a picture of what might have happened. But if you don't have them, it doesn't help you one way or the other.
And by not help you one way or the other, it means you can't conclude from that alone that a person did or did not die of low oxygen.
Exactly.
Right. And you mentioned bruising in that context.
Right. And again, sometimes, I mean, for example, strangulation is a great example. Sometimes in strangulation you have all kinds of bruises that you can see on the neck, but other times there's a strangulation case and they don't have a single mark on their neck. And I mean, there's all kinds of reasons that bruises may or may not occur, but it's, again, it's one of those things. If it's there, it's very helpful. If it's not, it's not helpful.
Were there other findings in the death investigation that supported your conclusion on the cause and mechanism of George Floyd's death?
Yes.
Would you tell us what those were?
So Mr. Floyd had superficial injuries, what would be described as superficial injuries, specifically on his face, on his shoulders, on his wrists. And what that does is it supports what I saw in the videos, which is that he's being forcibly restrained and subdued, and he's trying to move into a position by rubbing his face against the concrete cement of the ground, by pulling against his handcuffs. You can see the injury to his wrists from the handcuffs, and by pushing with his shoulder. And he also had some scrapes on his knuckles on his right hand, and again, that was from him pushing to try and get into a position where he could breathe.
Dr. Thomas, are there photographs that depict what you're describing?
Oh, yes, thank you.
So, Your Honor, we've stipulated by way of foundation to the photos, we have individual packets for the jurors.
Members of the jury, there are some stipulated photographs that are going to be shown to you, or as we call, as you've heard me say, published to you. We're going to go old school this time. We're not going to put everything on the monitors. We're not going to broadcast it out. But everybody in the courtroom will have access to it, including yourselves. Essentially, a packet with these photographs. We'll collect them afterwards because these are for you to use in the courtroom. The actual exhibit will be available in deliberation, however. Mr. Blackwell?
Yeah, would you either like the deputy or someone distribute these, or should I?
You can go ahead, Mr. Blackwell. Before you look through them, you can take them out, but don't start looking through them until Mr. Blackwell resumes his examination. Mr. Blackwell, Mr. Schaefer will take care of the rest. Give the rest of the... Hold on, Mr. Blackwell. Let's make sure everybody who would like a copy gets one. Around. Spectators. Spectators should each get a copy if they want one. You'll have to give up one of your copies. There you go. Mr. Blackwell?
Your Honor, if I may, I think I'll give one to Dr. Thomas just so she has it.
Actually, she can have mine.
Oh.
That way Your Honor won't have to use the camera at all. So, Dr. Thomas, if we start with the exhibit that's marked 185.
Yes.
I take that back. I would like to see it on my screen. Dr. Thomas, looking at Exhibit 185, what is significant in this photograph that informs your conclusions pertaining to the restraint and subdual as a cause of Mr. Floyd's death?
This is a photograph of Mr. Floyd's face, and it shows some facial injuries, most notably the what are called abrasions, which are scrapes over his left eyebrow and over his left cheek. You can also see there's littler scrapes or small cuts on his nose and lip, upper lip, and then a little on the left side of his lower lip. But the main thing this shows is that the left side of his face was obviously in contact with some rough surface.
Dr. Thomas, if we look at Exhibit 235, it may be a close-up of the same area.
Sorry, here we go. Yes. Yes, that is a close-up of the left cheek and the left forehead. And you can see, for example, above the left eyebrow, there's a dark area, that's a dried scrape, as well as there's a little bit of discoloration of the skin, so that also there was a bruise there. And then on his left cheek, you can see the dark area as well as kind of a lighter orange pink area, and those are, again, scrapes. The dark area is where a scrape has dried.
And what does it tell you about the cause or mechanism of his death?
It's consistent with the impression from watching the video that his face was on the ground and he was moving his face in an effort to get into a position where he could breathe.
Let's look at Exhibit 188.
This is a photograph of Mr. Floyd's left shoulder.
And what did we see here?
This, again, is an area of scrapes and indicates that there was some force between his shoulder and some rough surface, in this case the ground. And again is consistent with what it looks like on the video, that he's struggling to push himself into a position where he can breathe.
Let's look at Exhibit 187.
This is a photograph of his right shoulder, and again, you can see there's a little bit of discoloration, and then the skin is scraped. So there's less injury impact here, and that fits with, again, what you see in the video of which side was down and which side had more contact with the ground.
Let's look at Exhibit 189.
This is a photograph of Mr. Floyd's left hand, and if you look at the base of his hand, sort of right over his wrist, you can see there's some areas of red discoloration with kind of a pale area in between. and that's consistent with handcuff marks. You can also see on the sort of outer edge, there's some white material that's dried skin, and that's an area where his skin has actually been rubbed up from the handcuffs.
And Dr. Exhibit 190?
Exhibit 190 is a photograph of his right hand and wrist. And again, in this case, you can see more clearly the sort of the double-lined discoloration above his right wrist that's consistent with the handcuff marks and indicates pressure against handcuffs. And again, on the outer edge, you can see there's a little bit where it's darker and then there's some white skin. So that's an area where it's actually been scraped. The skin has actually been scraped by the handcuffs. Also, on this photograph, you can see on the knuckles of his index finger and middle finger, there's some skin that is scraped off. And that's consistent with what you can see on the video where he's pushing against, I think it's the rim of the car tire or something, to try and push his body into a position, again, where he can breathe.
Thank you, Dr. Thomas. Your Honor, the jurors may put the photographs away if they'd like.
Mr. Schaefer, we're going to collect those photographs.
Not the actual exhibits, they're simply for your use during this time. And we'll ask the spectators also to return the exhibits. You can keep yours. Counsel can keep theirs.
Thank you, Your Honor. So Dr. Thomas, having looked at this physical evidence from the autopsy, was that evidence in of and by itself conclusive?
No. There are multiple ways that scrapes and bruises can happen. It's only useful in the context of what is seen in the videos.
Was there any evidence to suggest that Mr. Floyd was suffering from a potentially fatal condition on the evening of May 25th, 2020?
No.
Do you have an opinion, to a reasonable degree of medical certainty, if Mr. Floyd would have died that night had he not been subject to the subdual and restraint of the police?
There's no evidence to suggest he would have died that night, except for the interactions with law enforcement.
Now, were there other mechanisms that you felt contributed to Mr. Floyd's death?
Yes.
Could you generally characterize what those were?
Sure. So I think a secondary mechanism in this case is what I refer to as physiologic stress. And by that, I don't mean like the stress, oh, somebody's a type A personality and they have a deadline at work and they're just really stressed about it. I'm not talking about that kind of stress. I'm talking about the kind of physical stress you feel when you're driving along and all of a sudden a car swerves right in front of you and you slam on the brakes and you realize, oh my gosh, if I hadn't reacted, if that had happened a second earlier, I would have been in a potentially fatal car crash. And you can feel your heart race and and then the car speeds on and you slow down and you realize, I'm okay, everybody in the car is okay, and your heart rate then slows, or I think even worse, you're at the beach and you suddenly realize, my toddler, I haven't seen my toddler in, oh my gosh, where's my toddler? And that rush of adrenaline you get, and you feel flushed and you get goosebumps and your heart races and you feel short of breath, and then there they are, they're getting an ice cream cone, and you'd go, oh, okay. But it takes you a minute for your heart to kind of slow down and your blood pressure to slow down and you to be able to take a deep breath and recover yourself. So that's the kind of physiologic stress I'm talking about, only instead of after a second or a minute, this goes on for minute after minute after minute for 9 minutes, where you are terrified, and you can't, there's no recovery. So it's that kind of fear of life that I'm talking about for physiologic stress.
Are you able to tell us what is going on in the body during the physiologic stress?
So it's the reactions are, you get chemical release, you get adrenaline, noradrenaline, or epinephrine, norepinephrine, and those are things that make your heart race, your blood pressure go up, you require more, your muscles get ready to act, to go run, to do whatever you need to do, slam on the brakes. And so you start needing more oxygen in your muscles, you need to take more breaths, you need more oxygen for your heart rate because your heart's beating faster. There may be other chemicals that are released, whether it's stress hormones or cortisol or things like that. There may be lactic acid that's produced as your muscles, when you have a heavy workout, your muscles get tired and kind of sore. It's because there's been an increase in lactic acid and it's your muscles working. So all of those physical things, those chemical things, can cause reactions in the body that put additional stress primarily on your heart, but also on all of your body systems, because your body requires your chemistry to be in very fine balance. And when there's too much, say, lactic acid, or too much, not enough, not an ability to compensate for that elevated lactic acid, then all of your body organs will get into trouble.
Doctor, do you consider that physiological stress that you're describing a direct cause or mechanism of death, or is it secondary?
Well, I guess I would consider it a contributory cause, or contributory to the cause of death. It's another contributing mechanism.
And so the direct cause is what, and then the secondary cause is what?
So their sort of primary mechanism, I think, is asphyxia, and the secondary, or low oxygen, and the secondary mechanism is this physiologic stress. But ultimately, the cause of death is the subdural restraint and compression.
So this physiologic stress, or physiological stress that we're discussing, is that something that can be observed on autopsy?
No.
And why is that?
Well, it's a chemical reaction. It's increased heart rate, which of course we don't see at autopsy. It's increased chemicals that we can't test for at autopsy. So none of it is anything that can be seen physically.
So it's a functional mechanism?
Yes, that's a good way of describing it.
Is low oxygen then also a functional mechanism?
Yes.
So could you tell us how you felt that the physiological stress was significant to your conclusion on the cause of Mr. Floyd's death?
So Mr. Floyd was already in a position where he was experiencing difficulty breathing and getting enough oxygen in his body. And on top of that now, there's this physiologic stress that's putting increased demand on his heart, increased demand on his lungs, increased demand on his muscles. So all of the things that he's using, his muscles, his strength, his body, to try and get himself into a safe position where he can breathe, those are being doubly stressed by the position that he's in, as well as the underlying chemical reactions that are going on in his body. So it's kind of a double whammy to his heart and lungs and muscles and his whole system.
Okay. So, Dr. Thomas, I want to show you Exhibit 194. Again, Your Honor, this has been stipulated to, subject to foundation later. First, Dr. Thomas, can you tell us what this is?
This is a press release that was put out by the Hennepin County Medical Examiner's Office at the time they certified the cause and manner of death of Mr. Floyd.
And is it your understanding that the Medical Examiner's Office generates this type of a press release report in certain cases?
Yes.
So there is a section in the press release report that refers to manner of death.
Yes.
Let's see if we can highlight that. And we see the word there, homicide.
Yes.
And we see also in here information we saw on the death certificate, where the press release says also how the injury occurred.
Yes.
And would you read that for the record?
How injury occurred: decedent experienced a cardiopulmonary arrest while being restrained by law enforcement officers.
Again, you agree with that?
Yes.
So let me show you what was marked as Exhibit 918. And homicide is a manner of death.
Yes.
And would you explain to the jurors a little bit about what it is medical examiners look to when they're trying to determine manner of death?
Sure. So unlike cause of death, which could be anything, we only have 5 options for manner of death. So a death can be natural, meaning that all of the conditions that contribute to the death are due to just innate processes. Could be cancer, could be heart disease, something like that. Second category is an accident, and that would be something like a motor vehicle crash or an unintended drug overdose. Third category is a suicide, which is death at one's own hands, with at least probably some element of intent. The fourth category is homicide, and that means death at the hands of another. And then the fifth category is undetermined. And that means generally we don't have enough information about this type of death to make a determination to fit it into one of the other categories. So for example, we talked a lot about terminal events early on. And in some cases, we have no idea what the terminal events were because the person is just found dead in their residence. And we don't know because they've been alienated from family. We don't know, were they saying they were going to take their lives? Did they have a prolonged history of using drugs? Did they just get out of prison? You know, we're unable to get enough information to sort it into, was this an accidental death or was this an intentional suicide death? And so that would be an example where we might use undetermined, where we just don't have enough information.
So Dr. Thomas, if you look then at the screen in front of you, does this depict or show the manners of death?
Exactly.
And homicide is highlighted, reflecting what Dr. Baker found.
Yes.
And do you agree with that finding?
Yes.
In the case of George Floyd. Your Honor, we offer Exhibit 918.
Any objection? And the exhibit itself is without the highlight, is that correct?
Yes, Your Honor. Yes.
918 is received.
For the ladies and gentlemen of the jury, these are the 5 manners of death that you were describing, Dr. Thomas?
Yes.
And we've highlighted homicide to reflect what Dr. Baker found and that you agree with.
Yes.
Is there any guidance given to medical examiners about how to select homicide as a manner of death?
Yes.
And,
There is a guide that was published by the National Association of Medical Examiners that provides assistance in how to make a determination between these different.
I want to show you what's been marked as Exhibit 952. Do you see that, Dr. Thomas?
Yes. Yes.
And is this the publication that provides the guidance to medical examiners on how to determine manner of death?
Yes.
Would reference to excerpts from this guide be helpful to your testimony?
Yes.
Your Honor, we offer excerpts from Exhibit 952.
Any objection?
Yes, I do object to this, Your Honor.
All right. Actually, would this be a good time to break so we can deal with the sidebar issue as well? All right, members of the jury, we'll take our 20-minute. We're probably going to have some work here, so let's come back around 5 after. 11:05.
The jury, it's within the province of the jury in terms of the jury instructions that are ultimately provided to them to determine the legal definition of what of this case. So in this particular instance, I think it would confuse the jury between the medical definition and the legal definition. I don't think it's appropriate for this to be admitted.
Well, and I can't see the whole exhibit in any case. All I see is the title page.
Can you click to the next screen? Can you see that, Your Honor?
All right, hold on. Do you have any objection to this being shown as a demonstrative?
I don't have it as being a demonstrative, but going back to the jury as an actual exhibit.
That's fine. I'll receive 952 as demonstrative so you can show it to the jury and have them follow along and have Dr. Thomas. I figured at some point you're going to do that with her or Dr. Baker.
Yes.
So that's fine. Okay, as a demonstrative, it is received. All right, 5 after, please.
Well, thank you for joining everyone out there in the internet world. We're on a morning break for 20 minutes. You just heard the judge. If you didn't, it is 11:05 Central Time that they are planning to come back. You see the timer there. That is a live feed as well. This is Nico from Unicorn Riot. Thank you all for joining. Alex is on the tweets. Go check out our Twitter feed, UR_ninja. Check out our website, unicornriot.ninja, for more information. You know, what you saw today so far was basically Dr. Lindsay Thomas, forensic pathologist who was an expert witness on the stand today from the state. She did not do the medical examination of George Floyd, but we expect to hear possibly from Andrew Baker, the medical examiner, soon, today, possibly, maybe tomorrow. So what we know that she said so far is that George Floyd's death was listed as a homicide, from lack of oxygen, from asphyxia basically, and the police restraint. She says she doesn't really like to use asphyxia word, but she did use it in the beginning. We're going to allow some time. So again, there are pool reporters inside the courtroom. Those pool reporters, I'm unsure who they are today, but we will possibly be getting an update from those folks closer to the break ending. So what we'll try to do is just show you some videos, and then in the meantime be able to give some time to the pool reporters to allow us to read what they say and relay some of that information. Again, check out our website, unicornriot.ninja. We have a Chauvin web page, sort of like a landing page for a lot of more information. Yesterday we started, so again, this is police killings is the topic. Not to take it away from George Floyd, because that's why everybody is sitting here watching this trial. But modern day policing and policing in general is the bigger picture. And we're going to take you outside of the micro from George Floyd's trial to a little bit bigger picture. Yesterday we started to play, before we didn't play, but yesterday we started to play a video of the mother of Kobe Heisler, and we're going to play that again. It's a 2-minute video, and then we're going to play a video from an event where Kobe Heisler was remembered 1 year later. This happened last year, and in 2019, I believe, Kobe Heisler was killed by Brooklyn Park, Brooklyn Center Police, one of those two. Kobe was, I think, 21, a very young, autistic, unarmed individual at his grandma's house. The police were called, then they were for a checkup, then they were called back and said everything's okay. Then the police said, you know what, we're going to go anyway. And they ended up killing this young man. So we're going to hear from his mother, and then after that it's going to go to a video from the first year remembrance celebration, commemoration of Kobe Heisler. So we're going to play that in a second. This will be Amity Dimmick Heisler. We also do, you saw a face or a head just walk by in the video. We have that audio on. If something happens in the courtroom, you will hear it. And I'm paying attention to the feed, and I'm pretty sure they won't be back until 11:05 at least. But just know that when we are playing these videos, we are also checking out the feed and making sure that they're not having court on us. So again, thank you all for tuning in. Thank you for being super nice in the chat room with everybody. It's a very traumatic experiences to watch, very traumatic topic. And again, thank you all for being careful with yourselves and with each other and being respectful. And again, thank you, Alex, on the tweets. Go check out our Twitter feed, UR_ninja. All right, we're going to roll this, the clip on Kobe Heisler. It'll be 2 videos that'll play, and both of these videos are from last year at the Government Center where the Derek Chauvin trial is being held.
Thank you so much for taking the time today. Can you tell us a little bit about your son?
My son Kobe, he was the most beautiful boy in the world. He was loving. We like to call him a gentle giant. He stood probably that high over me. One of his favorite things to do, actually, as I was going through looking at all the pictures, trying to find pictures for his funeral service, was he really like to just put his just rest his head on top of my head. And I saw that in just numerous pictures. The other thing that I realized that he really likes to do, that I caught numerous pictures of, is he loved picking his little sister up. Like when he started getting big, that was his favorite thing to do, was just pick her up. And I have like a million pictures of them just laughing, you know, him holding her and And I don't know, all I can say, you know, he was nonviolent. So, and still to this day, I haven't looked at the videos that they uploaded. I've heard about them. I haven't read the report from the district attorney. I haven't read any of the whatever the heck is out there. I don't need to. I know my son. We all knew my son. He was never a threat to anybody but himself. And all that I know is that police responding to mental health or autism sorts of situations. There's zero reason. The statistics show that that person generally ends up dead or injured, but certainly not helped. So there's a lot of work to do, and that's kind of where I'm at, because that's all they left for me to do for my son. Fight for justice, and also most importantly, like, give him a legacy, you know? Give him, I won't let them put his name out there and vilify him in any way. I'll fight against that till the day I die, because he was nothing but a beautiful, beautiful person, and he didn't deserve this.
It is time as human beings to choose a side. To choose a side. A side of not political versus community. Not a side of white versus black. A side of right versus wrong. Right versus wrong.
Power like the power of the people. Power of the people don't stop.
I knew Kobe better than anybody, and I was the person that got along with him the best, and I'd go over there and hang out with him all day, many days, like more than half the summer, and always during school and everything. He was trying to get away, he was trying to run out the door, and then I knew when he was running, like when they say he grabbed a knife out of the couch, he was running, and they say he was going to hurt my grandmother, but I knew he would never touch her. He would never have hurt the officers, and those cops should be across the street in jail right now.
When is it going to stop? When is it going to stop for me, for the family? When will this finally stop and we don't have to keep reliving this every time the government and the police that are supposed to serve and protect us are failing at their job?
54% of all lethal police encounters are people with disabilities. 54%. My heart breaks.
911 is a joke. It shouldn't say serve and protect, it should say kill the autistic, because maybe Noah and Jillian mentioned this already, but the police killing 3 people a day? 3 people a day, you know, since we made them, the FBI made them start keeping track in 1996, it's been 3 people a day. And 54% of those people are disabled. 54%. And that's why we need to defund the police. We've tried to reform the police. They said they were going to defund the police. They're not defunding the police. Every budget in the city was cut because of COVID, except for the police. They're getting millions of dollars.
And now we're going to hear from Amity, Kobe's mother.
I don't even want to talk today.
We got your back.
The last time I saw my beautiful boy, he was lying in the morgue. He was still hard from the ice. And cold and clammy. I'm still upset I didn't take the wisp of hair that I saw. I wish I had it. I just want to see my boy again. I just miss him so much. I can't.
Give me one of those lights, will you? One for mine, one for me. Excuse them. Excuse them.
Such difficult topics to witness, and also, you know, it's a continual cycle that a lot of people in America are dealing with, as well as some other places across the world. That was a story about Kobe Heisler. Kobe Heisler was a young man, like 21 or 23, I believe, killed by police on a mental wellness check, and they were specifically Brooklyn Center police officers. So if you want to know more about his story and his mother, we do have some posts on our website, unicornriot.ninja, with some more coverage from that day. We were live in the streets on that day, and so you can check that out at our website. I'm going to show you all our Twitter feed. Definitely check out our Twitter. Alex is over there providing a lot of details to the happenings of the trial so far. So again, thank you all for tuning in. I'm going to read off a quick few updates. Give me a moment. So from my understanding, there's one seat in the courtroom for each family. George Floyd's family and one seat for the Chauvin family. And up till today, excuse me, nobody has taken that seat in George Floyd's family. Derek Chauvin's family. So nobody has taken that seat of Derek Chauvin's family, the one that's labeled for them. They had actually moved the seat out of the way, but somebody's in that seat today. This is the first time, and I'm not sure who it is. The seat was brought back into the courtroom, according to Adrian Florido from the NPR. Adrian Florido. And sorry if I'm mispronouncing his name. It had been removed since nobody had shown up, obviously, and so somebody's there today. There's no description on specifically who that person is. Give me a second, and I'm trying to look up a little bit more. Possibly somebody from the court is saying it could be Derek Chauvin's ex-wife that is sitting in his seat. The other pool reporter is seemingly Holly Bailey from the Washington Post. So check out their feeds on Twitter or something. Possibly you can find more information about that. But from what I'm seeing in the pool reports, which we will try to summarize for you again, we will try to get these up on our website, a summary of some of the pool reports and some of the reactions from the poolers, or from the jury, because they're watching the jury. And I'm trying to read if anything else is up here. Yeah, so Holly Bailey says the Chauvin seat is filled for the first time since March 8th by a woman who appears to be of Asian descent. And it seems like possibly if that woman is of Asian descent and his ex-wife is of Asian descent, possibly his ex-wife is sitting there in the stand, or excuse me, in the courtroom in Derek Chauvin's seat. So that could be the first time and pretty much a new development that hadn't happened. Going into what we saw when the court started, when it went a little bit, dark on us. Basically, I'm going to read a summary of what happened. Cahill said that, okay, so they brought in one juror. It was a white woman. She came in and she sat at the witness stand. The judge addressed her. She seemed nervous and remained so throughout the whole exchange. These are not exact quotes, but this is sort of a summary. Again, you are looking at the live feed from the court, so if they come back on, you will see them and you will hear them. Their audio is also on, and we're paying attention to both of that while we're reading. So Cahill said that they had some concerns and that they wanted to go over and see what the story is. Then Cahill asked, have you had any outside information about what's going on in the trial, like other attorneys that have not appeared on TV? Have you seen anyone? The juror said, I did turn on the TV and saw a lawyer. I didn't know who she was. I turned it off. Cahill, do you know what channel it was on? Juror, no. I turned the TV on to watch a show I record. I noticed the courtroom, saw the lawyer, and turned it off. Cahill, do you remember what she looked like? Juror, she had dark hair. Cahill, do you have an indication from family members about what's going on in the trial? Juror said no. Anything from your mother-in-law texting? Cahill said. Juror said, my mother-in-law texted me and said it looked like a bad day for the defense. Cahill said, no book deals in the works? The juror said, no, I don't know what to expect. Cahill said, these are unique times. This is unique jury service. So we have to check out what we've heard. Anything else we should know about? Contact from the outside in? The juror said no, and if anyone approached me, I would report it. The judge thanked and excused the juror, and then she left. The Cahill to the lawyers asked if there was any motions based on that. Slisher said, not for now, Your Honor, but I think it would be good to make a record of her demeanor. The judge cut him off, seeming to suggest now is not the time to do that. And the judge said, there is a report there might have been some outside media. I find that she was genuinely surprised. There was not inappropriate conduct by her or from anyone on the outside. And then he called for the full jury to come in. And then he left, and then they entered, and then he returned. So that was the morning happenings. This was the pool report by Adrian Florido from NPR. That I was reading, and again, we'll try to get some of this summarized onto our website at unicornriot.ninja. But if you missed what I said, I basically just read line for line what Adrian Florido said, which was not specifically the quotes from each person. It was their note writing, and then they said the quotes below are not exact quotes. They're as close as I could capture them. So everything we read was from that. So two developments. It seemed like this juror, a white woman, unsure which juror number she is, was basically asked what's going on with some kind of rumor, and it seemed like the judge knew that her mother-in-law texted her. So that's very interesting. I'm going to read a little bit more from Adrian Florido. He said, Chauvin is accompanied by a woman. Chauvin So, yeah, okay. So Derek Chauvin is a free man. Derek Chauvin's been a free man since October 7th, 2010, or 2020. So coming up on 7 months. And Derek Chauvin was cash bonded. He was bailed out. His wife at the time actually divorced him and then moved to Florida, from my understanding. There's other charges like tax evasion out on Derek Chauvin. A lot of people have been saying, well, if he doesn't get caught on these murder charges or manslaughter charges, the feds will probably get him on the tax charges. Who knows? But Derek Chauvin's wife had divorced him and moved to Florida. From my understanding, I don't know his life, but that's from my understanding. Supposedly, Chauvin walked into court with a woman. The woman took a seat in the seat reserved for the family representative of Derek Chauvin, and he gestured for her to take that seat there.
Thomas, just a reminder, you're still under oath.
Back to
Thank
court.
you.
Mr. Blackwell.
Thank you, Your Honor. Dr. Thomas, I want to briefly go back to Exhibit 918 that we discussed, and then we're going to resume our discussion on homicide after that. Just to clarify for the jurors what these various classifications are. If we talk about natural, you discussed that with us. As
Yes.
An example of a natural manner of death would be, for example, a heart attack.
Yes.
If we talk about an accidental cause of death, where would drug overdose fit in general as a cause of death?
Usually drug overdoses are accidental unless there's evidence of intent, in which case it would be suicidal.
So we know what suicide is.
Yes.
And undetermined. If the medical examiner can't tell which of these it is or what it is, then undetermined is what you would indicate.
Exactly.
So if the manner of death here has been determined to be homicide, does that, in your opinion as a medical examiner, rule out a death by accidental drug overdose?
Yes.
Now, Brett, let's go back to Exhibit 952. That's admitted for demonstrative purposes. So, Doctor, we were talking about the designation of homicide.
Yes.
And tell us what this guide is as relates to how we define homicide as medical examiners.
Homicide is defined in its most broad sense as death at the hands of another. And it goes into more detail if we wanted to look at that.
Yes. So if, but this is guidance given from the National Association of Medical Examiners to medical examiners.
Exactly.
And it provides guidance and guidelines on how to designate a manner of death as homicide.
Yes.
So Brett, if we could go to the next slide. So Doctor, could you read this in for the record?
Homicide occurs when death results from a volitional act committed by another person to cause fear, harm, or death. Intent to cause death is a common element, but is not required for classification as homicide, more below. It is to be emphasized that the classification of homicide for the purposes of death certification is a neutral term and neither indicates nor implies criminal intent, which remains a determination within the province of legal processes.
And you agree with this?
Absolutely.
It's a guideline you follow?
Yes.
And have you followed this kind of a guideline for the years you've been a medical examiner?
Yes.
Is there more guidance given from the National Association of Medical Examiner guidelines on what constitutes voluntary acts?
Yes.
If you could click one more, Brett. And so, Dr. Thomas, could you read this for us?
In general, if a person's death results at the hands of another who committed a harmful volitional act directed at the victim, the death may be considered a homicide from the death investigation standpoint. And then, although there may not have been intent to kill the victim died because of the harmful intentional volitional act committed by another person. Thus, the manner of death may be classified as homicide because of the intentional or volitional act, not because there was an intent to kill.
And when you agree with the conclusion that Dr. Baker reached of homicide, is this the definition of homicide that you're applying that we saw in these two slides?
Yes.
Thank you, Dr. Thomas. Now I want to ask you about a new subject, and this has to do with certain studies that assess whether the prone restraint is dangerous from a breathing point of view. And I'd like to get your perspective as a forensic pathologist and a medical examiner in this respect. Are you aware of any such studies?
Yes.
Do you agree generally with the research that comes to a conclusion that the prone restraint is not dangerous for respiration?
In certain laboratory safe settings, that may be true, but I do not agree with their applicability to real life situations.
If you could generally characterize for the jurors, what's the punchline of these studies? What do they show?
Well, they purport to show that putting someone in a prone position, even with some restraint and with weight on their back, is perfectly safe.
And do you find the studies to be reliable, or do you find them controversial?
Well, I think they are fine for laboratory purposes, but they bear no resemblance to real-world situations. So I would say they're irrelevant for purposes of what we're talking about here.
And so how do they then not relate to the real world? What's artificial about them?
Well, I would say for starters, these are volunteers who have agreed to be put in this dangerous position of a prone restraint. But they know perfectly well at any point, if they feel scared or uncomfortable, all they have to do is say, stop. And that has happened in some of these studies, that a couple of the volunteers have said, wait, no, I can't tolerate being in this position, it's too scary. So that, to me, immediately takes out that whole element that we were talking about the terror, the physiologic stress. So that's number one. Number two is they're healthy volunteers. These are young people who have, mostly young people, mostly healthy, who have agreed to be part of this study. So it doesn't relate to someone who may have other underlying factors that may contribute. Thirdly, they're put on like a gymnastics mat to be face down. So it's completely different when you're squished between a person and a hard ground versus having a evenly distributed weight on your back and you're on a mat. Fourth, I guess, and perhaps most significantly here, none of them went on and on and on beyond the point where the person stopped breathing and where their heart stopped. So they were being monitored the whole time, and if at any point they had significant respiratory or cardiac difficulties, the study would have stopped, and the person volunteering knew that. So to me, it bears no resemblance to what Mr. Floyd experienced.
Did any of the studies involve a knee on the neck of any of the volunteers?
No.
Any of them go on for as long as 9 minutes and 29 seconds?
No.
Do you know if any of the studies actually measured the decrease in lung volumes as part of the study, that is, decrease in oxygen reserves?
Not that I know of. No.
So any relevance to George Floyd at all?
Not in my opinion, no.
So, Dr. Thomas, have you done any calculations or kind of work of your own to measure what the subdual and the restraint with the knee on the neck and the back of George Floyd would have done to his oxygen reserves or lung capacities?
No, that would be something I would completely defer to a pulmonary doctor to address.
So then are you able to tell the ladies and gentlemen of the jury, if you haven't done that work, whether the forces that Mr. Floyd was subjected to would have even killed a normal, healthy person?
In the way you phrased that, not based on lung volume and that kind of study. I mean, from watching the video, I certainly wouldn't want to be in that position, but that's a different answer.
Thank you, Dr. Thomas. No further questions.
Mr. Nelson.
You don't want.
Morning, Dr. Thomas.
Morning.
How are you today?
Good, thank you.
Nice to see you. You described being a forensic pathologist as sort of being the doctor's doctor, right?
General pathologist is considered that, yes.
Right. And the forensic pathologist, in terms of a death investigation, you kind of have to wear many hats, right?
Yes.
You have to have a broad familiarity with multiple medical conditions, right?
Yes.
And sometimes medical conditions may appear at autopsy that you've never seen before.
Yes.
Right? Some strange disease that you've never seen, right?
Yes.
And you will speak to other doctors, right?
Yes.
You will gather information and share that. They'll share information with you to help you make conclusions in an autopsy, right?
Yes.
And you also described how being a medical examiner is more than just the autopsy, right?
Yes.
The autopsy is one small part of a death investigation, right?
Yes.
You described reviewing videotapes in certain circumstances, right?
Yes.
Past medical records, right?
Yes.
Interviews with friends, family members, people who knew the decedent, right?
Yes.
And ultimately, the medical examiner's office compiles a massive, amount of information itself about the cause and manner of death, right?
Yes.
And you've had an opportunity to review a lot of that information in this case, correct?
Yes.
Now, have you reviewed all of the interviews of witnesses?
Probably not all of them, no.
Okay. Have you, after you prepared your report, have you been provided with additional materials that may be relevant to your considerations?
Not that I can think of off the top of my head.
Okay. And we'll come back to that. So I just kind of want to, but you did have an opportunity to review Dr. Baker's entire file.
Yes.
Right? And I believe we'll be hearing from Dr. Baker later this morning or this afternoon, but we'll have some questions for him. I would like to follow up on some of your conclusions. There's a term used in Dr. Baker's autopsy, the cause of death, the term complicating.
Yes.
Can you define, medically speaking, what the term complicating means?
Oh, I guess it could be used in lots of different ways. The way I would think of it in this setting is both things were present, that there was a cardiopulmonary arrest and that it was due to law enforcement, subdual restraint, and compression. I guess that's how I would consider it in this setting.
Have you been provided with any information about Dr. Baker's opinions in this case?
Nothing very specific. I mean, just what he put in the autopsy report and all of his conclusions.
So in terms of the word complicating, it's capable of different definitions based upon the forensic pathologist, right?
Yes.
Right. And so you, as a forensic pathologist, may have a different interpretation of what complicating means compared to Dr. Baker, for example.
Yes.
And there's a reasonable degree of disagreement amongst, in any case generally, it's reasonable for doctors to disagree with each other, is it not?
That sometimes happens, yes.
All right. You did not perform the actual autopsy of Mr. Floyd, correct?
Correct.
And that was Dr. Baker who did that, right?
Yes.
And you know Dr. Baker well?
Yes.
And you know him to be a competent medical examiner?
Yes.
Right. He's the chief medical examiner for Hennepin County at this time?
Yes.
Now, you were provided again with all of the information from his report, and I would like to go through a few of the things with you. Let's talk about Mr. Floyd's heart first. Okay. What was the size of Mr. Floyd's heart as measured at autopsy?
The weight of Mr. Floyd's heart was 540 grams.
Okay. And would you explain, or would you describe that as an enlarged heart?
I would say it's a slightly enlarged heart, yes.
Okay. And there are some different measures of how to base an enlarged heart, or how to determine if a heart is enlarged, right?
Right. By some categories, that heart would not be considered enlarged.
So there's two, as I understand it, two different kind of primary measurements, or primary ways of comparing Mr. Floyd's heart to determine if it's enlarged, right? The Molina studies and the Northwestern studies.
Oh, I see. There's probably multiple ways of looking at heart weights. I mean, those are two of them. There's the study from the Mayo Clinic. There's one in Europe. There's lots of ways of analyzing.
But ultimately, based on all of your information, you would agree that Mr. Floyd's heart was slightly enlarged, right?
Yes.
In terms of the DeMaio and Molina standard, what would a normal male heart weigh for a person similar to Mr. Floyd?
Oh, I don't know off the top of my head.
Would you disagree if I said it was 383 grams?
That well could be.
Okay.
For the average, I mean.
For the average, right.
Yeah.
So, according to, if that were the average heart rate, or heart size, excuse me, heart weight, 383 grams, relevant to Mr. Floyd's heart would be considered profoundly enlarged.
Well, the thing about using averages in especially medicine, which is of course what I'm most familiar with, is we don't generally just compare it to an average. We usually compare it to an average plus or minus 2 standard deviations. So that's why the range that I usually use is, from 253 to 510 grams would be the range of normal for someone of Mr. Floyd's height. And so I don't know in the DeMaio Molina study what their 2 standard deviations would be. Okay. But I wouldn't use just the average.
Okay, and so in terms of how you would assess the weight or size of the heart, you would say 510 grams is the high, 510 grams is the high end?
Right.
Of that, and 540 exceeds that, right?
Right.
And so in terms of whether it's a very enlarged heart or even a relatively minimally enlarged heart, a larger heart requires more blood, right?
Yes, it has greater demand, yes.
What are some of the things that cause a person to have an enlarged heart?
Probably the primary cause is high blood pressure.
And you understand, based on Mr. Floyd's medical records, that he did in fact have a history of high blood pressure, correct?
Yes.
Can you describe the blood vessels of the heart?
There are several major coronary arteries that, as I mentioned, supply blood and nutrients to the heart muscle. There's the left and right, and then the left branches into the left anterior descending and the left circumflex, and then there's some other branches off that.
And how would you describe narrowing or stenosis of the coronary arteries?
So the way we as forensic pathologists describe it is we look at the opening. So if an opening is fully open, then that would be 0% narrowing. And if it's completely closed, then that would be 100% occluded. And so then we look at anything ranging from, 25, 50, 75, 90%. Obviously, it's just an eyeball estimation. We don't actually get out calipers and measure because the actual percentage doesn't really matter. It's more, did they have coronary artery disease? Was it pretty good, pretty bad? That sort of thing.
Can you describe the difference between proximal and distal narrowing?
The way the coronary arteries supply blood to the heart, they come off of the aorta, which is the main vessel that takes blood from the heart to the rest of the body. And so in close to the aorta is called proximal to the aorta, and then the further out it goes distributing blood along the way to the heart muscle is called distal.
And when you have proximal narrowing, how does that affect the heart?
It can narrow the blood supply to more of the heart than if you have distal narrowing.
Another way of saying that would be it decreases the amount of blood the heart is getting, right?
Yes.
And it also affects how things are removed from the heart, right? Like CO2, carbon dioxide.
Well, that's different. That wouldn't happen from the blood vessels coming in, I don't think. So I wouldn't include carbon dioxide in that.
Is there a standard within forensic pathology where pathologists would consider to be that there's enough of a narrowing to cause sudden death?
So the way I would describe that is anything over more than 70 to 75% is, in the view of a forensic pathologist, something that, in the absence of another cause of death, could be used to explain death. Now, it's also true that people live with 100% occlusion and go on and do fine. So you have to understand this is strictly my perspective as a forensic pathologist, and everyone I see is dead. So that's kind of a different perspective.
Can you explain what myocyte necrosis is?
The myocyte is the name of the heart muscle cell. So cyte means cell, it's C-Y-T-E, and myo means muscle. So when you have a heart myocyte, it's the heart muscle cell, and necrosis means death. So if you see myocyte necrosis, that means there are dead heart muscle cells.
And do you have to have myocyte necrosis to cause sudden death?
No, you don't have to have myocyte necrosis.
Okay. And would you say that hypoxia is the absence of oxygen, agreed?
Yes.
And can hypoxia of the heart cause sudden death by other means?
Hypoxia means low oxygen, sorry. And your question is, can low oxygen to the heart cause sudden death through an arrhythmia, I presume? Yes.
Okay. What would you, how would you describe the conduction system of the heart?
The way the heart beats, the lub-dub, is that there are electrical currents that go through the heart muscle. And normally there's a certain sequence in which the heart muscles will fire. And That's called the conduction system through which the electrical impulses flow. And that's what keeps the heart beating in a regular rhythm, that beat, beat, beat. And yeah, that's the conduction system.
So what happens if the conduction system is impaired?
Then you can get what's called an arrhythmia, or abnormal beating of the heart.
And that can result in sudden death?
It can, yes.
Which artery supplies that kind of like that pacemaker of the heart?
Oh, it probably is variable from person to person. I mean, I think the coronary artery that we consider the most important usually is the left anterior descending coronary artery, but there's a lot of individual variability.
Can you, what about the right coronary artery?
It really depends on any given person, which part of the heart is supplied by their particular distribution.
Okay. And in Mr. Floyd's autopsy, the right coronary artery, Dr. Baker determined had a 90% occlusion, correct?
90% narrowing, yes.
When someone is exerting themselves, does that make the heart work harder?
Yes.
Does that mean that more blood, oxygen, it needs more blood to function? The heart needs more blood to function at that time?
Yes.
It's kind of like when we think about exerting anything like jogging, running, the heart needs more blood and hence more oxygen in order to function properly, right?
Yes.
You also described the fight or flight kind of the physiology of that in your consideration, right?
Yes, the physiological stress. Mm-hmm.
And the physiological stress produces adrenaline, right?
Yes.
And that also causes the heart to work harder?
Yes.
And therefore need more blood?
Yes.
And more oxygen?
Yes.
So let me ask you this. In this particular case, right, we have a heart that is at least above average, right, needing more blood. We have a heart with a occluded right coronary artery, right? Narrowed.
Mm-hmm.
We have a heart that the left anterior descending artery also had a 75% narrowing, right?
Yes.
And so you have, and then you have an exertion of stress producing adrenaline, right?
Yes.
So the heart has to work very, very hard in this case. Fair to
Yes.
say? Let's take the police out of this, and I'm going to ask you a hypothetical. Let's assume you found Mr. Floyd dead in his residence, no police involvement, no drugs, right? The only thing you found would be these facts about his heart. What would you conclude to be the cause of death?
In that very narrow set of circumstances, I would probably conclude that the cause of death was his heart disease.
So have you, as a forensic pathologist, ever certified a death due to arteriosclerotic cardiovascular disease?
Probably thousands of times, yes.
With similar degrees of narrowing of the arteries?
Yes.
Have you ever certified a death due to hypertensive cardiomegaly? I'm trying to...
Yes, hypertensive cardiovascular disease, yes, absolutely.
With a heart at this weight or even smaller?
Well, if it was, again, in this setting where that was the only abnormal finding, then I would probably go with that, yes.
So one of the things that has to be considered in this particular case is Mr. Floyd's heart, right?
Yes.
And even without any sort of an exertion, again, take the exertion out of it, take the police out of it, take the drugs out of it, that's a potential cause of death that needs to be considered.
Yes.
Now, you discussed the abrasions that you saw and the jury saw pictures of. You would agree that the abrasions are in a left to right pattern?
Meaning there are more on the left than on the right?
Right.
On his face, yes. On his shoulder, yes. And then he had the abrasions on his right hand.
And even in terms of the pattern of the abrasion, there's up and down like an abrasion could go from the bottom of my body up, or it could go from left to right, right?
Yes. I guess I didn't really focus on what direction the abrasions were going in that sense.
Okay, and that's fine. But you would agree that one possible way that at least some of these abrasions occurred would be when Mr. Floyd was initially put down on the ground.
I guess they could, yes.
Right. And not all of those abrasions necessarily occurred while Mr. Floyd was in the prone position, right?
That's hard to answer,
right.
I would say.
It's hard to answer when the abrasions were there and
right.
what caused the abrasions, right?
Right.
And if someone was being held down with the weight of 3 people, would you expect those to be more punctile in their nature, or abrade, like with the lines and movements?
Oh gosh, there are too many variables there, I would say.
Okay. Now, you ultimately determined that this case was an asphyxiation, essentially, right?
Yes, that was the primary mechanism.
Right. And asphyxiation is simply the lack of oxygen to the brain?
Yeah, low oxygen, inadequate oxygen.
Inadequate oxygen to the brain specifically.
Yes.
And in terms of asphyxiation, you would agree that there are multiple things that can cause asphyxiation.
Yes.
So you use the reference to someone being strangled, right?
Yes.
So if I came up to you and I strangled, or I strangled a person, put my hands around their neck, there are certain things that you would expect to see, right?
Sometimes you do, yes. And that's great when you do. Right. You don't always, but...
And those would be things like a broken hyoid bone.
Yeah.
Right? The petechial hemorrhaging that you discussed.
Yes.
And in an asphyxia death, there are oftentimes, frequently, those types of signs available, right?
Well, it really depends on the mechanism of asphyxia.
Okay, so let's go back to the mechanisms of asphyxia. You described it. Strangling would be one.
Yeah.
Hanging could be one.
Yes.
Right. You've described positional or mechanical asphyxia.
Those are types, yes.
Yeah. Positional being, based on the position of the body. Mechanical being something, using some sort of a device to asphyxiate someone.
Oh, well, we haven't really talked a lot about positional and mechanical. I mean, there's all kinds of things under both of those that can cause low oxygen.
And one of the things that can cause a low oxygen to the brain is the use of controlled substances, correct?
Well, eventually, yes. Yes.
So someone can ingest a particular type of a controlled substance. That particular substance could affect the diaphragm, right?
It affects some controlled substances affect the ability to breathe, which then decreases the oxygen, which then leads to low oxygen, yes.
Right. And that's essentially what you're saying is that there, in this particular case, as I understand it with my notes, is that essentially what happens is there was some event that happened that resulted in a decrease of oxygen to the brain, and that resulted in death.
Yes.
And that's essentially what asphyxia is generally.
Inadequate oxygen, yes.
Right. Okay. And you were asked a series of questions about some studies in terms of, I think they're called they're out of San Diego. Or
yes, Dr. Chan. And
Dr. Chan's, right. Yep. Are you familiar with the Journal of Forensic and Legal Medicine?
Yes.
Now, you testified that some of the problems with the Chan studies were that they were in laboratory settings. Sorry. Laboratory settings, that they were controlled environments, healthy individuals, etc., right?
Yes.
Are you familiar with the work of Dr. Christine Hall and her paper, Incidence and Outcome of Prone Positioning Following Police Use of Force in a Prospective Consecutive Cohort of Subjects?
Is that the one from Canada?
Yes.
Yes.
And that was essentially an analysis of actual police encounters, correct?
Yes, in Canada.
In Canada, understood. But they actually, that study, they go through and they look at the number of police-citizen interactions, correct?
Yes.
And then from those police-citizen interactions, they further go in to look at how many involved being placed in the prone position or a non-prone position, correct?
Yes.
They consider various actual real-life variables, agreed?
Yeah.
And including drugs, whether drugs were on board, whether the length of time to a certain extent that someone was in the prone position, agreed?
Yes.
And ultimately they analyzed about 3,000 prone positional placements.
Yes.
Out of a total of like 1.1 million police interactions.
Yes.
So 1.1 million police interactions resulting in about 3,000 prone position arrests. That those these are real people, real incidents, right?
Yeah.
And in those 3,000 or so interactions, there were no deaths that occurred.
Isn't that amazing? When you consider that virtually every forensic pathologist in the United States has probably had an officer-involved death like this. How did they, it utterly baffles me, which is why I kept saying Canada, because I think, I don't know what's different, but
I'm going to object at this time as non-responsive. So let me ask you, in terms of hypoxia, can you again define hypoxia?
Low oxygen.
Right. And which organ is more sensitive to the lack of oxygen? The brain. The brain.
Absolutely.
The brain's the most. It needs the most oxygen, right?
Yes.
And that's because it's doing millions of things simultaneously, right? Agreed?
Yes. I'm sure there's lots of reasons metabolically why it needs oxygen.
Right. I think a previous witness testified that it takes about 20% of the body's oxygen supply to function. Right?
That sounds about right, yes.
But the heart also needs oxygen, right?
Yes.
So in terms of the professional standards for determining an asphyxia death, is it true that you have to first exclude all natural and non-natural cases or causes of death?
Well, you can have natural and non-natural causes of low oxygen. So I'm sorry, I guess I don't understand.
Sure. There's a criteria that's established for making a determination of positional asphyxia as a cause of death, right?
Well, I'm not really sure what, I'm sorry, I don't understand that.
Fair enough. Is the prone position in and of itself inherently dangerous?
Not if there are no other factors.
Okay. So the prone position is examined and used in a lot of different settings, right?
Correct.
I mean, even in hospitals, in the treatment of, say, COVID, the prone position is used.
Correct.
And in those circumstances, being in a prone position is not inherently dangerous, right?
Yes.
I mean, chiropractors put people in the prone position, right?
Yes.
Massage therapists put people in the prone position, right?
Yes.
So the prone position, I'm just talking generally
Right.
speaking, no other factors. The prone position in and of itself is not inherently dangerous, right?
Right.
Is the prone position on concrete inherently dangerous?
Again, with no other factors, as long as someone can breathe, no.
Right. I could be laying by the pool in Florida, right?
Right.
On my stomach in the prone position, not inherently dangerous.
Right.
Do you know, or did you take into consideration Mr. Chauvin's weight in your analysis?
Oh, I'm aware of his weight. I would say I took it into some consideration, but it wasn't a major factor one way or the other.
Okay. You reviewed all of the videos, right?
Yes.
And it's fair to say that portions of his weight were placed on Mr. Floyd's body at a different distribution.
Yes.
And ultimately, in terms of the autopsy that Dr. Baker conducted, in terms of the area in the shoulders, the back, and the neck, no bruising was found, right?
Right.
In your experience as a forensic pathologist, if someone is placing a significant amount of weight on a person's area for a prolonged period of time, would you expect to see bruising?
You might or might not. It's so variable.
And you would agree that there are no abrasions or bruising described in the autopsy in the neck area of Mr. Floyd?
Correct.
There's no bleeding into the muscles in his back, right?
Correct.
You would agree that the knee is sort of a pointy or a more protuberant part of the body?
I guess so. It's kind of flat on top because of the patella, but...
Right. And when we talk about the shin bone itself, there's not a lot in between the skin and the shin bone, right?
That is true, yes.
And it's sort of a triangular shape, right?
Yes.
And again, along Mr. Floyd's back, there's no long bruise consistent with a shin bone, right?
Right.
And there's no more circular bruise consistent with a kneecap.
Right.
You've reviewed, obviously, a lot of strangulation type cases in those, in your career?
Yes.
Strangulation with the hands, right?
Primarily manual, but also ligature.
Ligature being like a rope or a phone cord or something.
Exactly.
And in those manual strangulation cases, the pressure that's exerted in that will frequently leave bruises, fingerprint-sized bruises, right?
Frequently, but not always.
And ultimately, what increases the likelihood of seeing a bruise is the amount of force that's applied, right?
You know, I don't know what all the factors are, whether it's fragility of the vessels, whether it's the length of time, whether it's the force, whether it's the location. I think there are lots of variables.
So, yes.
And everyone bruises differently.
So yesterday depends on what medications they may take, right? So yesterday there was an analysis or an analogy to sitting on a church bench and you don't bruise your behind.
And that can feel long.
Would it be different if you're sitting on a church bench with a baseball, for example, underneath your butt?
I really couldn't say.
All right. So in terms of Dr. Baker's autopsy, you would agree that there's really no objective evidence showing any pressure to the back of Mr. Floyd?
There is nothing at the autopsy. That's correct.
Did you find, or did Dr. Baker find hypoxic changes in his brain?
He died too quickly for that to show up.
And that's when we talk about the lack of ischemic hypoxia, correct? Dr. Baker noted a lack of ischemic hypoxia.
I don't remember his exact words. You're describing lack of ischemic changes in the neurons?
Correct.
Yes.
In the brain.
Yes, because that has to happen over a period of time.
Okay. And when someone is experiencing that shortness of oxygen or that lack of oxygen to the brain, that will frequently lead to certain symptoms, right?
Yes.
Confusion is one.
That could be, yes.
Restlessness.
Could be, yes.
Shortness of breath.
Could be.
Visual changes.
Could be. Mm-hmm.
Incoherent speaking.
Could be.
So, to your knowledge, did Mr. Floyd, in the videos that you observed, ever complain of these any visual changes?
No.
Did he appear to be confused to you?
So what time period are we talking about? Sorry.
Sure, that helps. Maybe if we narrow down that time. The 9 minutes, during the 9 minutes that Mr. Floyd was restrained, did he appear confused to you?
Oh, gosh. How do you describe his behavior?
Well, I mean, did he was articulating that he was in pain, right?
Yes, and then he couldn't breathe, and he calls for his mother, and he says he loves people. I mean, you might interpret that as confusion, or you might interpret it a different way.
Did he appear to be breathing during this time frame?
Not effectively.
Do you know how many breaths per minute?
No.
If one expert indicated it was at a rate of 22 breaths per minute, would you disagree?
I would have no way of assessing that.
When someone is hypoxic, they start breathing faster, right?
That can be a mechanism of trying to balance.
At least for the first 5 minutes or so, Mr. Floyd was talking, right?
Well, again...
In talking, yes or no? He was talking.
He was, yes. There were words, yes.
So he had an open airway?
Yes.
And you'd agree that, or would you agree that at some point he went limp?
Yes.
Right? And would you describe what you saw as the progression of hypoxia in that instance at the point he goes limp?
That is certainly a good explanation for it, yes.
Was not a sudden hypoxic event, right?
That is my interpretation, yes.
You would agree that if he was progressively growing hypoxic, you would expect whole body hypoxia? I'll rephrase my question.
Yeah, sorry.
I'm not a doctor, so I have to rely on my notes quite a bit. So if he was progressively suffering from whole body hypoxia, the brain would be the first thing that would show signs of hypoxia.
Oh, I see. Yes, yes, the brain is the most sensitive.
And you would agree that that would not occur in a matter of seconds, but it would take a matter of minutes, right?
Correct.
And asphyxia due to position or compression, that prevents air from getting into the lungs, right?
Yes.
And that leads to what we would call a global hypoxia.
We haven't really used that word global.
Whole body.
I mean, if there's inadequate oxygen, the blood flows everywhere, so I guess that's what you're talking about.
But the brain is the first thing to show symptoms of hypoxia.
Right, that's the most sensitive organ.
And in this particular case, where you have a 90% stenosis of the right coronary artery, that's going to be limiting oxygen to the heart, right?
Yes.
And he has a big heart, right?
Yes.
Needs more blood.
Yes.
And adrenaline speeds up the heart.
Yes.
Methamphetamine speeds up the heart.
It can, yes.
So methamphetamine and adrenaline cause the heart to work harder.
Yes.
And increases the heart's oxygen needs.
Yes.
And at what point does the stenosis in the left and right coronary arteries become critical and cause the heart to stop? Generally.
Oh. Are you asking that same question about, as a forensic pathologist, what degree of narrowing do we consider potentially fatal?
Right.
70, 75% and above.
Now, in terms of drug use, right, you obviously were aware, based on the toxicology, that Mr. Floyd had certain drugs in his system, right?
Yes.
And so when we say on board, that means in the system.
Yes.
Okay. Would you describe the use as you know, based on the information that you have, as sort of a binge use of drugs?
Oh, I guess I couldn't answer that.
Are you familiar with drug use taken or used rectally?
I've heard of that, yes.
And that increases or speeds up the distribution of controlled substances in a person?
It speeds up absorption, yes.
Okay. So the effects would be felt much faster?
Yes, they could. Mm-hmm.
In a case where you have a person who is experiencing cardiac arrest, right? And they're put in an ambulance and taken to the hospital for resuscitation. There's IVs that are placed in a person, right?
Yes.
And those IVs contain saline.
Yes.
And saline can ultimately dilute or decrease, to some degree, the amount of controlled substances that would be as they would be measured.
That's a theoretical possibility.
You'd agree that fentanyl is a respiratory depressant, right?
Yes.
It slows breathing and lowers oxygen in the blood.
Yes.
Does the fact that there's norfentanyl in his blood mean that he took it some time ago?
Yes, but by some time, that's a very vague, yeah.
So long enough in the past to start metabolizing.
Exactly, exactly.
But does it exclude him taking fentanyl more acutely or more recently in time?
No. There's no way really of knowing the timing.
Fentanyl depressing the respiratory system can also act with the coronary artery or can interact with coronary vessel disease, correct?
Can you clarify that?
Sure.
I'm sorry.
Does fentanyl's depression of the respiratory system also act with coronary artery vessel disease and oxygen and carbon dioxide to reduce the supply of its supply to the heart?
Oh, so as fentanyl may lead to a gradual progression of slowing breathing and ultimately decrease the oxygen, that would apply to oxygen to the brain as well as to the heart. Is that what you're, yeah.
And it would likewise increase the carbon dioxide in the blood.
Yeah, I mean, anything that decreases respiration decreases that exchange.
Right. Mm-hmm. So as that exchange process is happening, right, you're not taking in the oxygen, you're likewise not expelling the carbon dioxide, right?
Right.
And thus the carbon dioxide will increase because you're not expelling it, right?
Correct.
You would agree that methamphetamine is a stimulant, right?
Correct.
And that can cause a cardiac arrhythmia?
It can.
And it can increase a person's heart rate?
It can or cannot.
And you testified before that methamphetamine, there's no safe level of methamphetamine, right?
Correct.
So the fact that methamphetamine is at a lower toxicological standard doesn't somehow make it safe.
Right.
It doesn't exclude the possibility that it could increase the heart rate.
It could or not.
In terms of the evidence in this case, were you made aware that drugs were found in the backseat of the squad car?
Yes.
And that those drugs contained the DNA of Mr. Floyd?
Yes.
And that those drugs were at least to some degree partially dissolved?
Yes.
And that those drugs were fentanyl, a mixture of fentanyl and methamphetamine?
Yes.
Based on the toxicology in this case, did you see any metabolic byproduct of methamphetamine?
No.
Right. And so that means that the methamphetamine was taken more acutely or recently in time?
Probably. I mean, there's lots of variables.
So again, just kind of taking into consideration removing certain variables, right? You find a person at home, no struggle with the police, right? And the person doesn't have a heart problem, but you find fentanyl and methamphetamine in this person's system at the levels that they are at. Would you certify this as an overdose?
Again, in the absence of any of these other realities, yes, I could consider that to be an overdose.
And the level of fentanyl in a person, again, in this hypothetical scenario, there are deaths certified as drug overdoses significantly lower than 11 nanograms per milliliter.
Lower, higher, it's got a huge range, yes.
As low, I believe, as 3% or 3 nanograms per milliliter.
Yes.
Right. So the ingestion of drugs is unique to that individual's body, right?
Right.
Your Honor, I have no further questions.
Ms. Blackwell.
Dr. Thomas, a few things I'd like to try to clarify with you.
Thank you.
You were asked a number of questions that were to the effect that if we take the police subdual, restraint, and neck compression out of this, what would you conclude Mr. Floyd's cause of death to be? Remember those questions?
Oh, yes.
Aren't those questions a lot like asking Mrs. Lincoln, if we take John Wilkes Booth out of this, may I finish? It's my analogy.
That's argumentative.
Dr. Thomas, if we put the police subdual, compression, and neck compression into this, restraint and neck compression into this, what was the cause, the manner of death for Mr. George Floyd?
The cause of death was the law enforcement subdual, restraint, and compression, and the manner of death is homicide.
Does it make any sense to you whatsoever from the standpoint of trying to assess cause and manner of death for Mr. Floyd to be answering questions having to do with hypothetically taking the facts of this case out relating to his subdual, restraint, and neck compression?
You can finish the question.
Dr. Thomas, from your standpoint as a forensic pathologist and your analysis of manner and cause of death, would you ever approach an assessment of manner and cause of death by taking out of it the facts that you found relevant and highly pertinent to assessing and determining the manner and cause of death?
No.
And in this case, those factors are what?
The law enforcement subdual, restraint, and compression.
And you were asked questions again about fentanyl and meth. Remember those questions?
Yes.
Do you know what quantity of meth was even involved or found in Mr. Floyd's bloodstream?
I have the number.
Well, let me ask you a question.
But it was very small. I mean, I do know that.
And so this was the point. You found that it was a very small amount.
Correct.
Were you able to assess, based on the amount, what kind of effect, if at all, it would have on the stress or strain on his heart?
No. There's too much individual variability to correlate one number with one person's reaction.
Well, let's see with respect to fentanyl, if there's a punchline we can get to with respect to fentanyl. Fentanyl has been discussed with you, Dr. Thomas, as a respiratory either depressant or suppressant.
Yes.
In order for us to go from fentanyl to death, in the middle, there are certain symptoms and responses and reactions a person would have who's suffering from fentanyl overdose or intoxication.
Yes.
If the person doesn't have those symptoms, those indicators, then would you feel that it's possible even to conclude that they are suffering from fentanyl intoxication or overdose?
No. If there's no signs of fentanyl overdose, then it makes no sense to conclude that there was an overdose from fentanyl.
And to be clear for the ladies and gentlemen of the jury, what are those symptoms of fentanyl overdose or intoxication?
So fentanyl is an opioid. It's like morphine or heroin, and it causes slowing. Well, first of all, it's a potent pain medication and given mostly for that, but it also can cause slowing of the respiratory rate in a very gradual, peaceful, non-struggle kind of way. What is described as people just fall asleep and may just kind of slump gradually over because they very peacefully stop breathing, or it slows and then eventually stops.
And they fall into a sleep out of which they can't even be aroused.
Correct.
Would that be also known as a coma?
Yes, ultimately it's a coma.
When George Floyd was on the ground for the 9 minutes and 29 seconds, Was he asleep to the point of not being able to be aroused?
Not for the first half of it, no. And then afterwards, he was completely unresponsive, but that's a different.
For the second half, he was unresponsive with no pulse.
Exactly.
Was George Floyd, during the 9 minutes and 29 seconds, ever in a coma that you saw?
No.
So when we talk about fentanyl overdose, did you ever see, as applied to George Floyd, during the 9 minutes and 29 seconds, did you ever see, as relates to fentanyl overdose, during the 9 minutes and 29 seconds, that he was on the ground enduring the subdual and restraint by Mr. Chauvin, that he ever exhibited any of the symptoms of fentanyl intoxication?
No.
You asked, again, quite a few questions about the heart. And remember that discussion?
Yes.
I think it was to the effect the heart was slightly enlarged, high blood pressure, narrowing of the coronary arteries, dead heart muscle cells. Do you recall all of that being discussed? Yes. In order for us to go from there being issues with damage to the heart to a death from damage to the heart, in the middle, do we have to have certain cardiac events that then lead to death?
Yes.
Would you tell the ladies and gentlemen of the jury, if we're going to talk about heart conditions, what are those conditions in the middle that actually lead to death?
Well, what ultimately leads to death is an arrhythmia, an abnormal beating of the heart. And as I described, it's generally it's often called a sudden cardiac arrest because it's sudden and someone just drops over.
Now, to be clear, when we're talking about these various heart conditions and a sudden cardiac arrest, a fatal arrhythmia, did you see any indication with all this discussion about heart conditions that Mr. Floyd ever suffered from a sudden fatal cardiac arrhythmia as the primary cause of death?
No.
Was there any evidence that Mr. Floyd suffered from a heart attack?
No.
If you bring to mind what was found during the autopsy, was there any injury found to Mr. Floyd's heart whatsoever?
No.
So if we talk about, for example, dead heart muscle cells, any dead heart muscle cells seen on autopsy?
Not that Dr. Baker described and not that I saw, no.
In fact, his heart was so ordinary in terms of non-injury that it wasn't even photographed intact, was it?
Not intact, no. Dr. Baker took one photo that showed no scars and no acute injury.
Now, you were asked about certain studies out of Canada.
Yes.
On the prone position.
Yes.
And now, and the findings out of Canada, supposedly with real police and real police settings, was no fatalities.
Yes.
Are you familiar with any such studies reaching that conclusion in the United States of America?
No.
What is so peculiar then about Canada that we're talking about Canadian studies here?
That's what I don't understand. I found that study and I just thought, I don't know how to interpret this because it's so contrary to the actual experience of forensic pathologists in the United States.
Now, you ask questions about whether the prone position is safe to lay on your stomach.
Yes.
Are you familiar with whether or not laying in the prone position automatically brings about a reduction in the oxygen reserves somewhere in the neighborhood of 20 to 24%?
I am not aware of that, but I would defer to a clinician.
Perhaps a pulmonologist?
That would be the best, yes.
I think you were, in fact, asked a question about laying by the pool on my stomach in Florida.
Yes.
George Floyd was not laying by the pool on his stomach in Florida, was he?
No.
I know the answer to this, but I'll ask you. You asked a question about sitting on a church bench with a baseball under your butt. You've never done that.
No.
Now, you were asked questions about symptoms of damage to the brain.
Yes.
And whether there was any evidence of damage to Mr. Floyd's brain.
Yes.
Would you tell the ladies and gentlemen of the jury whether the fact that you observed an anoxic seizure in Mr. Floyd, was that evidence of damage to the brain?
So yes, what happens in the brain is when there's inadequate oxygen, it reacts by causing this anoxic reaction or seizure that we've described. If someone then goes on and essentially is brain dead, but their heart can be restarted and they're kept alive for, say, a day, and then they die, then you will see changes in the brain. But in a case like Mr. Floyd, where he died during this period of time and his heart was never able to be restarted, that is not enough time for the brain cells to show any kind of reaction that you could see at autopsy.
Thank you, Dr. Thomas. No further questions.
Any further?
Yes, very good.
Dr. Thomas, after the heart stops, if a heart stops, is it possible that the body will continue to breathe or respire?
Yes, I suppose it could in some circumstances.
And that continued respiration after the heart stops could be a matter of a minute or two, correct?
I suppose that could happen.
And you would agree that methamphetamine also further constricts the arteries, right?
It can do that.
And so that constriction, there's been a lot of discussion about the level of methamphetamine in the system, this low level as it's been described, right? You said there's no safe level, agreed?
Yes.
Would you, as a physician, prescribe methamphetamine to a person who has a 90% or 75% occlusion to his or her heart?
Objection, Your Honor, beyond the scope and relevance.
You may answer it if you have an opinion in that regard.
Yeah, I don't have an opinion. I'm sorry.
Okay, no further questions.
Great. Thank you, Dr. Thomas. You're excused. Members of the jury will take our lunch recess. We'll reconvene at 1:30.
Thank you all for continuing to follow our live stream from the Derek Chauvin trial. What you saw today so far was the expert witness, Dr. Lindsay Thomas, in her direct examination, cross, redirect, and recross. And you saw a lot of sort of sparring, it seemed, that Nelson was trying to do. there was a lot of interesting happenings, in my opinion. So what we are going to do, excuse me 1 second while I grab some notes. I'm going to update you all from the pool reporting earlier today, as we were mentioning some of it. If you all are still here before you leave off for lunch break, I will try to run off of some of this information, and then we will be back also at 1:30 for the continuing of the live stream. We'll probably stay up this whole time, Unicorn Riot will, and we'll probably throw on a couple videos for you all. In the meantime, give you a quick update as to what's happened today inside the courtroom from the jury, from the pool reporters. Again, this is Nico from Unicorn Riot. Alex has been tweeting on the Twitter feed. Check that out if you want to catch up on the happenings inside court. In the meantime, as I said, I'll give you a quick update. As we were mentioning earlier, there is somebody sitting in Derek Chauvin's seat for the first time since the trial has started, and that person appears to be a woman of Asian descent, and some people are questioning if it's his ex-wife. I will read off a quick thing. This is from a pool report by Holly Bailey from the Washington Post, and basically she says that at 9:10, deputies returned the empty seat designated for the Chauvin family member, and at 9:10, Chauvin came into the courtroom with Amy Voss, the defense attorney who's part of the defense team, as well as and he ushered a woman into the seat. She appeared to be of Asian descent. She had short, curly black hair cut into a curly bob. She's wearing a black knit wrap, multicolored dress in hues of orange and black, flats, and appears to be wearing a wedding ring. Chauvin took his seat and then stood and turned to the back prosecutor table, where he plugged in his headphones to audio devices being used for sidebar conferences. Then he looked back at Amy Voss as she appeared to give the woman instructions about how to stay off the courtroom camera. As the woman spoke to Voss, Chauvin kept glancing back at the woman. So that's what we know. Possibly Derek Chauvin's wife. I shouldn't be saying ex-wife. I think their divorce was nullified by a judge claiming that it was fabricated, something like that. And I think I even saw something in the chat saying that. So somebody is sitting in Derek Chauvin's seat for the first time. That's interesting because after, I think yesterday was probably the strongest day of the prosecutor's trial so far, with their expert witness, Dr. Tobin, and two other doctors, Dr. Eisenschmidt and Smock. Dr. Smock is a police surgeon in Louisville. And that was interesting. He was talking about how he believes in excited delirium, and a few other things, and he broke down the 10 phases of excited delirium yesterday, and George Floyd exhibited none of those phases, and all those phases, in my opinion, can be questioned, as well as why is excited delirium not in a bunch of the medical registrations. And so it's a questionable practice or a questionable word to describe things in the Western sense of medicine, and seems very racist in its connotations and its creation. The juror was questioned earlier today, before, so when trial came on, they spoke to a juror off the record. That conversation with the juror off the record was revolving around possibly that person getting a text from their mother-in-law asking if, or saying, court looks like it's having a bad day. Let me pull that up real quick for you all. Again, this is according to the pool reports. There's two pool reporters inside the courtroom today. It's Adrian Florido from NPR and Holly Bailey from Washington Post. Again, I'll read off real quick what happened with the extra juror. And the extra juror seems to be, so the juror that they pulled this morning to talk to her. You see Judge Cahill's face. That is a live feed. Their audio is up. So yeah, I just wanted to make sure that I wasn't going to talk over them. Doesn't look like they're doing anything. Lunch is going on till 1:30. So real quick, we have update from the jury. As I was talking about, there was a person who was questioned off to the side. Well, not off to the side, questioned by themselves on the witness stand. A juror number 11, who's a white woman in her 40s or 50s, and she has blonde hair. She is the one who was questioned. Again, there are 14 jurors inside every day. They're off to the right side of the camera. You can't see them. When the expert witnesses or other witnesses are looking off to their left, they're looking at the jury. So just know that. Again, the jury is the people who are deciding this case. So everything sort of depends on them. I'll read you what Adrian Florido said from the interpretations or from the interactions this morning. So once Cahill got the juror in there, she came in and sat down at the witness stand. The judge addressed her. She seemed a bit nervous and remained so throughout the exchange. These following quotes are not the exact quotes, so don't take this as the exact repetition or exact iteration of exactly what happened, but this is a very close capture of what happened. Cahill: we've had some concerns expressed and want to go over and see what the story is. Have you had any outside information about what's going on in the trial? Like other attorneys that have not appeared on TV, have you seen anyone? The juror: I did turn on the TV and saw a lawyer. I didn't know who she was. I turned it off. Do you know what channel it was on? Cahill asked. The juror: no, I turned the TV on to watch a show I record. I noticed the courtroom, saw the lawyer, and turned it off. Cahill: do you remember what she looked like? Juror: she had black hair. Cahill: do you have any indication from family members about what's going on in the trial? Juror: no. Cahill: anything from your mother-in-law texting? Juror: my mother-in-law texted me and said it looked like a bad day for the defense. And now I think there was a correction sent with this for instead. She didn't say a bad day for the defense. Let me find that correction real quick. So the correction was, my mother-in-law texted me and said it looked like a bad day for the defense, is what I just read. But actually, Adrian Florido said she might not have said for the defense. So she definitely said it looked like a bad day in court. So don't worry about the defense part. I'm going to keep going. So that's what Cahill asked. Did you have any mother-in-law texting you? She said, my mother-in-law texted me and said it looked like a bad day. Cahill said, no book deal in the works? He questioned her. No, I don't know what to expect, she said. Cahill: these are unique times. This is unique jury service. So we just have to check out what we've heard. Anything else we should know about? Contact from the outside in? The juror: no, and if anyone approached me, I would report it. The judge thanked her and excused her, and they end up coming back. So Cahill asked the lawyers if there was any motions that they wanted to do based on that interchange, and Schlischer said, not for now, Your Honor, but I think it would be good to make a record of her demeanor. And the judge cut him off, and seeming to suggest now is not the time to do that, and said that there and then the judge said, so as context as to the whole thing, there was a report there might have been some outside media. I find that she was genuinely surprised there was not inappropriate conduct by her or from anyone on the outside. So they squashed it. So that's what happened this morning inside the court at 9:15ish, as you saw. Today I believe that Rodney Floyd is sitting in George Floyd's family's seat, at least for the late morning break. And again, a woman of Asian descent who has a wedding ring on is sitting in the Derek Chauvin seat today. There again, as I was talking about, 14 jurors. In the notes, juror number 4 is definitely the best dressed juror this morning. The report says she's the older black woman. Not exactly sure like which number she was comparatively to the jury selection, but we'll try to get some of that information onto our landing page as much as sort of we can figure out when we have more capacity to do that. Here is our landing page at unicornriot.ninja. First, I'll show you our front page, and you see the graphic up at the top, Derek Chauvin Trial. If you click into that, you will get to the landing page, which brings you more updates. And you see it started for today, the 9th. You see an update from yesterday, and there we are. So I'm gonna bring you back real quick and give you what we're gonna do right now is roll a video, and then I'll come back with more updates. So we have more updates from the pool reports of the jurors, and we want to bring them to you. We want to allow you to have the information that we have. We from my understanding, can't really disseminate it in the way it is, but we will be bringing you more updates very shortly after this video. What we'll do in the meantime, again, this is Nico from Unicorn Riot. Alex was dropping the tweets on the Twitter all day so far. Let me refresh this feed so you can see what the tweets have been looking like. You see the live stream and the top pin to the Twitter, and you see what it looks like there. Basically, it is a long litany of details. In horribly sad news, you see DMX on the right side of the trending has passed. You know, he was in the hospital sort of struggling for the last few days, sort of in a vegetative state, and it means a lot, I think, for a lot of people in the hip-hop world, a lot of people in the 90s, 80s. I mean, if you're an 80s baby and you grew up in the, with the 90s and 2000 hip-hop, you definitely know about DMX. And even in this topic of addiction, and we heard from George Floyd's girlfriend or partner at the time of his death, how they were struggling with an opioid addiction that was based off of pain medication that they were prescribed for certain pains in their body. And we had DMX, who was also sort of an addict and had made a lot of compositions around addiction, and helped a lot of addicts out. The Slippin' and Fallin' song. There's a lot of people who I just wanted to mention that a lot of people who grew a lot of support from his lyrics. So sad day. It's also a very sad day to just be continuing to talk about the death of George Floyd. We're gonna bring it to as we did during the break. It's a little bit larger issue than George Floyd. We don't want to lose focus of George Floyd and the reality of this trial, but we also want to showcase the macro instead of going in so micro at this point. We're gonna bring you outside a little bit. We're going to show you a video. So in 2 days, on Sunday, there's going to be an event at 2 p.m. I believe in St. Paul off of University Ave, and it's going to be a protest for reopening the case of Justin Teigen. Justin Teigen died after a police interaction, and that was in 2010. We heard from Justin Teigen's fiance 2 years ago, and since really for the last few years she's been a steady hand in trying to get support for families who've lost loved ones, as well as bringing police accountability to these crimes or for the victims of police killings. We're going to show you her telling her story. This will be Toshira Garraway telling the story of Justin Teigen. Again, there's a event this Sunday at 2 p.m. commemorating Teigen and calling for the reopening of his case. There will be a march and a rally, and we'll show you this, and we'll come back and we're going to show you 2 other victims of police killings, their stories real quick, and then we're going to bring you more pool notes from the inside of the courtroom. Again, thank you all for tuning in. This is Nico from Unicorn Riot. Thank you, Alex, for tweeting this morning. We will come back after this video. It's about 4 minutes. Thank you all for being respectful on the chats. We got Facebook, we got Twitter, and YouTube. If you want better accessibility, I think Facebook has a little bit better auto-generated captioning. And in the meantime, you all take care of yourselves, and we'll be back in a few minutes with some more information on some of these topics that we're talking about and some of the stories.
After they murder your loved ones, then they come and follow you, harass you when you are the victim. We're only doing what any other human being would do naturally, is try to find out the truth of what happened to your loved one. That's a natural reaction.
Unfortunately, we're all standing here together, but God chose us for some reason. We don't know why, but He knew it was something inside of us that we were strong enough.
My name is Tashira Garraway, and I am the fiance, Justin Tigan. In 2009, Justin was pulled over by the St. Paul police. And during that, we got so many different stories, but at the end of the story, Justin ends up dead. He was beat, murdered, thrown in a trash can, and found out in Inver Grove Heights by the St. Paul Police Department. He ran from the police. They beat him, picked his body up, threw him over in the dumpster. They thought they threw him in the regular garbage, but they had thrown him in a recycling bin. And of course that gets sorted through, so he ended up out in Inver Grove Heights, and he comes through on a flatbed with the rest of the recycling material. So I have pictures of Justin's body just dangling from the Bobcat with blood just pouring out from his head. And so he's laying in his casket where you can see the handcuffs marks on him. You could, when I went to look at his body, he has dog bites all over him. There's a video from Walmart that shows the police. It shows Justin run. It shows the police right where the area where Justin ran, and then the video goes blank. So it's clear that the video has been tampered with. But the video clearly shows that the police was right there in Justin's presence, although they told us they never chased him. Once we hired an attorney, the harassment started. They would sit outside my home where my 3-year-old would just be playing. They'd sit there and watch my kid. That scared me bad. They would sit outside his mother's home where her kids would be playing. Just doing things to keep us quiet, you know, and that's the main thing for them. They want to keep us quiet. And since 2009, I have been quiet, and I'm tired of suffering in silence. When I seen other mothers coming out, that's when I felt safe enough, because for a long time I did not feel safe. I felt that my life was threatened as well, and that they just did everything they could to keep me quiet. You know, I've had family members that's like, just let it go. But that's the problem. We've just been letting it go. There's so many mothers out there suffering because they just been letting it go. And it's time for us to stop just letting it go, and time for us to try to say something. We have to tell our stories. Otherwise, it's like it never happened. And we got to let people know that it's more than Philando Castile. It's more than Jamar Clark. Only by the grace of God that girl was there to record Philando Castile. Otherwise, it'll be the same situation like the rest of us. Swept under the rug, and everybody just moves on like nothing happened. But that's what they want to happen. That's why they harass us. That's why they follow us. They do everything so that our stories don't get out. But it's time for our stories to get out. It's time for us to get heard, and it's time for something to happen. It's time for people to hear us most of all.
So that was the story of Justin Tigan from Toshira Garaway. She now is consistently fighting for police accountability and supporting a lot of families. She's created a group called Family Supporting Families Against Police Violence. And again, there's an event this Sunday at 2 p.m. commemorating and calling for justice and reopening the case of Justin Tigan. Again, thank you all for joining. This is Nico. Thanks, Brett, in the chat, remembering me for narrating the revolution. And thank you all again. This is a troubling topic that we continue to focus on, but is one that's very pertinent and needed to shed light on in the society that we live in. Another story that we're going to bring you over to. Again, we do have more pool notes that we're going to bring up. We'll probably do that. We'll probably give it like another 30 minutes or so, and we'll play a few videos in the meantime. And then we'll get some more pool notes to you all so you can sort of get more of a glimpse of what's happening on the inside of the trial of Derek Chauvin. If you want to have more details of the happenings that you missed today, you can go to ur_ninja at Twitter, and also we are streaming on YouTube. If you go to our Vimeo as well, you will catch a lot of our videos if you're not on YouTube checking it out. So again, thank you all. Again, Alex was doing the tweeting today, and so I'm gonna just show you all real quick. Bam, check that out. ur_ninja. Check out our Twitter feed, and you will see a lot of the details if you missed some things earlier this morning. So what we're going to do is give you another story of another police killing. This isn't to take away from George Floyd. It is to just focus on the larger picture of police accountability off of police killings. There has been one police officer that has been held accountable, convicted for the crime of killing somebody in Minnesota in the last 21 years out of 400 plus officer involved deaths. It doesn't mean those 400 people in Minnesota were shot to death, but they were killed by police interactions or car accidents caused by police officers, or other such thing. Only one officer has been held accountable, that officer being Muhammad Noor, a Somali man, a black Somali man who killed a white woman over southwest Minneapolis in a nice neighborhood. That shook a lot of people up when that happened, and a lot of people were able to see, or not able to see, a lot of people pointed to Noor as what they said was, the person who the state was able to do that to because of the racial bias that the state holds. So again, we bring that up in the context of this trial. Derek Chauvin might be the second one. Who knows? What we see so far in the trial is that the state has been making their case that Chauvin was killed by, that George Floyd was killed by Derek Chauvin's knee, and not what the defense is claiming, that he died from drug overdose, or now maybe their new claim of he had a heart attack or whatever. So when we get into the further stories, we're going to show you the story of Marcus Golden from his aunt. So Marcus Golden was killed a few years back, maybe 2014, I believe. Let me pull up some information for you to just look at while we sit here and talk about it. We talked to Monique Colors Doty, and she is Marcus Golden's aunt, and he again was killed in St. Paul, Minnesota, and she, since his death, has been an outspoken sort of activist and community member, helping a lot of other mothers and whatnot get support and fighting for police accountability. Also, a side note of that is that her sister, so this is Marcus right here, and that's Monique Colors Doty right there. Her sister, who Marcus's mom was a reserve officer in the SPPD. So she was a reserve officer in the St. Paul Police Department. And they never got an apology for justice, as you can see in this first paragraph. And so that's the story on if you're watching this and you're like, oh, I wanna go back to it and learn more information or share it or whatever. Here's Marcus's mom in the left side. Just a very sad story, one of many. And we interviewed the aunt, as you see right there in the picture. That is Monique Cullors-Doty, and if you're local, you definitely probably know who she is. In the meantime, what we're going to do is show you this video. This will be the story of Marcus Golden, who again was killed in 2015 in January in St. Paul. After this, we'll be back for a little bit more and another story, and then we'll give you some pool notes from inside the court. Again, thank you all for joining. This is Nico from Unicorn Riot, and we'll see you in a bit.
Justice! It's really a classic example of how the police will demonize their victims and create a whole new scenario to try and protect the thin blue line in their officers. My nephew is Marcus Golden. He was killed by two St. Paul police officers, Jeremy Dover-Spike and Dan Peck. One of the officers slipped on ice and his gun went off. The other began to shoot, thinking his partner had been shot. The police told many lies and changed the audio accounts of the incident. The representative speaking for the St. Paul Police giving the press conference was Paul Paulos. What he said was that my nephew Marcus tried to run over both of the officers. Then they later changed the account that he tried to run over one of the officers. And that's just one of the many, many lies and fabrications. But what we found out from a witness is that yeah, the officer did slip on ice. Marcus was shot in the back of the head and the back of his arm, and his vehicle was completely shot up. He was behind an apartment building. It was isolated. It was dark. It's a dead end. The officers told the paramedics to park on the street. He was behind the building. It was up a hill. They also said send one medic. As friends of ours, we were listening to the radio accounts. We were talking about them, then we saw that they had changed, they had been deleted and re-recorded. My nephew was killed across the street from St. Paul Region's Trauma Center. He was never taken to the hospital. Having the paramedics park on the street in the winter, they said send one medic, which paramedics work in twos because they have to carry equipment as well as push the gurney. That meant one paramedic going up an icy hill, a long icy hill, and go about half a block or so to where my nephew was. That also delayed any type of medical attention he would have received. My nephew was unarmed for 11 hours until Officer Sheila Lambie of the St. Paul Police Department came to my parents' home and retrieved a gun he legally owned. In the midst of all the inconsistencies, what they said was there was some trash on the bottom of the passenger side of the floor, which is why it took them so long to find the gun. 11 hours to find a gun on the floor of a passenger seat. So that's a bit of what happened in my nephew's case.
The man that was killed last Wednesday was my brother Marcus. He was a good man. He was there for me every time when I needed him. And right now, I'm currently going to school for law enforcement to work with the police. And it hurts just because this is the city that I want to work for. And now that this happened, it's hard. It's hard for me.
My sister, Marcus's mother, she was a volunteer officer with the St. Paul Police Department for 22 years, and she was a reserve sergeant for 7 of those years. So she knew the police chief, Chief Smith, quite well, and they lied on her in the report. 3 of them got together and said that my sister told them Marcus always wanted to kill a cop. They just wrote lies. And what happens when the police write lies in their reports, it makes it difficult for the families to secure help in terms of getting some type of justice, because it's very difficult to prove in a court case because people believe the police in what they're saying.
There's a day where we won't march no more, and while my sister ain't equal and my brothers can't breathe, marching hand in hand with my family, we will fill these streets. Come on.
I am Marcus Ryan, Kelly Golden's mother. And I'm hurt, and I'm torn apart, confused. Just makes everything so difficult. My son that spoke earlier, I'm so proud of him for still wanting to continue on with law enforcement. He's almost done. My older son, one of his degrees was in criminal justice. And my affiliation for the last 20 years with the St. Paul Police Department. My son Marcus, beautiful, handsome, tall, strong, soft-spoken, good-hearted.
This is a testament to why we cannot push community relations with the police. We cannot push trusting the police. We so often hear about we need to build trust. We cannot trust the police because when they know someone, what they do is they take information to use against them. That's the purpose that the police have of trying to know who is in the community and what they're doing. They just want to get information or extract information from you to harm somebody else. People have been so trained to believe that the police are actually here to protect and serve when that is not true. The police are here to maintain the status quo. The police are here to protect property, to protect the wealthy and corporate interests. And America is a corporation. This is why America is not doing anything at a legislative level nationally to stop police brutality, to stop police executions or otherwise homicides, because capitalism needs the police. And as long as America is a capitalist society, money will always be put before people, profits will always be put before the environment, and we will continue to struggle, and there will continue to be a wealthy upper class that will continue to prosper, and there'll be less and less for us, not in terms of less justice only, less provision, and less of everything that we need as a greater society to be prosperous.
Blue street, our street! Blue street, our street!
So people wonder why we're doing this. It's because you will ignore us if we don't. Ignore us.
So there were a lot of protests that surrounded my nephew's execution. Black Lives Matter Minneapolis reached out to my family, and we met with them, and they dedicated the MLK Reclaim the Day March to my nephew. There were about 2,000 people that came out. We marched in St. Paul from Snelling University down to the Capitol, where they hosted a beautiful candle vigil for my nephew. It was so powerful and so supportive that really, gave me the strength to stand up and we got to keep this going. Black Lives Matter St. Paul really gave me some legs to stand on, and we could really have some more protests. And the first one we did was we protested at the State Fair. We had about 900 people. It was a very powerful action in response, because I thought, I would go to the State Fair with my nephew pretty much every year. And I thought, what a great place to bring the message that Black Lives Matter to people from, the 5-state region, and even from people internationally who are coming to the State Fair. So it was a means where we began to really grow and meet people and connect with other people when we continue to come together. Then with Jamar Clark being killed, with Phil Quinn being killed, we had a community where we could come together, support them. We're doing vigils and protests, shutting things down, disrupting traffic continually. We've done a lot here. So since that time, I have been working not only for my nephew, but for other families of stolen lives, to help them celebrate the lives of their loved ones, as well as seek justice and keep their names alive in the streets. So the work that I do is to encourage people to help them live and survive through the trauma of the police brutality, the execution, the lies, the media reports that are false, and all the criticisms and the critiques and the things that people will say online, which are very harmful and hurtful as well. So it's really about helping people rise above the trauma and really to be able to maneuver and survive in a new way of life, knowing that their loved ones are not forgotten and that there's a community of people that is able and willing to support them and help them. A major component that would change the deadly use of force by police is holding police accountable. Once police understand that, yes, if you do this, you will go to prison, then that will stop right there. If police know that they're not going to have the support of their brothers in blue, then that will also help. If they know that they will not be allowed to sit on paid leave for 2 years, as we've seen here, if they know that they can no longer work for another police department, that their police career is over after they wrongfully kill someone, then that will change things also. When police begin to understand that they'll be held accountable for their actions, then that will change it. But without accountability, there will be no change. And aside from accountability, officers should give a statement immediately after they've killed someone. A video recorded, legal, sworn statement. They should not have days to collaborate with lawyers and other schemers to try and come up with a story. These are the things that when these things change, we will see officers change how they're doing their work. And anyone who is aware of any wrongdoing from another officer, they should be held accountable as well for not bringing that forward. But what happens now, there's not protection for officers, and we have seen officers that either lose their job, they've even been killed. So the officers who break that blue line, they need protection from their own, because they're killers and they're deadly, and they will turn their back on their fellow officers just like they turned their back on my sister, and for them it can be deadly.
And I just want the state of Minnesota, the whole nation, to know that my son, I want everyone to remember him for the good person that he was in the short time of only 24 years. Please remember my son is a good-hearted person, a caring, a loving human being. He's so beautiful, so beautiful.
That was the story of Marcus Golden from Monique Colors Doty, and also Monique's thoughts on how to have change happen, how to not have over 1,000 people die from police interactions or from being killed by police every year, over 1,000 throughout the country, and have such low rates of accountability. She said once police start to be held accountable, then accountability will start to, or then change will happen. So you also heard just the story of some of the things her family went through, and some of the things that she mentioned that of Marcus's story. Again, if you want more information about Marcus Golden or to watch that again, check it out here. It was actually a lot of that footage from that first MLK Day was before Unicorn Riot was incorporated. So long ago, 6 years ago, and that's the story of Marcus Golden, people coming out to support her family and to call for justice for him. He was 24 years old. So again, this trial is about George Floyd, but just want to bring you all into the larger picture as well. We're going to do that again with another story, and this story is going to be another longer, maybe it's about 10 minutes, 9 minutes. So just like last one was about 11 minutes, this one's 9 minutes, and then we'll come back possibly show another video, and then we'll be back with a update from inside the jury, and just to chat about what we've seen so far today and in the trial. The next story is going to be about Isaac Aiden, and Isaac was killed in 2000, and you can hear me typing. I have to pull it up because I didn't pull it up. There's so many names. He was like 2019, but I don't want to say it wrong, you know? Yes, 2019. So Isaac was really young as well, you know, young 20s, college student. He was 23. He was an entrepreneur. Anyways, he was killed by the police in southern suburbs. I'll show you his picture right here. About 2 weeks after he was killed, there was a protest. Excuse me one second, I'm going to pull up a different one. 2 weeks after he was killed, there was a protest at the Eagan City Council, City Hall building, where they had a city council meeting. And during the city council meeting, it sort of just got took over by protesters who were calling for justice for Isaac Aiden. And we talked to his brother and sister after the protest. And this is his sister in the image, Samaya Aiden. And you see this title says that he was another black life stolen, and then you see the title on the image saying that it was a sit down with the siblings. And so that's what we're going to show you. We sat down with two of Isaac's siblings, and we will be showing you the video of what they have to say directly after their brother's death. The killers in his case have not been held accountable. They were all, you know, released with, they weren't released, they were never charged with anything. So just nothing's happened to them as far as accountability. And there was 5 officers involved in his death: Jacob Peterson from Eagan, and then 4 Bloomington officers: Matthew Ryan, Daniel Nelson, Adam Steyer, and Anthony Keel. And it was also Bloomington, Burnsville, Eagan, and Edina officers that were involved. So we'll bring you over to this, we'll show you this, we'll come back. And again, thank you all for joining. This is Nico from Unicorn Riot. This is the story of Isaac Aiden, as told by his brother and sister very shortly after he was killed. His brother Denny was on the scene, not able to see him because the police had the area cordoned off. It was a standoff for a few hours, and the police ended up killing him. So again, thank you for tuning in. Thank you, Alex, for doing the tweets. We have YouTube, Facebook, and Twitter going on, and we're gonna run this clip, come back with some more, one more video probably, and some more discussion.
Isaac's life matters! Isaac's life matters! Isaac's life matters! Isaac's life matters! Isaac's life matters!
I've never had panic attacks prior to this. I can't sleep every single night. I wake up and I just hear, I've never seen my little brother break down like that. And to hear him say, hear those gunshots and say, they killed him, they really killed him, and just see him break down like that. I currently live in Los Angeles, California. I got a phone call and that there was a standoff going on with the police with my brother involved, and I was just kind of freaking out. I called every single family member and I called him. His friend found the address of the location of the standoff, and he was there, and we were FaceTiming throughout the whole situation.
I was at the scene, and just based off what I heard, no human being could survive the amount of gunshots that I heard. And I just immediately knew then and there that it was over for my brother. So I followed the ambulance to Regents Hospital, and that's basically, I was the first point of contact for all family members. So that's how the rest of the family discovered what happened.
What do we want? Justice! When do we want it? Now! What do we want? Justice! When do we want it? Now! What do we want? Justice! No peace! Prosecute the police!
Isaac was just a very genuine person. He was currently going to school at the University of Minnesota, and he was studying IT and infrastructure.
Isaac to me was my oldest brother. He cared a lot, not only about his family, but also his friends and his community. He was very selfless. He loved to do things for others, and he was just naturally talented at whatever he did. His intersectionality really, he used that to his advantage and really brought all of his identities together to unite everyone. He was amazing. I truly do wholeheartedly believe that my brother embodied what it meant to be a good person. That's the only way I can describe Isaac. He's amazing.
He was one semester shy of graduating, so this fall was supposed to be his graduation. Isaac was just someone who's very unique. He held a full-time position at Spire. He also went to school full-time. He also, on the side, we started a business last year. So he was managing all those things at once. And Isaac was just a very creative person. He loved art. He loved what all of us like to do, which is travel. So Isaac was just a very relatable person, and just, it's been hard. Today, we honestly had a good turnout. So prior to this protest that we had today, we've made multiple attempts to communicate with Egan to ask them to release any information. We've went to the BCA multiple times. We basically did every single thing we could. And the next best thing that we decided to do was a protest. Our voice needed to be heard.
The police act as an apparatus to reinforce class structure in our society. They protect the upwardly middle class and affluent portions of our society. They carry out the business of the 1%. They're the largest gang organization in the United States of America. They have more blood on their hands. I cannot stand for the flag. Call the Dakota County attorney. Submit the evidence.
Yes,
we want the police
prosecuted.
We are here and move.
Put the pigs away.
Up to the front of the meeting because you want to be heard and we want to listen.
We want justice.
I can't say too much about the exact incident, but what I can say is I was at the scene when everything happened. At this time, what the BCA and everything is disclosing is they had 90 officers against my brother. So they called 9 regions. They had a SWAT team, armored vehicles. And to me, that's just excessive because there's no reason to have that many amount of officers.
As you guys know, the names of the 5 officers who killed my brother have been released. As my sister mentioned, 2 of the officers who were involved had prior incidents where their use of deadly force was justified. Anthony Keel was a Bloomington officer who killed a 24-year-old male, January 15th, 2015. He was let off the hook, and now he killed my brother July 2nd, 2019.
Serial killer.
Gunslinger.
Criminal.
Jacob Peterson.
Roll your eyes at them.
Jacob Peterson,
Yeah,
who works
don't
for
roll
Egan.
your eyes.
Jacob Peterson, who works for Egan Police Department, fatally shot Zachary Primo, a 26-year-old male, June 11th, 2013 in Duluth, Minnesota. Zachary was laying face down on the ground with his gun underneath his chest. And his mother and neighbors witnessed the shooting and heard Peterson, the officer, yelling, "I'm going to kill you, Zach." And this is the Egan police officer who also shot my son, my
Serial killer.
Putting officers who have a previous past of being involved in fatal shootings at the front line of a situation that sensitive tells you what kind of mindset they had going into this.
Egan is not above the law. 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 Bloomington is not above the law.
Number 1, release all of the video and all of the evidence that led to the killing of this young man.
Under the Minnesota Government Data Practices Act 13.82 subdivision 15, you have the right as the originating agency of that data to release that data.
Number two, as you can see, this community, we are not going anywhere.
No.
If you thought somehow this is a one-time off, we're not. We believe in justice, not for ourselves. We believe in justice for Isaac, but we also believe in justice for your children.
That's right.
And we would be here for them if they were gunned down by police officers.
We are hurting as a community.
Police are not killing dogs, they are not killing cats, they are killing black person. It's easy to kill the black person. That is not acceptable. We want justice.
That shows you that we are all hurting. The Somali community is hurting. The Muslim community is hurting. The black community is hurting. All of us are hurting.
They know that the system is protecting them, and then when they go to the court, they get not guilty.
What justice looks like in the case of my brother, at least, is having those officers who shot my brother and used deadly force behind bars. I cannot stress that enough. We don't have a death penalty in Minnesota, so the fact that officers are able to just kill people and get away with it and be put on paid administrative leave. The 5 officers that are put on paid administrative leave, I'm basically funding them since I pay taxes and I work. So I'm basically financially supporting the people who shot my brother. So if it was up to me, I would make sure that their leave wasn't paid. And at the end of all this, I just honestly want them prosecuted and behind bars.
I would like the officers put behind bars. They're not first-time offenders. They've already done this before, and they've done it again to my brother. And God knows who they'll do it to next. We shouldn't be living in fear of the police, the people that we pay to serve and protect us. It's frightening, especially being black in America. We're shot and killed in the street at a disproportionate rate, and it's not okay.
Isaac went to the University of Minnesota. He was just a kid. He was leading his sister, his brother back there, and another brother of his in the way that life should be lived. They don't have parents over here. They don't have mom and a dad. Their grandma raised them. The community raised them. We are their brothers. We are their sisters. We are their family. We are their community. Okay? Exactly. And we came up together. Isaac was our leader, and we want justice for him, and we want justice for his family, and we want it yesterday, not tomorrow.
You saw a story told of Isaac Aiden's last day by his brother and sister, and also talking about a protest that happened at the Eagan City Council and video from that. There's been numerous protests that have happened after that as well. We've documented quite a few of them. If you go to our website and go to, or just type in Unicorn Riot and Isaac Aiden, ISAKADEN, you can find out more. There's also, let me bring you here. There's also a post that we did last year talking about the 1-year anniversary for Isaac Aiden, Isaac. And you see in this title, Negotiator in Aiden's 2019 standoff pushes protesters at 2020 March. So that happened. Go to our website, check that out if you want to see that video and the breakdown of what happened, because Officer Mosing was one of the specific negotiator in before Isaac Aiden was killed. He was not the specific person who ordered the murder, basically the action, but if you go into here, there's a lot of information. We also covered multiple other stories. If you look at these hyperlinks, the shooting by police after standoff deemed justified, that actually goes over all of the case file from the attorney's office of the Dakota County attorney when they exonerated the officers in killing Isaac Aiden. His family has filed a lawsuit If you want to know more information about him, just look him up on the internet and try to, provide support for their family if that's what you feel like. These are the 5 officers. This is information about the lawsuit. You can read the lawsuit on our website if you go to it. The other officers involved had definitely, like you even heard, had definitely some past in very checkered past, and they had other killings on in their past. And it's just it's a continual thing when you look at a lot of these situations where these officers that have killed before are killing again. And we're going to bring you over to give me 1 second. I'm putting this timer back up here so you can see how much time is left before trial starts. But as you see this Maxim Yakovlev. He was a sergeant in Burnsville. He had already shot Map Kong in the back. You heard Denny talking at the council members that saying a minute ago on the recorded video was that Jacob Peterson and another officer had already also killed other people. Quincy Rindell was killed by Keel, I think Anthony Keel, excuse me, and Zachary Primo was killed by Jacob Peterson. And so when I'm bringing you back to George Floyd, when we were out in the streets, maybe the 2nd or 3rd day of the happenings, I think it was the morning of May 28th, before the precinct got ransacked by the community. We walked into a conversation, we saw Daniel Davenport from basically, I can't remember the acronym, but we end up, you'll see it in the video, but he speaks about seeking police accountability, coming from another place. I think he was in Atlanta or somewhere out east, and just jumping on the plane to get out to Minneapolis after George Floyd was killed, because he's working with legislators and other folks to try to bring police accountability bills to the legislation in different states and federally. He also talks about Oscar Grant's family and Uncle Bobby, who's also been pushing for a lot of the accountability when it comes to police. Oscar Grant was killed in Oakland. So we're going to show that, and then we'll be back with some court notes, and then trial should be started again. So we'll go to May 28th, Southside. Ooh, you see the court moving around? Okay, so you see that's a live angle. We're keeping an eye on it. What they're doing is they're just making sure their pan is set. Like, that's an automatic pan. I'm not sure the technical words, but yeah, that what you just saw there, they're not in court. Their audio is still on. When they get in court, and if they start talking and the video is still playing for whatever reason, which I do not think it will, you will know that they're talking because their audio is on. So just a heads up. Again, thank you all on Facebook, Twitter, and YouTube. Thank you for being respectful inside the chats as well. We're going to roll this video of Daniel Davenport talking about, if police kill once, they'll likely kill again. And this is in response again to the video we just played, Isaac Aiden, where 2 officers had already killed others, and actually 3 officers involved had killed others. Yakov actually didn't shoot Aiden, but he was part of the team that created the idea to shoot him. Derek Chauvin had also killed again. Killed before. He killed Wayne Reyes, I think in 2006, an indigenous man, and he's also been involved in the death of 3 others. So Derek Chauvin, who's on trial today for killing George Floyd, has killed 1 other specifically, that was Wayne Reyes, and 3 other people in interactions. So again, there's a science, there's a thought process to killing once, you will likely kill again. Daniel Davenport talks about that, and police accountability 3 days after George Floyd was killed. We're bringing you that video, and thank you again for tuning in. This is Nico from Unicorn Riot, and we'll see you in a minute.
I came all the way up from Atlanta to tell you this mission. It's embarrassing. All y'all embarrassing the whole nation. Why you should have went? You should have went and locked your boy up. You should have locked him up. You should have locked him up. Why you didn't lock him up? Why you didn't lock him up? If you fire him, you know he should be in jail. You know that. You know that. Y'all know you don't train nobody like that, man. And I ain't out here stunting, so my message done. Good job. You know, it's just a lot of pain, man. You know, I do civil rights, you know what I mean? I'm the Georgia chairman for National Association of Equal Justice America. I'm working the case right now for Ahmaud Arbery. In a couple hours, I gotta be on the phone with the FBI. You know what I mean? It hurt. We don't even got enough people trained to, black people dying every day. We don't even got enough civil rights leaders to respond to all this stuff all over. I'm still with this, I'm in Georgia, we in Brunswick, I gotta catch a flight. Same clothes, man, I ain't even shower. I gotta catch a flight, same clothes, just to come up here and tell them what they know. They went through training, they don't know you don't put nobody's knee on nobody like that, but they think they think people ain't gonna call them out. How you gonna fire somebody and not arrest him? It's just pain, man. This original sin is racism. Like, yo, I appreciate everybody. Like, when we start calling each other out, when we stop this blue shield stuff, when we stop that and we call it out, our nation gonna be better. Like, look at this, man. All this is embarrassing. This is messing up the economy. But when you back people on the wall, they try to make a point. They trying to say, yo, we don't like dying. Because at the end of the day, Floyd could have been me. You know what I mean? It could have been you, it could have been you, it could have been you. Because at the end of the day, regardless of the fact that this Black Lives Matter, yeah, we gotta respect that 100%. But the police is just police state rogue. They killing people of all colors. You know what I mean? We still got it because slavery and human trafficking is real. I'm still gonna rock with Black Lives Matter all day long. But these dudes is straight police state. They will kill a dude regardless of their color. And they get away with it. The police accountability numbers is low. You know what I mean? So that's just me. You know what I mean? I did the lobbying with Oscar Grant's parents. We passed the AB 392 in California. It's one of the strictest use of force laws in the nation. You know what I mean? So we're going to be trying to probably do something up here, increase the law and the training on the state level.
Can you just expound upon that a little bit?
Well, first of all, I gotta give all blessings to Uncle Bobby, you know, Aunt BX, California Families United for Justice, you know what I mean? And Families United for Justice, you know what I mean? They doing great things, you know what I mean? If whoever listening, if you got an issue with police accountability, you know what I mean? You gotta look up Uncle Bobby. He the greatest in the nation at it, right? So when we come in, young dudes, we coming in and we mad because there was a little loss, the policy had to be watered down. He been in that thing since his nephew died, and he teach us, you know what I mean? So our only thing, the law is the law, you know, it's passed what is passed. We didn't get everything we wanted on it, we got some stuff, you know what I mean? And they basically say it makes the use of force policy in the United States of America equal with international law. But that's only in California. Now we try and take that to the federal level and kick it out. But people ain't even doing work in the federal level. So now you got to spread the knowledge, and this basically you take AB 392, copy and paste it, clone it, edit it a little bit, and you get some lobbyists who know what lobbying is, and they push it out here in where we at, Minnesota? Yep. I don't even know where I'm at. I'm just boom. Okay.
Has it worked in California?
It's too early to say.
Okay, yep.
That was less than too early, 2 years ago. So you got to get the data to say. You know what I mean? Too early to say. But look, all this stuff is patterns. When I got to come down here because I can't even believe the fucking news no more. So I'm like, I ain't even, everybody, oh, you going, don't tell me nothing because I got to go find real people who know this dude. Oh, yeah, people telling me real stories. Yeah, oh yeah, he let me in the club, this and that. I gotta get it first here, then I go. I ain't even seen the video. I just came to find out what real people think about it, what the real story is, you know what I mean? And the thing is, soon as they tell me this, soon as they tell me that the same cop that murdered him killed somebody else, we in Oakland looking at data like that. So when I'm telling state legislators that this is stupid that you don't got a law yet where when you fatally shoot somebody, yo, I get it that it's your livelihood at stake, but we got too many good ideas of how to give somebody another job, but they don't PTSD is real. If you kill one dude, you know what I mean? You likely, the data show you likely to kill somebody. So it's just sad that we come here, we already knew this. We knew this in Oakland, that most of the killings come from people that kill twice, right? If you kill once, you're gonna kill again as a police officer. So it's sad because we gotta take this energy and then we gotta eventually put policy in place where it's like, oh, you killed one person, here you go. You go do security without a gun. You know what I mean? I can't, I'm a two-way fan, so let me clarify. I can't talk, I'm not saying that you can't have your personal hammer on you, you know what I mean? But you can't take that sort of employment no more because you already showed yourself unfaithful. Last thing, man, I go all around the nation. You go to London, the way people police here in America is stupid. I talk to people, London police officers, they say, you know what? We train to tell people what not to do. We literally look at police film to see what not to do. You feel like I'm in London and I'm talking to the dude, me and my girl, I'm talking to the dude, I'm about to go in my pocket. I said, look, I'm just going in my pocket to get my cell phone. He laughed. He said, we ain't that jumpy around here.
So that was Daniel Davenport. To go back to Isaac Aiden real quick, Aiden did, there was a weapon that Aiden had. I'm only answering this to a comment that I saw. I don't see all the comments, but I see a comment that's refuting the facts that Aiden was killed. Well, not refuting the facts that he was killed, but essentially what happened with Aiden is he was cornered into a corner, shot at by snipers and killed by snipers. He was sitting on the ground talking on the phone to the police officer, and he was 12 to 18 feet away from the gun that he had, and the officer was on the phone with him, and they shot flashbangs at him, and he tried to grab the gun and run away. That's essentially what the family has said, and what you can see in the video, and they killed him at that instant when the negotiations were still ongoing. And as people always point out, had he not been Black American, Somali American, or Somali American, he would not be in that position. They had numerous standoffs with numerous other folks that were white in the southern suburbs where they lived. Anyways, back to the jury pool real quick. We have some more information. So as we were talking about the jury, the pool reporters, Chauvin's ex-wife possibly being in the seat of Chauvin's family, and we have a little bit more to report on that. So and also, just to go back real quick, I'm sorry to just cut back to it and come back to it, but we do have a bunch of more information. There's like much more to the story on Isaac Aiden than you can just talk about in a half a minute. Again, his family has pressed a lawsuit. In that lawsuit, has filed a lawsuit. In that lawsuit, it has all of the interactions that they felt were pertinent to reasons why he was basically assassinated. You can read that. Everything in there seems to match up specifically with what happened from the county side as well. If you read their reports, it just, the county side didn't include all of the details that Aiden's family's lawyers included. Anyways, that's filed. Back to this, they're usually a little bit late coming back from lunch, but we're here. The audio's on. We're looking at a live feed. Thank you all for tuning in. This is Nico from Unicorn Riot. We have Alex doing the tweets. We're going to bring you a quick update from the court. After the jury left the room for lunch, it just went on lunch, the lawyers mingled for a bit, including some conversation between the prosecution and the defense. Now you have to wonder, these are all people in the courtroom. They have to talk to each other at some point, and they probably have been talking to each other. And so, yes, they have been talking to each other. Here's another side note that I was thinking is that because you saw all the objections happening on both sides continuously from the start of the trial up until the medical examiners or up until the medical professionals, there has not been much objections. And really, they've been letting the other person go in questioning. You saw so many, like, what possibly people were talking about absurd questions numerous times from Nelson, and they weren't getting objections. And so they must have some kind of deal where they're allowing each other to just continue to ask those questions, or it's the judge is like, yo, you have to just allow this. We don't want to have objections every now and then, or every question. And so just think about that. There has to be obviously conversations with them. And so here's a pool report from Adrian Florido, NPR. It said that the lawyers mingled for a bit, including some conversation between the prosecution and the defense. As they waited for Nelson to finish his conversation with the prosecution, Chauvin made eye contact with his family representative, and then he walked over to her. Again, this is possibly his ex-wife. We do not know. There's a person of Asian descent, a woman with a wedding ring on, and I shouldn't say ex-wife. I don't think that they ever really got their divorce clarified in court. So they stood by the door together. At one point, Jerry Blackwell crossed in front of Chauvin, smiled and nodded at him. Chauvin gave a simple nod. So that's very interesting to just see some of the background of what's happening on that end. Try to give you a little bit more update. No, we won't. We're back at court.
Mr. Blackwell.
Thank you, Your Honor. For our next witness, the state calls Dr. Andrew Baker.
Raise your right hand, please. Do you swear or affirm under penalty of perjury that the testimony you're about to give will be the truth and nothing but the truth?
I do.
Let's see. And if we could begin by having you state your full name, spelling each of your names.
My full name is Andrew Michael Baker, Andrew Michael Baker.
Mr. Blackwell.
Thank you, Your Honor. Good afternoon, Dr. Baker.
Good afternoon.
You know, first of all, you conducted the autopsy on Mr. George Floyd.
I did.
Before we get into the specifics of the autopsy, why don't we explore your background a bit? You're the Chief Hennepin County Medical Examiner?
That's correct.
And would you tell us what it means to be the Chief Medical Examiner in Hennepin County?
So I've been the Chief Medical Examiner for Hennepin County since 2004. I'm actually the Chief Medical Examiner for Hennepin, Dakota, and Scott counties. My office provides service to all three of those counties, which is about 1.85 million Minnesotans, or about a third of the state, falls within our catchment area. Being the Chief Medical Examiner means that I supervise the rest of the staff, in particular my other physicians. I have 6 other doctors as well as a doctor in training that work under me.
And so before becoming the chief, you were the assistant chief?
Correct.
And that was in roughly 2002?
Correct. I was the assistant chief medical examiner for 2 years.
So all in, it's been going on 19 years as either the assistant chief or the chief?
Correct.
What did you do before joining the Hennepin County Medical Examiner's Office?
Are you asking me to go back to my educational background or just my postgraduate training?
Maybe to the Air Force. To the Air Force?
Oh, prior to coming to Hennepin County from 1998 to 2002, I was a major on active duty in the United States Air Force. I served as a forensic pathologist for the Department of Defense. Our unit was known as the Armed Forces Medical Examiner, and at that time we were headquartered in the Washington, D.C. area.
Are you board certified in any areas?
I am.
Would you tell us which ones?
I am board certified in anatomic and clinical pathology, and I hold subspecialty certification in forensic pathology.
Doctor, would you tell us what the National Association of Medical Examiners is?
Yes, the National Association of Medical Examiners is the professional organization for people who do what I do for a living. I want to say we have about 800 or 900 members. Many of those are fellows like me, meaning they're fully board certified forensic pathologists. We do have a variety of other membership categories as well, for investigators, for administrative personnel, and for other support personnel in the profession.
Now, you are former president of the National Association of Medical Examiners.
Yes, I am.
In fact, at least as of to date, you're the youngest president, or were the youngest president ever to hold that position with the NAME.
I don't actually know that that's true, but I will take your word for it, Counselor. I did not know that.
Yeah, I thought I was just listening to you, Dr. Baker. So, but in any event, you have been the president of NAME.
Yes, I have.
So let's move now to the specific autopsy of Mr. Floyd. Could you give us some sense of what you knew about the circumstances surrounding his death before you started your work on Mr. Floyd?
Yes. So I was aware that Mr. Floyd had become unconscious while in police custody, that he had been transported to Hennepin Healthcare, and that was where he was pronounced dead. I believe at the time I started the examination, my staff was probably still working to confirm Mr. Floyd's identity and properly notify his next of kin. But that was basically the background information that I had.
Had you seen any of the videos at the time you started your work?
I had not. I was aware that at least one video had gone viral on the internet, but I intentionally chose not to look at that until I had examined Mr. Floyd. I did not want to bias my exam by going in with any preconceived notions that might lead me down one pathway or another.
So it was then several days after you'd done your work on the autopsy that you saw the videos?
One video I saw shortly after the autopsy, and that was the one that I think most of the public had seen through Facebook or other social media. The other videos, such as the cup surveillance video and the body-worn camera videos, I did not see until 3 or 4 days after the autopsy.
Could you, Dr. Baker, give us an overview of how it is you conduct autopsies? What's your approach to them?
Sure. So in a case that's believed to be a homicide or a potential homicide, there's a few more steps involved than a typical natural death or an accidental death. We start every exam with a very thorough external examination of the decedent's body in an as-is condition, meaning the medical devices are still in place. If the decedent came in with clothing, that clothing would still be in place on their body. All of those things potentially could be evidence to us as the medical examiners. In many cases, we will also collect trace evidence. For example, if the decedent's fingernails are long enough, we will collect fingernail clippings. We will collect some pulled head hairs as exemplars in case those are needed to match to anything. It wouldn't apply in Mr. Floyd's case, but in other circumstances, we shoot a fair number of x-rays before the autopsy starts if we're looking for things like bullets or stab wounds, broken knife tips, that sort of thing. Once all of those are done, then we very carefully set the clothing aside. We very carefully remove the medical devices, and then we examine the body again from head to toe, front and back. We're documenting this with copious photographs as we go. And then the final step in the external examination is we clean the body very, very thoroughly, because we don't want any blood, any foreign material, any plant material, anything that might be on the body to obscure the injuries or diseases that we're looking for. And then we, again, photograph the body head to toe, front and back. Once that part of the exam is done, then we proceed to the internal exam, which is, I think, what most lay people would think of when they hear the word autopsy. We make a set of very careful incisions on the body that allow us to remove all of the organs one by one, so we can look for evidence of natural disease, internal evidence of injury, and while we're doing that, we're collecting specimens for toxicology. Typically, blood and urine are the ideal specimens. We do remove all of the organs from the tip of the tongue to the bladder. We also remove the brain. We also remove all of the structures from the front of the neck, looking for any injury or evidence of disease. In a case like Mr. Floyd's, there are some additional steps we will take that wouldn't occur in most autopsies. So, for example, in Mr. Floyd's case, I did make incisions of his wrists and dissect around the skin underneath to look for evidence of what we would call subcutaneous bruising, or bruising under the skin from the handcuffs that were applied.
World.
Please continue.
And then the last thing that I was going to say is also in Mr. Floyd's case, I did make a special incision from the back of his head all the way down to his buttocks, and I dissected underneath his skin all the way out to the sides of his neck, all the way out to his shoulders, and all the way out to his flanks. And you might ask why we would do something like that, and the answer is because sometimes fresh bruises can be difficult to see in some people, and so we look underneath the skin to make sure that we haven't missed something. Again, those last few steps wouldn't be part of a typical autopsy, but in circumstances like this, it's a generally accepted practice that we do that.
And Dr. Baker, is the autopsy part of a broader death investigation?
Yes, the autopsy is just one piece of the medical examiner's death investigation.
And could you generally characterize the umbrella? What's the death investigation entail overall?
So the medical examiner's ultimate mission, in addition to properly identifying people, is to ascertain their cause of death and their manner of death. The autopsy is just one component of that. It obviously has a great deal to do to inform the cause of death and manner of death, but we also need to know the decedent's past medical history. We need to get a hold of the decedent's next of kin to see if the decedent could potentially be a donor. If there's any family history that we need to know about, we will typically contact decedent's primary care physicians as well as get their hospital records. If an ambulance was dispatched and took them to the hospital, we'll even get the ambulance run sheet as part of our investigation. Because to get the cause and manner of death right, you need to assemble all of those things for the whole picture.
So let's go back to the autopsy aspect of it. How important is it to have a detailed documentation of what you do?
In terms of the autopsy?
Yes, sir.
Well, it's critically important that the autopsy be very detailed, particularly if the death is potentially a homicide, because obviously it could end up in a court and the work that you're doing would be evidence.
And do you create what we might refer to as a robust data set documenting what you do?
Yes.
What's all included in that?
So when I use the term robust data set, what I really mean is I have dictated the most detailed autopsy report that I can, describing all the scars, all the tattoos, all the birthmarks, all the injuries. In many cases, it's the pertinent negatives, meaning the lack of injury, places where you might expect to see an injury but you don't. All of those things are very carefully dictated in a narrative autopsy report. But that's not enough. You have to take copious photography as well. My goal is to create a set of photos that's so robust that another pathologist could take my set of photos and almost feel like they'd been there for the autopsy. That person has enough data that they could look at my work and reach their own conclusions. They don't have to take my word for it because it's in the photos.
Mm-hmm. And in the case of Mr. George Floyd, that's what you did?
That was certainly my goal, yes.
Your Honor, at this point, I'm going to ask Dr. Baker to identify the photographs from the autopsy. I still have them here in hard copy. May I approach Dr. Baker, Your Honor? Dr. Baker, I've handed you a number of photographs that should have exhibit numbers 186, 235, 185, 236, 187, 188, 189, 190, 191, and 192. I'll represent to you, that's what you have.
Okay.
And if you could just look through the set and just confirm for the record that those are photographs that you took during your autopsy of Mr. George Floyd.
So these are, in fact, autopsy photographs of Mr. Floyd, and they were taken by me.
Thank you, Dr. Baker. I'd like to redistribute them to the jury, Your Honor. So, Dr. Baker, let me just ask you generally first about documented injuries that you saw with respect to Mr. George Floyd, and I'll ask you about specific parts of the body.
Okay.
Did you note any injuries to Mr. Floyd's back?
I did not.
Didn't see any bruises, scrapes, etc.?
Correct.
What about the injuries to Mr. Floyd's face?
Yes, Mr. Floyd had several injuries to his face.
And if you could, Dr. Baker, look at Exhibit 186 and Exhibit 235. Now, I'll represent to you that the jurors have seen these two photos, but first tell us what do we see in these two photos?
These are photographs of the left side of Mr. Floyd's face. This would be after I have removed or cut away any medical intervention. Had there been any blood or foreign material on his body, it was cleaned up before these photographs were taken as well. And these were specifically taken to illustrate the injuries that you see on the corner of his left eyebrow and on his left cheek. You can see the bruising and the abrasion. That's fancy medical lingo for the big scrape on the left side of his forehead, and you can see the scrape or the abrasion on the left side of his cheek. It's very common for abrasions post-mortem to take on that dark black color. After death, the moisture that would be in an abrasion on you or me isn't there anymore, and so they tend to dry out and look a little bit more like this. What you see in the photo.
Mm-hmm. Do you have an opinion as to how Mr. Floyd would have incurred these abrasions?
Well, these would be entirely consistent with the left side of his face being pinned against the asphalt or the road surface that he was on the night before.
In the prone position?
Correct.
If you would, Dr. Baker, look at Exhibit 185.
Got it.
All right. What do we see in Exhibit 185?
This is an overall photograph of Mr. Floyd's face, taken early on in the post-mortem examination. You can see the scale there in the photograph. That's actually in all the photos you have with his case number, and the scale allows you to gauge the size of what you're looking at. This is a photograph I would take in any case so that you can put a face with the decedent's name and the decedent's case number. You can see the injuries that we illustrated in the previous two photos there on the left side of his head and on his left cheek. You can also see a small abrasion on the left side of his forehead. It's kind of that pinpoint thing about an inch above his left eyebrow. You can see a laceration, which is a tearing of the skin on the right side of his upper lip. There's also some subtle bruising of his nose and a couple of small abrasions on the right side of his nose. And I think you can see a few small abrasions under the left corner of his mouth.
And Dr. Baker, what is the tube that we see in his mouth?
The tube in Mr. Floyd's mouth is the endotracheal tube that was put in during the attempt to resuscitate him. We do leave those tubes in place and cut them off before we start the autopsy. That's some quality control that we do for the hospital and the paramedics so that we can confirm the tube was in the right place when we do our exams.
So, Dr. Baker, if you would go to Exhibit 187. What do we see in Exhibit 187?
This is a close-up photograph of Mr. Floyd's right shoulder. Centered in the photograph just above the scale, you can see what I would call an abraded contusion, which is a fancy medical lingo for a bruise that has some scraping superimposed on it.
And Exhibit 188?
Exhibit 188 is a close-up photograph of Mr. Floyd's left shoulder. You can see occupying most of the photograph there is an abrasion, the deep red and slightly less red and pink injury that you see. Again, it looks darker than you might envision this on yourself. Typically these will dry out after death, and that's why it takes that darker appearance.
And is this an injury that is consistent with Mr. Floyd laying prone on asphalt?
Yes.
And let's look at Exhibits 189 and 190. What do we see in Exhibits 189 and 190?
Exhibit 189 is a photograph of the back side of Mr. Floyd's left hand. Exhibit number 190 is a photograph of the back side of Mr. Floyd's right hand. In any case that we think has the potential to be a homicide, we do examine the hands very carefully and we photograph the hands very carefully. Our hands are largely the way that we interact with the world around us, and so injuries on the hands, or sometimes lack thereof, can tell us something about what happened. Specifically in Mr. Floyd's case, you can see a number of scar-like areas on his knuckles on the left and some scattered across the back of his right hand. I don't specifically know what those are from. Those obviously predate the events of his death, and I don't know where those came from. The more acute injuries that you see in the photograph, right above the scale in each picture, you can see kind of a patterned bruise. It almost looks like a tram track, those parallel marks. That's pretty typical for what handcuff marks look like when we see them at autopsy.
And Dr. Baker, Exhibit 191.
Exhibit number 191 is a close-up photograph of the back of the index and third fingers of Mr. Floyd's right hand. You can see that he's got some injuries over his knuckles. Just for orientation, if I were to use my own right hand, we're looking at an injury right here and an injury right here on the back of those two fingers.
And did you have an opinion as to what may be the cause of those injuries?
So these are blunt force injuries. These are abrasions and lacerations. Again, that's damage to the skin from blunt trauma. These would be entirely consistent with him having been in an altercation with another person. They certainly could be from the asphalt or just about anything his hand could have banged into.
Thank you, Dr. Baker, and you can put the photos away. Now I'd like to talk with you for just a moment about your examination of Mr. Floyd's heart.
Okay.
Did you take a photograph of Mr. Floyd's heart still intact?
No, I did not.
Would you tell the jury why not?
I don't normally photograph organs that appear to be perfectly normal unless there's some reason to. I don't have a photograph of Mr. Floyd's spleen or Mr. Floyd's liver either because those were also grossly normal. His heart was enlarged by weight, but that wouldn't really be something you could capture in a photograph unless it were so excessively enlarged that it would be obvious from the picture.
Mm-hmm. And so when we talk about the tissues of the heart, are you able to describe them generally, such as the endocardium, the myocardium, etc.?
Sure.
Would you tell the jurors what those are that you ordinarily look at?
Yeah, so dissecting the heart is one of the most important things we do in every autopsy because the heart is involved in so many of the deaths that we investigate. So the first thing we do is we carefully remove the heart from the lungs. The next thing you do is you carefully make sure that there's no blood or clot left in the heart because you want to get a very accurate weight. It turns out that the weight of the heart is a very good predictor as to whether that heart is normal or not. People who have high blood pressure for a long period of time, their heart will actually get heavier. Just like any muscle that's worked hard, the heart will grow in response to that kind of stress. So we do weigh the heart first. The next thing you typically do is you very carefully dissect the coronary arteries. And when I say carefully dissect, I mean you take a scalpel blade and you cut every 2, 3, 4 millimeters in very fine slices along every one of the coronary arteries. A normal adult heart will generally be described as having 2 coronary arteries, the left and the right. The left immediately branches into the left anterior descending and the left circumflex. So we dissect those two very carefully. And then we look at the right coronary artery. So usually you'll hear people describe 3 coronary arteries, the circumflex, the left anterior, descending, and the right. So we want to make sure those arteries are in the right place. We want to make sure they have normal openings where they connect to the aorta. And then we go tiny slice by tiny slice, making sure that none of those arteries have narrowings or blockages in them. After we've done that, then we typically will carefully slice the heart, meaning the whole organ where we're now cutting through the muscle. And as you're making those slices, what you're looking for is evidence of previous heart damage. Is there a scar in the heart? Is there hemorrhage in the heart, suggesting maybe a more recent heart attack, if you will? There's many more rare conditions of the heart that we're also looking for while we do this. None of those apply in Mr. Floyd's case, but those are always in the back of our minds as we do this. And then the last thing we do is, once we've cut through the muscle of the heart, we open all the valves of the heart generally in the same direction the blood flows. We make sure the valve leaflets are normal, make sure there's no infections, there's no calcifications, there's the normal number of leaflets. So yeah, we've now looked at the outside of the heart, the coronaries, the muscle of the heart, and the valves.
So having done all of that with respect to Mr. Floyd, did you find any previous damage to his heart muscle?
No, Mr. Floyd had no visible or microscopic previous damage to his heart muscle.
You know, and I apologize to you, Dr. Baker, and the jury, but there is one other photograph I do want to look at.
Okay.
So if we could pull out just number 192, which should be the heart valves. So, Dr. Baker, would you tell us what we see in Exhibit 192?
Yes, Exhibit 192 is cross-sections of what I would describe as the worst or the narrowest lesions that I found in Mr. Floyd's coronary arteries. So above about the 3 mark on the ruler, you can see 3 pieces of coronary artery that are fairly close together. The uppermost one in your photograph is what we would call the proximal left anterior descending coronary artery. So that means that's pretty close to the aorta, that's close to the origin of the artery. And in most adults, the left anterior descending is the largest of the 3 coronary arteries. So in this picture, you can see that Mr. Floyd's left anterior descending artery is quite narrowed. I would put that at 75% narrowing. The cut that you see right below that, which is the middle of the 3, that's another section through Mr. Floyd's left anterior descending coronary artery. So you can see that that area of very tight narrowing is still there. Again, I would put that at about 75%. And then the third one you see in that series of 3, the one closest to the ruler, is the first branch off of his left anterior descending coronary artery. That's called the first diagonal branch. That can be a big one in some people. It was pretty good sized in Mr. Floyd's case, but that one is also quite narrowed, as you can see in the photograph. And I should probably back up and explain that when I say narrowed, I mean the yellow plaque that you see eccentrically lining those coronary arteries like a partially clogged plumbing pipe. That's the cholesterol, that's the fibrous tissue, that's the scar that you don't want in your coronary arteries. That's why your doctor checks your cholesterol and asks you not to smoke and tells you to watch your weight and your blood pressure. This is what he or she is trying to prevent, is that plaque buildup. That's the yellow discoloration you see in these arteries. They should be wide open. You should be seeing through a round hole in each of those, but they're pretty severely narrowed. So getting back to the description of the photograph, the 4th cross-section you see, which is more closer to the 1 on the scale, that's Mr. Floyd's right coronary artery. In most adults, that would be the 2nd largest of the 3 coronaries. You can see that one is also significantly narrowed by atherosclerotic plaque as well.
So, Dr. Baker, are you kind of familiar with the concept of acute changes in plaque buildup?
Yes.
Would you tell jurors what that means?
So there are times at autopsy when we can tell that a plaque has suddenly changed because it has fractured. These plaques can actually be kind of hard. That's why this is known as hardening of the coronary arteries. Sometimes these plaques will fracture and you can see clot or fibrin, which is protein from the blood, suddenly filling that plaque. And so the plaque went from being smaller than it used to being bigger than it used to be very, very quickly. Sometimes you can even get hemorrhage into a plaque as it fractures, and so the plaque can grow very quickly. We can see that with the naked eye at autopsy. Sometimes we can see that under the microscope as well. To get to the heart of your question, Counselor, I did not see those changes in Mr. Floyd's coronary arteries. These looked to me to be, I guess you would call them stable plaques, for lack of a better term.
And if they had fractured in some way and created a clot of some kind, would that be observable on autopsy?
Yes, and that's one of the reasons we dissect these arteries so carefully, is you wouldn't want to miss an acute change or a thrombus, because in most cases that would tell you a lot about how the person died.
Mm-hmm. And if there were a thrombus and it affected the heart muscle, what would that look like if you had such an affected heart muscle on autopsy?
If we find a thrombus, which means an acute clot in a coronary artery. If the person dies very, very quickly, which is entirely possible, we won't see anything abnormal in the heart muscle that depends on that coronary artery for its survival. People typically need to survive for hours from their acute cardiac event before we can see any changes in the heart, either under the microscope or with the naked eye. So again, if a person dies very, very quickly from a coronary artery event, we can only infer what happened based on the fact that they have bad coronaries and the circumstances of their death. We wouldn't expect the heart muscle to look abnormal.
And if the heart muscle does show damage from a clot, what does that look like?
So that depends on how long the clot has been there and how long the person has survived. There's a generally good progression of changes that we see very, very early. All you might see under the microscope is some of the heart cells start to look a little bit wavy and abnormal. Shortly after that, they start to take on way more pigment under the microscope than the surrounding heart cells do. They look much brighter to us under the microscope. Then those heart cells start to die, or necrose, as we say in pathology. That necrosis then brings in an inflammatory reaction from the body, and so you see inflammatory cells come and start to clean up those dead heart cells. And then eventually the body will bring in what we call granulation tissue, which is new blood vessels and early scar tissue. And if the person survives long enough, that dead area of heart will just turn into a scar. Dead heart cells, unfortunately, don't grow back, and so once they die, depending on how long the person survives, we'll see anything from those very early changes all the way out to a scar.
But with respect to Mr. Floyd, you didn't see any damage to the heart muscle?
That's correct.
Let's talk about the brain. Did you note any injury or damage to his brain tissues?
I did not. I did not notice any acute injury to his brain in the sense of physical trauma, nor did I note any injury to his brain in the sense of it being deprived of blood or oxygen.
Did you note anything regarding Mr. Floyd's lungs?
Mr. Floyd's lungs were quite edematous, meaning they had a lot of fluid and congestion in them, but other than that, they were generally normal postmortem lungs.
And is it possible to get fluid on the lungs, or edematous lungs, I think you called it, from the efforts to resuscitate Mr. Floyd after he was taken from the scene?
Yes.
And what kinds of fluids could cause that?
Well, basically what we're seeing at autopsy is just called edema fluid, which is a lightly protein-filled fluid that seeps out of the blood into the lungs and fills up the breathing spaces. We see that in people who have had protracted CPR, who've been given lots of fluid. As their heart's not working very well, perhaps not at all during the CPR, they're still getting a lot of fluid put in them in the emergency room, and so we can see that pulmonary edema from that. There's other circumstances in which we see pulmonary edema as well. It's a fairly non-specific finding.
And so in this instance, with respect to Mr. Floyd, you didn't need to take the time to try to understand what was the source of his pulmonary edema?
I don't know that I could pinpoint the source with any accuracy. Again, given that he got CPR, there's multiple potential explanations for his pulmonary edema.
What about the prospect of what's called a pulmonary embolism? What is a pulmonary embolism?
A pulmonary embolism is when you have a clot form in another part of your body. Most commonly it's in the lower legs or the pelvis, although it can form in other places. And that clot breaks off and it goes straight to the lungs because that's where your heart pumps all the blood as it returns from your body. A massive pulmonary embolism can be almost instantaneously fatal, and by massive I mean it blocks the artery coming off the top of the heart that goes to the lungs. Smaller pulmonary emboli can go out into smaller branches of the lungs. Sometimes they're completely asymptomatic, sometimes they're symptomatic, sometimes they can be life-threatening if the person has underlying conditions. We do always look for pulmonary emboli as part of a forensic autopsy.
Did you see any pulmonary emboli in the case of Mr. George Floyd?
No, he did not have any pulmonary emboli.
Dr. Baker, let's talk about the toxicology. Did you seek what's called a toxicology screen in this case?
Yes.
Would you tell the jury what is a toxicology screen?
So we actually use the term expanded panel simply because the laboratory that we use, that's the terminology. But in essence, what we do is we send off one or more tubes of blood, and in some cases urine, to our toxicology lab, and they run a very comprehensive panel looking for a variety of illicit drugs as well as scores and scores of prescription drugs. I expect that you've probably already heard from a toxicologist, so I won't go into the laboratory part of it because that's not my area of expertise. But part of the testing they do is antibodies, looking for specific categories of drugs like morphine and related compounds, benzodiazepines, things in that class, barbiturates, and so on. And then the lab can do a variety of other techniques that are often go under names like gas chromatography, liquid chromatography, mass spectrometry, things like that. And they have the potential to detect hundreds of different medications that way. That's what we call the expanded panel with the lab that we work with, and that's typically what we ask for on most forensic autopsies.
And it's the lab you work with, NMS?
Correct.
How long have you worked with NMS labs?
It's been about 13 or 14 months now.
So for the past 13 or 14 months, would that be the only lab that you would be sending out toxicology panels or screens to from the Hennepin County Medical Examiner's Office?
Yes, all of our postmortem toxicology is done by NMS.
Are you familiar with the toxicologist named Dr. Eisenschmidt?
Yes, I know Dan.
Dr. Eisenschmidt testified here just, time flies, I don't know if it was yesterday or 2 days ago, but he testified here. Do you have a good opinion of him as a toxicologist?
He has been great to work with so far. Hold on.
Objection is sustained.
Well, you know Dr. Eisenschmidt.
I do.
Did you examine the contents of Mr. Floyd's stomach as part of your autopsy?
I did.
What did you note regarding the contents?
Counselor, can I refer to my report so that I don't...
Yes,
speak?
if it helps refresh your recollection.
I'm simply going to quote what I dictated as part of the postmortem exam. The stomach contains approximately 450 milliliters of dark brown fluid with innumerable soft fragments of gray-white food particulate matter resembling bread.
Did you note anything resembling either a pill or pill fragments in the stomach contents?
I did not.
Did you do any testing of the contents of Mr. Floyd's stomach as a part of the toxicology assessment for Mr. Floyd?
So I wouldn't do any testing of that. It is possible that we could send it to a lab like NMS for testing, but I did not request that.
So were you aware of whether or not Mr. Floyd had tested positive for COVID?
Yes, I was aware of that. Not at the time I did the autopsy, but I became aware of that later.
Was that significant to you in any way?
That he had tested positive for COVID?
Yes, sir.
I guess it kind of depends on what you mean by significant. This was very early in the pandemic, and we were still scrambling to figure out things like autopsy safety protocols and what we should be wearing. So in that sense, it was significant. In Mr. Floyd's specific case, the fact that he had been COVID positive 7 or 8 weeks before he passed away did not factor into my cause of death determination because I didn't see any signs of COVID at his autopsy, and his lungs did not have any of the stigmata of COVID that I would expect to see under the microscope.
So was he clinically symptomatic from your point of view?
I can't assess that because I didn't know Mr. Floyd when he was alive. To the best of my knowledge, he was generally healthy on May 25th before the events of that evening. I'm unaware that he was suffering from any acute COVID symptoms at that time.
You also know that Mr. Floyd had sickle cell trait. What can you tell us about that?
Sickle cell trait is carried by about 8% of Americans of African heritage. What it means is that one of the genes that codes for the beta chain of hemoglobin has an abnormal substitution in it. If you just have sickle cell trait, chances are you will go through life and never have any symptoms from it because you make plenty of normal hemoglobin. That's very different than sickle cell disease, which means that both of the genes have that gene substitution, and then you have sickle cell disease. People with sickle cell disease can get very severe anemia, they can have sickle cell crises, they're subject to a variety of infections and other complications. But Mr. Floyd didn't have that, he just had the one gene for sickle cell trait. I wouldn't even have known that, except that it happens that people who have sickle cell trait, when you take a biopsy of one of their tissues and put it in formaldehyde, which is what pathologists do with all tissue, the formaldehyde can cause cells to sickle as a post-mortem artifact. And so when I saw that on Mr. Floyd's slides, I immediately called the hospital lab and I said, do you have a peripheral blood smear for Mr. Floyd? And it turned out they had made a blood smear during his CPR. And so I had a pathologist who specializes in blood disorders look at the slide and confirm there was no evidence that Mr. Floyd was sickling on his peripheral smear during life. I did also have our lab then run a sickle cell quantitation, which means they actually quantify the abnormal hemoglobin in the blood. And sure enough, that came back with the exact number that would be consistent with Mr. Floyd having sickle cell trait. So it's really just a fluke that it got picked up at autopsy. In my opinion, it doesn't have anything to do with why he died.
All right. What about paraganglioma, a kind of tumor? I'll just ask you about the paraganglioma as to whether you found or concluded that it had anything to do with Mr. Floyd's death.
So the short answer is I don't feel Mr. Floyd's paraganglioma had anything to do with his death. What we're talking about is an incidental tumor that I happened to find in his pelvis during the autopsy. I did look at it under the microscope. The most likely diagnosis is a paraganglioma, but I have no reason to believe that had anything to do with Mr. Floyd's death.
Okay. So Dr. Baker, want to switch and talk about the death certificate.
Okay.
So if we could pull up Exhibit 194. First, I'd like to talk to you about the press release report.
Okay.
And ask you first, Dr. Baker, if you would just identify what this is for the record.
Yes, what you are looking at is the final press release my office put out once I had reached my conclusion as to the cause and manner of Mr. Floyd's death.
Okay. Can you explain to the jury what it means to certify a death?
To certify death as a physician means that you fill in the decedent's cause of death and their manner of death. And if their manner of death is other than natural, then you also have to fill in the how injury occurred box on the death certificate. Death certificates are relatively standard in the United States. Most of what's on them is largely dictated by the Centers for Disease Control. They vary a little bit in appearance from state to state, but the core elements are pretty much the same in every jurisdiction. Most of what's on a death certificate is actually filled in by family members and the funeral director. So, what's the decedent's full name? Where were they born? What are the names of their parents? Did they ever serve in the armed forces? There's all kinds of things that are captured. The medical examiner's primary role, again, as I mentioned, is the cause of death, the manner of death, and the how injury occurred. Most death certificates in the United States are actually filled out by clinicians, meaning your primary care doctor that you see. That person fills out death certificates for their patients who die of routine natural conditions. Medical examiners get involved when the death appears to be from unnatural causes. In practice, we should be the only people that certify deaths where the manner is ever anything other than natural.
So doctor, if we could look at Exhibit 193. First, would you, for the record, tell us what this is?
Yeah, this looks to be a actual state of Minnesota death certificate for Mr. George Floyd. These death certificates are actually produced by the state, not by the medical examiners. We simply fill in the parts we're responsible for. We push all of those data to the Minnesota Department of Health, and then the death certificate's issued by the state. And so that's why what you see here says state of Minnesota on the top. But the cause of death, the other contributing conditions, and the manner, that's what I'm responsible for, and that's right in the middle of your display.
Yeah, just want to zoom in on that and show it to the jury. I think this is pre-admitted, Your Honor. Okay. So if we look at the cause of death, immediate, underlying, other contributing conditions, this would be the section that you fill out then?
Correct.
So if we see here under manner of death, it indicates homicide. Tell us, what does homicide mean to you as a medical examiner?
So as a medical examiner, we apply the term homicide when the actions of other people were involved in an individual's death. It's one of 5 manners of death that we can choose from, the other 4 being accident, suicide, natural, or undetermined. Homicide in my world is a medical term. It's not a legal term. From a vital health and public statistics point of view, it's critical that medical examiners fill in a manner of death on every death certificate, because from a public health point of view, you want to know how many people committed suicide in your state, how many people died of accidents in a given year in your state. And so it's a key piece of public health data, but we don't use it as a legal term.
So we look at 918, correct? Dr. Baker, in front of you, Exhibit 918 is a list of manners of death, the ones you just talked to us about. Natural, accident, suicide, homicide, which I've highlighted because it's what you found in this instance, and then undetermined. Would you tell us from your point of view as a medical examiner, what does natural mean?
Natural means the person died exclusively of natural diseases.
Right, so an example of a natural disease might be a heart attack or a fatal arrhythmia as a primary cause of death.
Those are actually pretty vague terms. We're much more specific. So to your point, Counselor, arteriosclerotic heart disease causing a heart attack would be a natural cause of death. A ruptured brain aneurysm from long-standing untreated high blood pressure would be a natural cause of death. Metastatic lung cancer would be a natural cause of death. There's almost an infinite number of potential natural causes of death.
And if we look at accident as an accidental cause of death, is a drug overdose an example of what could be an accidental cause of death?
Most drug overdoses are accidental causes of death. Some are suicides. But yes, we do regard most drug overdoses, because we don't believe the person intended to die, we do regard those as accidents.
Mm-hmm. And we know what suicide is. Doctor, what does undetermined mean?
Undetermined means that despite the best efforts of law enforcement, the medical examiner's investigators, we simply never could pin down the circumstances under which the individual died. In any good medical examiner's office, you are going to have a small percentage of cases every year that go out undetermined in manner. Most of those, as it happens, are people who died of drug toxicity, and based on the drug levels, based on the person's known history, we just don't have enough data to know whether this was a suicide or an accident. And so if we don't know their intent, it's often undetermined. More dramatic but slightly less common example, you find a skeletonized body out in the woods. You have no idea why the person was there, how long they were there. There's very little left to work with, so you don't really know what happened. A case like that might go out undetermined as well. Again, much less common, but undetermined essentially means we never really did figure out the circumstances.
Now, in Mr. Floyd's case, you listed the immediate cause of death as cardiopulmonary arrest, complicating law enforcement, subdual, restraint, and neck compression.
Correct.
What does cardiopulmonary arrest mean?
That's really just fancy medical lingo for the heart and the lungs stopped. The heart, no pulse, no breathing.
So with respect to the term complicating, am I right in the understanding that this term means occurring in the setting of?
Yes.
Or in other words, cardiopulmonary arrest occurring in the setting of law enforcement, subdual, restraint, and neck compression.
Correct.
So Dr. Baker, can you tell us how it is physiologically that the subdual, restraint, and neck compression caused Mr. Floyd's death?
In my opinion, the physiology of what was going on with Mr. Floyd on the evening of May 25th is, you've already seen the photographs of his coronary arteries, so that you know he had very severe underlying heart disease. I don't know that we specifically got to it, Counselor, but Mr. Floyd also had what we call hypertensive heart disease, meaning his heart weighed more than it should. So he has a heart that already needs more oxygen than a normal heart by virtue of its size, and it's limited in its ability to step up to provide more oxygen when there's demand because of the narrowing of his coronary arteries. Now, in the context of an altercation with other people that involves things like physical restraint, that involves things like being held to the ground, that involves things like the pain that you would incur from having your cheek up against the asphalt, an abrasion on your shoulder, those events are going to cause stress hormones to pour out into your body, specifically things like adrenaline. And what that adrenaline is going to do is it's going to ask your heart to beat faster. It's going to ask your body for more oxygen so that you can get through that altercation. And in my opinion, the law enforcement subdual restraint and the neck compression was just more than Mr. Floyd could take by virtue of those heart conditions.
So, Dr. Baker, just a point of clarification that frankly occurs to me as you were talking. As a forensic pathologist, it's not part of what you do within the four corners of your job to try to calculate what Mr. Floyd's either lung volumes or oxygen reserves or that sort of thing would have been, is it?
I think what you're getting at, Counselor, is the sort of thing that I would defer to a pulmonologist. Those are obviously things we can't measure post-mortem in living people. Clearly those things are the purview of pulmonologists.
Right. So Dr. Baker, we did find from the toxicology amounts of fentanyl and methamphetamine in the results from the lab.
That is correct.
You didn't mention either fentanyl or meth in Mr. Floyd's system. You mentioned those, but you don't list either of them on the top line as causes of death. Why is that?
Well, the top line of the cause of death is really what you think is the most important thing that precipitated the death. Other things that you think played a role in the death but were not direct causes get relegated to what's known as the other significant conditions part of the death certificate. So the other significant conditions are things that played a role in the death but didn't directly cause the death. So, for example, Mr. Floyd's use of fentanyl did not cause the subdual or neck restraint. His heart disease did not cause the subdual or the neck restraint.
All right. So these are items that may have contributed but weren't the direct cause.
Correct.
No further questions, Dr. Baker.
Mr. Nelson. Sure. We're going to take a 10-minute break.
Thank you all for continuing to join us. This is Nico from Unicorn Riot. The court is on a 10-minute break. That's happened quite frequently when an examination has finished and the defense wants to cross-examine. If they've actually been lucky on these breaks. We have 8 minutes left on it. We're going to try to read you some of the other press reports from the press reporters that are inside the courtroom that are reporting on what they see happening. So, again, what you just witnessed was Dr. Baker, the medical examiner who performed the autopsy on George Floyd, getting direct examination questioning by Jerry Blackwell. You see the rotation of sort of attorneys for the state. I'll pull them up. This is the rotation of the attorneys. Most of the time what you've seen is sort of the four on the left: Matthew Frank, Jerry Blackwell, Steve Slisher, and Aaron Eldridge. The other five that you see, Sandeep, Christina, Joshua Larson, Neil Katyal, have been also playing roles, and Keith Ellison is sort of like the lead, from my understanding. As we continue to watch the trial, it's just important to note that it's the jurors that are the ones that are going to decide the case. And when it comes to what they're doing today, we'll bring you a little bit of update from that. So we have pool reports coming in from Holly Bailey, I believe, from Washington Post. I think it's still not verified who the person that is sitting in Chauvin's seat is, but there's a person finally sitting in Chauvin's family seat, and that seems to be possibly his wife. She has a wedding ring on. She is a woman of Asian descent. In the meantime, as I said, we'll read you some of the happenings from Holly Bailey this morning. So during the first witness, it was Dr. Lindsay Thomas. Jurors 1, 2, 8, 9, and 5 were continually taking notes. Jurors 2 and 3 were definitely nodding and taking notes as Thomas began to speak about her review of Dr. Andrew Baker's autopsy. And they seem to be the most interested. And jurors 2 and 3 are a white woman in dark blonde hair in her 30s. And juror 3 is a black man, slightly balding. So, again, the jurors' identities are protected for multiple reasons, but they are protected. We do not know who they are. They are off to the right of the screen. As you look at it, when you see witnesses take the stand and they look off to the left, they're looking at the jury. And that is the important thing to also understand. It seems like juror 6, who is a slim white male in his 20s, hadn't taken out his notebook until Dr. Lindsay Thomas said this was not a sudden death. There was nothing sudden about his death. All the jurors wrote that down. And juror number 6 finally opened his notebook to write that down. So they have notebooks, they're keeping notes, and then they go back during the deliberation at the end of the presentations, and that's when they'll decide. The deliberation could be a day, 2 days, a week, we don't know. The jurors will probably get sequestered during that, so that means they'll probably be brought to a hotel or have to stay in a hotel. So, when you saw that they actually didn't show the autopsy photos to the public, which was probably very good. It was a very traumatizing situation, and to relive it for a lot of people and to just watch it play out. Again, take self-care. I saw some people in the chat also mentioning that. There's some people locally, like Black Table Arts. I think every Thursday or every other Thursday they're holding space at their new space off of 37th and Minnehaha over South Minneapolis, and they're providing a healing space for people to come talk. And if you all need somebody to talk to, you just reach out to somebody that you think is there for you, and find that support. Locally, they're out there, so check them out. So when they handed out the envelopes, that was the autopsy photos. I don't know if you heard, but it sounded like somebody had to give up their copy when we were watching, and that was actually the prosecutors that were forced to give up one of their copies to give to the woman in Chauvin's seat. And at first she didn't open the envelope but eventually she did. And again, those copies were just like photos of his shoulder, his hand, his face, the abrasions on his cheek, and such. Yeah, I see. I'm looking at the Facebook chat every now and then, and thanks Roxanne for putting up Black Table Arts Co-op in the Facebook chat. If you want to get, look at their Facebook, they're tagged now, Black Table Arts. I'll pull up their website after this, when it goes to afternoon break probably. I do want people to see and understand that they are out here doing their thing. Shouts to Kino Evol, who created that, and some other folks along with them. So I'm going to read a little bit more. Give me a second. As we talked about earlier, before lunch came all the way back, when the lunch break happened after the I think we got that right before lunch. So after the lunch break happened, people were coming back. We got the jury pool for when they took the lunch, and when the jury left the room, we got the pool report from when they took the lunch. When the jury left the room for the lunch, which they have their own lunch brought to them, I believe, and they sit in like a room in the back of the court's tower of floor 18 in the Hennepin County Government Center, and they eat together, I believe, and they talk. And so that's always an interesting thing to see those, or to know that they're also having to have relationships with each other. So the lawyers mingled for a bit after the jury left the room for the lunch break, and they had some conversation between the prosecution and the defense, and they waited for Nelson to finish his conversation. Or as they waited for Nelson to finish conversation with the prosecution, Chauvin made eye contact with his family representative and then walked over to her. They stood by the door together. At one point, Jerry Blackwell crossed in front of Chauvin, smiled, nodded at him. Smiled and nodded at him. Chauvin gave him a simple nod. So that's just a small interaction that happened before lunchtime. From my understanding, let me see who's in the trial seat for Floyd family is Rodney Floyd. Rodney Floyd is the brother of George. And while we have about 50 seconds left of this 10-minute break, when we'll come back, it seems like Eric Nelson will be doing the cross-examination of Dr. Andrew Baker, who performed the autopsy on George Floyd. He listed the autopsy as a homicide, cause of death. And we'll pull up this thing real quick just to show you. Again, Jerry Blackwell is part of the Minnesota legal team. He's an attorney general. He specializes in civil cases, from my understanding. But he's brought here. So again, the court reporters on the inside are Adrian Florido today from NPR, Holly Bailey from Washington Post. And we'll try to continue to bring you updates from them. As the afternoon break, we'll get another update. We'll try to read some things off. It's still not clarified specifically. Yeah, I shouldn't say Jerry Blackwell is not the Minnesota Attorney General. He's like an assistant attorney general. He's part of he's part of the legal team of the Attorney General. Excuse me. Thank you for that clarification. I do see that, Shairat Gupta. So I also want to mention that when it comes back to the afternoon court, we will have more pool reports, and we'll try to read off anything that's pertinent in those. But this is not the afternoon break. This is just a break between questioning to allow Nelson a little bit more time, I believe, to gather his questions. So again, thank you all for tuning in. If you want to check out our Twitter feed, we have a lot of happenings on there. Extra details if you might have missed something in the court. If you missed a part of it, you want to go back, you can check that out. I'm going to go to that real quick. Here's our website. Here's the Twitter feed, and you can check that out. So there again, in a 10-minute break, it's a little bit long as normal. This is pretty normal. But it's not the afternoon break, just a heads up. So you're looking at the live feed. When they come back in, you will see them and hear them as their audio is still on. So again, thank you all for supporting and viewing and sharing, and also being very respectful to each other in the chats. Again, we are on YouTube, Facebook, and Twitter. UR_ninja on Twitter. We're also on Instagram. We're not live tweeting this or anything, or like live posting on Instagram, but we do have Instagram, unicorn.riot. And we do have a Vimeo, so check out our Vimeo as well. What you're looking at in the background of the red map is downtown Minneapolis. The Hennepin County Government Center is actually sitting on right below the video of the court feed, so it's actually almost like right where they are. Again, they're in the 18th floor, I believe, of the Hennepin County Government Center, which is fenced in with $35-some million worth of security going on in Minneapolis. Add that to the $27 million given to George Floyd's family from the taxpayers from the settlement because of the death of George Floyd at the hands of Minneapolis police, who killed him in custody, or at this point he died in custody. We are seeing if the courts view that he was killed in custody. We'll see that by a jury of 14 people. 12 people are the jurors that are really going to be deciding. There's two alternates, and one of the jurors got questioned earlier today about any outside interactions they might have had with information. And we'll get back into that after the afternoon break. Just give you a quick update on that again if they come back into court.
Just a reminder, you're under oath still.
Yes, Your Honor.
Mr. Nelson.
Good afternoon, Dr. Baker.
Good afternoon, Mr. Nelson.
If I may have just a moment, Your Honor, to... So, Dr. Baker, thank you for being here with us this afternoon. Just some follow-up questions I kind of want to break up into two different sections. One about the autopsy, and then some other questions about events after autopsy, okay?
Okay.
All right. So you understand, Dr. Baker, that you've testified in many cases in Hennepin County before?
Yes, I have.
Dakota, Scott County as well?
Not nearly as much, but yes.
And you understand that as a part of the process of exchanging information, the defense receives copies of everything, your reports, meeting notes, prior statements you've given, things of that nature.
Yes.
Right? Okay. And have you had opportunities to review all of that information prior to your testimony today?
To the best of my knowledge, yes.
Okay. And ultimately what you testified is in a death investigation, it's much more than just simply an autopsy, agreed?
Correct.
And in fact, if you pull your file, it usually ends up being a few inches thick, right?
We're actually paperless at the medical examiner's office, but if you printed it out, yeah, I guess it would be a few inches thick.
Yeah. Well, that's what I did, and that's what it is. I guess I got to get with the times. But ultimately, that file contains your autopsy report, correct?
Correct.
Death certificate, the paperwork that you fill out for the state of Minnesota?
Yes. We don't actually get a copy of the death certificate from the state, but everything we put on the death certificate is in our file.
Right. And then you also keep track of conversations that you have with people, right?
Generally, yes. That's usually more my investigators who are talking to family, treating physicians, hospital records departments and stuff.
So you keep sort of a log, so to speak, of today investigator so-and-so spoke with X, right?
Again, I don't personally do that so much, but yes, my investigators do.
Right. And it's all a part of this file, right?
Correct.
And then in addition, you obtain any known medical records that may factor into your analysis as well, right?
Yes.
You had received some hospital records from HCMC regarding Mr. Floyd, correct?
Correct.
But you don't go out and try to search, or perhaps you do, try to search for every provider that he or that any person generally may have seen, right?
In most cases, that's correct, Counselor. There wouldn't be a lot of point in us trying to get every medical record ever generated for a particular decedent. It would only be if I thought it would help me understand the cause and manner of death better.
Okay, fair enough. Now, I want to talk to you first about the word complicating. How do you define the word complicating as you used it as to the cause of Mr. Floyd's death?
I use the word complicating the way I think most physicians use the word complications, and I'm guessing that most people who've ever been a patient or had a loved one who's been a patient knows what physicians mean by the word complications. It means that an intervention occurred and there was an outcome that was untoward on the heels of that intervention. So, for example, somebody goes into the hospital for hip surgery and they develop a blood clot in their leg. That's a complication. You get started on a new medication for a heart condition and you have an allergic reaction to it. That's a complication. So it's an untoward event on the heels of an intervention that happened. That's how I look at it as a physician.
Right. And it could be during an incident as a result of an incident, right?
Again, we don't usually use the word incident in medical practice, but yeah, it could be an immediate complication as a result of a medical intervention or therapy, or it could be what we call a delayed complication.
Right. And there are certain circumstances that precede those complications. Agreed?
That's a little vague, Counselor. I wonder if you could...
Well, I mean, in any death investigation, you're trying to determine the cause and manner of death, right?
Correct.
And in this particular case, you obviously took into consideration the police restraint, right?
Correct.
But you also took into consideration the heart disease, correct?
Yes.
As well as the toxicology results. Agreed?
Yes.
And you factored those in your cause. There's the cause and manner of death. And then there's the second thing that you left blank, right? And then there's the contributing causes or contributing factors.
Yes, the term of art is other significant conditions is what you're getting at, Counselor.
Yeah. And that's simply just something you have to do for the CDC, or did you take those into consideration as contributing to Mr. Floyd's cause of death?
So when you put those on a death certificate as a physician, what you're saying is, I think these played some role in this death. They had a contributing condition. I'm unaware of how the CDC would mandate what goes on there. Presumably the goal is you put things on there that you believe are relevant. You don't list trivial stuff on there that didn't play a role.
Right. And so if something was significant enough, you put it on, but if it's insignificant and didn't contribute, you leave it off.
Generally, yes.
Okay. And so in your opinion, both the heart disease as well as the history of hypertension and the drugs that were in his system played a role in Mr. Floyd's death?
In my opinion, yes.
All right. Now, again, in terms of your autopsy report, you don't generally note negative findings, right? If something is normal, you may just say it's normal, but you're not going to take special note to say the heart is completely, perfectly normal.
That's a really long question, Counselor, but I think I can give you a reasonable answer to that. For most normal organs, we have a boilerplate description for what that organ is. So if a spleen is normal, I'm going to give a normal description of the spleen with the weight of that spleen. The same for a liver. Depending on the nature of a particular case, there are, I used this term earlier, pertinent negatives, things that you think might be on the body based on the circumstances, so you specifically seek those things out, and if they're not there, you document them because the fact that they're not present really means something. So I don't know if that answered your question. There's some things that are normal, that they're almost always normal, and we go on to the next step of the autopsy. There's some things that, depending on the complexity of the case, the fact that it's not there, you're going to dwell on that, you're going to do a special dissection, you're going to take a picture, whatever you need to do to document that you specifically looked for something and it wasn't there.
Okay, and so in that regard, if you note something, whether it's odd or irregular, or it's the negative, right? You take special precaution to note those things in your autopsy.
Ideally, yes. You not only do you document that in your narrative report, but you take a picture of things that are there and you document things that aren't there that people might have expected to be there.
Okay. And it's interesting to me that you made a conscious decision not to watch any videos before you performed the autopsy, correct?
Correct.
And that was to prevent bias, you described?
In general, yes. I don't want to go into an autopsy with a preconceived notion that I already know what happened, because that might tempt you to skip certain steps or not do certain things that could turn out to be relevant. So, and just full disclosure, counsel, to fully answer the question, I did see the video that the entire world saw later that day after Mr. Floyd's autopsy. I did not release his body until the following morning. So had I seen something on the video that triggered yet another thought in my mind, I still had the chance to act on it. I did not want that to be in my mind when I physically performed his autopsy on the morning of the 26th.
Understood. But you had received some briefing from law enforcement or from somebody to say, here's generally what we know about what happened.
It was pretty high level, but yes, I got a phone call from the BCA that a man had gone unresponsive in police custody while he was being restrained. He had died at Hennepin County Medical Center, and that was largely what I knew going into the autopsy. I believe I was aware that there had been pressure applied to his neck, but beyond that, that's pretty much what I knew going into the autopsy.
So you took special, because you had learned that there was potential pressure to the neck, you took special steps to look at the neck area, shoulders, etc., right?
Yes.
And because of that, you did this unique incision, or this specific incision, to lift the skin off to look under the surface, so to speak.
That's correct.
All right, and we'll come back to that in a second. You did note, I want to focus on the heart for a little bit. You noted that the heart was dilated.
Yes.
What causes that?
So dilated is just fancy medical lingo for has gotten a little bit bigger than it used to be. Like when you blow up a balloon, it dilates, for lack of a better lay description. Mr. Floyd's heart was, if I can refer to my report, counselor.
Refresh your recollection?
It would. So I described the ventricles, which are the two main pumping chambers of the heart, the right and left, as mildly dilated in Mr. Floyd's case. I would interpret that as being part and parcel of his high blood pressure. That's a manifestation of the heart getting bigger and heavier as it works against that continued high blood pressure over a period of time.
Okay. You also took note of the size of Mr. Floyd's heart, right?
It's actually the weight, counselor, but yes,
weight, yes.
Absolutely did take note of the weight, yes.
All right, and that was 540 grams?
That is correct.
And you're familiar with the papers of DeMaio and Molina on the normal heart size?
I am familiar with DeMaio and Molina paper, although the one that I usually use is the Kitzman paper from the Mayo Clinic.
Okay. And what's the maximum size of a heart under that standard?
So the Kitzman paper normalizes heart weights as a function of your body length and your body weight. Because if you think about it, a very large person is going to have a larger heart than a very small person. So we don't want to penalize people for being too big or too small. That's why you normalize their heart weight. So in Mr. Floyd's case, the upper limit of normal for his body length, according to the reference that I use, is 510 grams. The upper limit of normal for his body weight would be 521 grams. Again, he was 540 grams, and so he is outside the upper limit of normal. That means on the bell-shaped distribution of heart weights for a man his size, he's way out on one of the tail ends, the heavy end.
Okay. And all of these various standards in terms of the weight of a heart, they're peer-reviewed?
As far as I know, yes. The reference I use is from the Mayo Clinic proceedings, which I'm going to assume is peer-reviewed.
Right. And as would be, say, DeMaio and Molina's or the Northwestern studies or any of these other studies?
I'm not familiar with the other studies you're referencing, Counselor. The DeMaio and Molina paper, I believe, was published in the American Journal of Forensic Medicine and Pathology, which I know to be peer-reviewed.
Okay. And you would agree that the larger the heart is, the more blood it needs to provide adequate oxygenation. Agreed?
As a general rule, I would say that is true, yes.
What types of things cause a heart to be bigger than normal?
The most common cause by far in adults in the developed world would be high blood pressure. There are a number of far less common causes. Aortic valve disease could do it if the heart's pumping against a defective valve. There are genetic causes of an enlarged heart. Typically, we can tell those by looking at the heart grossly and microscopically. Those are much farther down the list than high blood pressure, which again is the number one shot.
And based on your review of Mr. Floyd's medical records, you determined that he has a history of high blood pressure, correct?
Yes, it was very helpful to learn that from his medical records. He was known to be hypertensive.
Can you describe the narrowing or the stenosis of the coronary arteries a little bit more detail?
I can, Counselor, if I may refer to my report again. Sure. So as I mentioned when I was describing the photographs earlier, he had 75% proximal and 75% mid narrowing of his left anterior descending coronary artery. Again, in most people, that would be the largest of the three coronary arteries. He had 75% narrowing of the first diagonal branch of his left anterior descending coronary artery. And then in his right coronary artery, which in most people is the second largest of the three, he had 90% proximal narrowing.
All right. And what do forensic pathologists generally consider to be enough narrowing of the arteries to cause a sudden death?
We usually look to 75% greater as capable of causing sudden death.
And are you familiar with myocyte necrosis?
Yes.
And do you have to have myocyte necrosis to cause a sudden death?
No, you do not.
In an arrhythmia, there would be no necrosis, correct?
So an arrhythmia coronaries.
And when we describe hypoxia of the heart, that's the reduction of oxygen to the heart, correct?
Correct.
And can you, can hypoxia to the heart cause sudden death by other means? Or would it just be the arrhythmia?
Well, there's many ways that a lack of oxygen to the heart could cause death. One could be a sudden dysrhythmia, where the person's heart goes from a normal beat to a non-perfusing beat, and the person would literally just collapse right in front of you. Depending on the nature of their artery disease, a person could have a thrombus. They could present to the emergency room with crushing chest pain and sweating and difficulty breathing. That would be a different mechanism of death. So there's different ways the heart manifests that is not getting enough oxygen, but one of them is sudden collapse and death.
And sometimes people can survive that.
Survive thrombi in their coronary arteries. That's why we have clot-busting drugs and cardiologists on call for emergency rooms for urgent catheterizations and stuff like that.
Gotcha. Now, can you generally describe the conduction system of the heart?
Only in the broadest terms, because I'm not an expert in the conduction system of the heart. I have other people I rely on for that, but it's basically the electrical system of the heart. There's a part of your heart called the sinoatrial node, and that's like the little watch in your heart that starts every heartbeat. You would be able to see what it's doing on an EKG if you were looking at an electrical tracing in a living person. That's then conducted to another node that's known as the AV node, the atrioventricular node, and then the electrical impulses go out from that to the ventricles that cause them to beat. You can actually see the conduction system under the microscope if you take it out and look for it. And there's on very rare occasions we do that. It wouldn't have been necessary in Mr. Floyd's case, but that's basically what the conduction system does.
If the conduction system is impaired, what happens?
I'd have to defer to a cardiologist on that, because there's so many different ways it can be impaired. Sometimes it's completely benign. Sometimes a person might need a pacemaker or even a defibrillator. It totally depends on the nature of the derangement.
Which of the arteries supplies that first one, the SA node, the sinoatrial
node?
Right.
I believe it's a small branch of the right coronary artery in most people.
And is that the one that was 90% occluded?
Not the branch. I didn't dissect out the branch, but yes, the main right coronary artery was 90% narrowed.
You're aware also of the methamphetamine that was found in Mr. Floyd's system?
Yes.
Does methamphetamine further constrict the vessels and ventricles and arteries?
I don't know. I'm not an expert in the specific toxicology of methamphetamine. It is certainly hard on your heart in the sense that it does things like drive up the heart rate and drive up blood pressure. I don't know if it's a vasoconstrictor, but in either way, as a general rule for forensic pathology, methamphetamine is not good for a damaged heart, a heart with coronary artery disease.
Does the amount of the level of the toxicological findings affect whether it's good for the heart or bad for the heart?
I don't know that there's a scientific answer to that, Counselor, because I'm not aware that there's a quote-unquote safe level of methamphetamine.
And especially illicit methamphetamine, right? No safe level of the street drug versus the amphetamines that are sometimes prescribed.
Yeah, so I'm very unfamiliar with any medical use for methamphetamine in approved circumstances. I'm aware that amphetamine is used in some circumstances. That's definitely not my area of expertise. Again, my high-level overview as a forensic pathologist is all other things being equal, methamphetamine is not good if you have bad coronary arteries.
And exertion also causes the heart to work harder?
Correct.
And therefore would require more oxygen?
Correct.
More blood has to pump through to oxygenate the heart and send it to the rest of the body, right?
Correct.
And so in this particular case, we have Mr. Floyd's heart is at least above average size, right?
Correct.
He has a heart with narrowed coronary arteries, right?
He does.
There was evidence of a period of exertion prior
that yes, there was a period of exertion prior to him becoming unconscious.
So in terms of your investigation, you ultimately did watch the videos.
Correct.
Including the body-worn cameras of the officers?
Yes.
And were you also provided with other videos in terms of surveillance videos, additional bystander videos, things of that nature?
I was.
And were you provided with investigative materials that what people said happened, etc.?
No, I did not have those.
Okay. Have you ever certified a death due to hypertensive cardiomegaly? I don't know how to cardio, M-E-G-A-L-Y. Megaly?
So the answer to that, Counselor, is yes. The term you're going for is hypertensive cardiomegaly, which is fancy medical lingo for the heart is too big because of high blood pressure. We don't typically use that term. We just use the term hypertensive cardiovascular disease because it's a little more precise. But yes, I have used that or similar terminology.
Of the arteries compared to Mr. Floyd?
Yes.
In terms of the injuries to Mr. Floyd, the abrasions and things of that nature, obviously they appear to be fresher to you. Would you agree with that?
They do appear to be fresh, but I want to be very careful in my answer. There's not any literature that allows you to date those kinds of injuries with precision. Presumably there's contextual data that would allow us to know that Mr. Floyd didn't have those abrasions, an hour before he died or whatever. If you just showed me those abrasions blindly, could I tell you how old they are as a pathologist? And the answer is no, not with any precision.
Right. And in terms of the abrasions that we looked at on Mr. Floyd's body, they could have been from the period of time he was restrained on the ground, agreed?
Correct.
They could have also been consistent with the period of time where he was taken to the ground or brought to the ground, right?
Well, that would be true as long as there's something in his environment that would explain those abrasions. I mean, some of those would take a fairly rough surface to produce. A smooth surface wouldn't, you wouldn't really expect that to cause those.
Understood, but if you were in the midst of a struggle with police officers and the police officers brought Mr. Floyd to the ground, the moment of impact with the ground could have of the abrasions that we looked at. It would also be likewise consistent with Mr. Floyd being taken out of a police car and put onto the ground.
Same objections beyond the autopsy.
Yes, depending on how he made contact with the ground, if the direction of motion is correct and there's enough abrasive force, yes, that contact could explain those abrasions.
Okay. Would you agree with the general proposition that the prone position is not inherently dangerous?
As far as I know, based on
you dissected Mr. Floyd's shoulder and neck area, right?
That's correct.
And you found no bleeding into the subcutaneous tissues of the neck and back, right?
That is correct.
And there's no bleeding into the muscles of the back, correct?
That's correct.
And you don't have any section in your autopsy report to describe any injuries whatsoever to Mr. Floyd's neck and back like you do other areas of the report?
That's not true, Counselor. There's a special paragraph that specifically describes me dissecting his back and not finding anything.
Okay. And you took pictures of that as well?
Correct.
And all of those procedures were documented in the normal course of how you, when you conduct an autopsy, right?
Yes, all of those things were photographed.
And you did that so that other people would have an opportunity to review your work, correct?
Correct.
And you understand in your career?
I have.
If you had to venture a guess, how many autopsies have you conducted?
I've never kept a spreadsheet, but I would say it's probably in the neighborhood of 2,900 to 3,000.
Okay. You've done other autopsies where asphyxiation was the suspected cause of death?
Yes, asphyxia is a very common cause of death in my line of work.
Right. You see it manifest itself in many ways, right?
That's correct.
And there are certain things that you look for in the course of your autopsy to determine whether or not this death would be consistent with asphyxiation. Agreed?
Yes and no. It depends on the type of asphyxia you're talking about. There are many ways that human beings die of asphyxia, so as pathologists, we want to make sure we know the type of asphyxia that we're talking about, because the signs that you would see are going to vary from one type to another.
And including, you look at the brain for signs of lack of oxygen, right?
We do, but to be fair, the person has to survive the anoxic brain injury for a considerable period of time before we can see anything. In most of the asphyxias that we investigate, we're not going to see any acute changes in the brain.
You look for musculoskeletal changes to the body, right?
Again, depending on the nature of the asphyxia, yes.
So you may look for, perhaps if the asphyxia was from the front to the back, broken hyoid bones, for example?
Correct. We're specifically looking at things like the muscles of the neck, the thyroid cartilage, the hyoid bone, in things like strangulations and hangings where there's pressure on the neck.
Okay. And you formed some opinions ultimately about the amount of pressure and whether the pressure was applied to the neck, right?
Could you be more specific, Counselor?
Well, ultimately you have your, you have described your cause of death, right?
Correct.
And part of your cause of death includes neck restraint, right?
I believe I actually used the term neck compression, but yes, that is on the top line of my cause of death statement.
And in the course of your many conversations that you've had with various prosecutors and law enforcement officers, you, after watching the video, you've made some statements about where you thought Mr. Chauvin's knee was placed. Would you agree with that?
Yes.
And did you feel that Mr. Chauvin's knee was compressing his neck?
Yes.
Did you describe it as being more on the back or in this lower part, base part of the neck?
So in my impression from the video, and I want to be very clear, I have no special expertise in looking at videos. I'm just looking at them as another person trying to figure out what happened. In my opinion, it would appear that Mr. Chauvin's knee was primarily back or the side or the area in between on Mr. Floyd's neck.
Did you see any evidence that he was occluding the carotid artery?
It did not appear to me on the video that his knee would have been able to occlude the carotid artery. Even if it were, you'll have two carotid arteries, and the unoccluded carotid artery would continue to supply blood to the brain.
And when you look at deaths by manual strangulation, for example, are you also looking at bruising?
Yes.
You're looking for bruising. Do you see that bruising in the majority of your cases or not in the majority of your cases?
Well, keep in mind that my patients are all deceased, and so if my patients were strangled, it was so significant that they died. And I say that because if you were to ask an ER doc for her experience looking at living strangulation victims, you might get a different answer. In my world, we typically see bruises on the outside of the neck, we see abrasions on the neck, we see bruises to the small muscles of the neck. Depending on the type of strangulation and how old the decedent was, we could even see fractures of the thyroid cartilage and the hyoid bone. And we often see petechiae as well, which are little tiny blood spots on the lining of the eyes. Sometimes you can see them on the face, on the inside of the lips, even the inside of the mouth.
And did you observe any of those signs in this case?
No, I did not.
And in terms of, when you think about just kind of the classic strangulation, I'm taking my fingers and my hands and I'm pressure to your neck, even those small finger, you would expect to see bruises consistent with the size of my fingers, right?
Again, in my line of work, we more often than not see bruises. You did say consistent with the size of your fingers. That might be true on television shows, but in the real world, there's not a lot of correlation between the size of bruises we see and the size of assailants' hands. But we are looking for those telltale bruises.
All right. And in terms of, in this particular case, the knee, the placement of the knee being a pretty bony, hard, round object, right?
Yeah, I mean, it's pretty concentrated right under the kneecap at the fourth.
Right. And of course, the shin bone is just below the skin, right?
Yes.
And it's sort of triangular in its nature, right?
On cross-section, yes.
And so if a substantial amount of force was being used by the knee or the shin bone on the neck or back area in your line of work, and if that force was sufficient to asphyxiate him, would you expect to see bruising?
I would expect to see bruising, but I don't know that the lack of bruising excludes that. You and I kind of just pivoted from strangulation, which is really pressure to the front of the neck, to the pressure of the back of the neck. And that's just not something that I think we see as medical examiners, pressure to the back of the neck explaining a strangulation.
Or an asphyxiation.
Correct.
So is there any objective medical finding in your autopsy that shows a sufficient or significant amount of pressure to the back?
Again, I think we've covered this. I did not find any injuries to Mr. Floyd's back, not on the outside of his body, not looking at the soft tissue under his skin to make sure I didn't miss any occult bruises. I didn't find any bruises on his back.
Okay. Did you find any hypoxic changes to Mr. Floyd's brain?
I did not, but again, a person has to survive for many hours before we would be able to see those as pathologists.
You're generally familiar with a hypoxic death and how that occurs?
Again, Counselor, it really depends on the nature of the asphyxia. Keeping in mind, in my world, asphyxia is hangings, it's strangulations, it's carbon monoxide poisoning, it's drownings. There's all different ways people can be asphyxiated. It really depends on which mechanism you're talking about.
Well, generally, regardless of the mechanism, would you generally see symptoms consistent with hypoxia? Would a person exhibit certain symptoms?
So symptoms is a little outside my bailiwick because we're talking about living people, and I don't treat living people who are suffering from hypoxia of any cause.
So, I mean, Dr. Thomas, who just testified, would testify that you may see confusion when someone is going into a hypoxic state.
Objection, Your Honor, to the characterization of Dr. Thomas's testimony.
Rephrase as
Certainly.
what he agrees to.
So, your role as a medical examiner, right? You take into consideration information from lots of different sources. Okay?
That is true.
And there may be cases where you just don't know what's going on, right? You can't figure something out.
Could you be more specific?
Well, you have a decedent in your medical examining table, and there appears to be some sort of tropical disease, right? I'm assuming you're not a tropical disease or an infectious disease expert, right?
I'm certainly not an expert in tropical diseases. We do diagnose a lot of infectious diseases at the MD office.
But if there's some sort of infectious or tropical disease, you may go to another person and ask that person, hey, are you familiar with this?
I object to the question in terms of relevance and beyond the scope.
Beyond the scope is overruled. Relevance at this point is sustained.
Sure. Do you rely on the expertise of other physicians when you conduct an autopsy?
Not always, but I am never above reaching out to clinical colleagues or other pathologists if they have an area of expertise that would help me.
And part of your job as a pathologist is to attempt to determine whether there is asphyxia in a particular case, right?
Again, it completely depends on the nature of the case, Counselor, but if it appears to be an asphyxial death, we're always trying to get at the root of how did this occur? Why did this person asphyxiate?
And as a physician, you're a physician and a forensic pathologist, you're familiar with what happens to the human body when someone asphyxiates, right?
In general, yes. Again, I don't actually see living people asphyxiate. I don't treat living victims of different types of asphyxia in a clinical setting.
But in the context of your research or education, you may go to a conference and they're saying, here's an asphyxia death. Let's talk about it, right? Here's a picture of someone hanging from all the way fully suspended versus someone who is on their knees and suspended forward belt or something.
Objective questions, vague and relevant, Your Honor.
Sustained is relevance.
Are you familiar with the symptoms of hypoxia?
Again, they would be very general symptoms, and I don't know what the differential diagnosis for those symptoms would be.
What would the general symptoms be?
Of hypoxia?
Right.
Probably some form of mental status change in the form of confusion or disorientation.
Incoherent speech?
Again, the differential diagnosis for something like that is so long. Could asphyxia explain that? Yes, but there are many other things that could as well.
When someone is hypoxic, does that cause that person to breathe faster?
I honestly don't know. Again, it probably depends on the nature of the asphyxia. I would defer any further questions to a pulmonologist because they're the experts in breathing.
Okay. Would you, based on your understanding, you reviewed the toxicology of Mr. Floyd, right?
Yes.
You'd agree that fentanyl is a respiratory depressant?
That's my understanding, yes.
That it slows breathing, resulting in lower oxygen levels?
It can, yes.
And similarly increasing the carbon dioxide, correct?
What it would do to carbon dioxide would be outside the scope of my expertise. I would defer that to a pulmonologist or maybe a toxicologist.
Methamphetamine is a stimulant, correct?
Correct.
meaning, again, it causes the heart to beat faster.
Correct.
Causes the heart to work harder.
Yes.
Causes constriction of the arteries.
I believe you already asked me that, counselor, and my answer was I don't recall if that's a specific mechanism of methamphetamine, but I would acknowledge that it increases your heart rate and the work of the heart.
So, have you certified deaths by overdose?
Hundreds of times a year.
Have you certified deaths as an overdose where the level of fentanyl was similar to the level of fentanyl in Mr. Floyd?
Yes.
Have you done so where levels were lower?
Yes.
Or were higher?
Yes.
What's the lowest level of death by fentanyl overdose that you have certified?
Without doing a search of my office's records, I'm not prepared to give you an answer on that. I know I've seen levels as low as 3 nanograms per ml and possibly lower. Like all death investigations that we do, if it involves a drug overdose, you also want to try to piece together the person's history of how much they've been using it, how long they've been using it, if they're tolerant to it at all. There's a lot of variables that go into it, but I've seen levels as low as 3, in some cases even lower if there's other intoxicants on board, such as alcohol or benzodiazepines.
So the combination of drugs in any person's system is a relevant consideration?
I'm sorry, did you say irrelevant or
relevant? A relevant consideration.
Yes, combinations of drugs and interactions of drugs can be relevant.
And that's why you included both the heart condition of Mr. Floyd as well as his toxicology findings as other contributing issues to his death, correct?
That's correct.
All right. Now, I just want to kind of review with you the history of your involvement in this case, if that's okay.
Okay.
Obviously, Mr. Floyd was deceased on May 25th of 2020, correct?
Correct.
You performed the autopsy on the 26th?
Yes.
And after the autopsy, you had a meeting with some Hennepin County attorneys, correct?
Correct.
On May 26th, correct?
Yes.
And do you recall telling them that the autopsy revealed no physical evidence that Mr. Floyd died of asphyxiation?
I don't know what my specific language is, but yes, that is what I conveyed to them, was the lack of anatomical findings that would support that conclusion.
All right. And you told them that you had avoided watching the videos at that point, right?
Until after I'd performed the autopsy, yes.
All right. Do you recall telling them certain factors that you thought contributed to the death?
Your Honor, object on the grounds of hearsay and cumulative.
Members of the jury, you should consider any statements made outside of court as possible impeachment of the witness's testimony and not for what is actually being asserted. Mr. Nelson, you may ask that question.
Thank you. Do you recall telling the Hennepin County Attorney's Office on May 26th, after you conducted your autopsy, what you thought the contributing factors were to his death?
I don't recall the specifics of that conversation. As far as I know, the only narrative record of that conversation would be what they wrote down. I would be shocked if I did not tell them about Mr. Floyd's heart condition, because obviously I knew that the moment the autopsy was done. I couldn't have known the toxicology results the afternoon of the autopsy because I wouldn't have those back for several more days.
So you found initially that his heart condition was pretty significant, right?
Yes, you would know that walking out of the autopsy suite.
You received the toxicology on June 1st of 2020?
Could I refer to my record and see if that's correct?
Yes. On or about June 1st?
That is correct. And I'm going off the toxicology report itself. It appears that it was issued on the morning of June 1st at 7:04.
Okay. Do you recall having a conversation with Hennepin County prosecutors about the significance of the toxicology findings?
I recall having the conversation. I don't recall the specifics of it, but I'm certain that I would have relayed the toxicology findings to them.
Do you recall describing the level of fentanyl as a fatal level of fentanyl?
I recall describing it in other circumstances. It would be a fatal level, yes, in other circumstances.
And would you agree that one of the causes of the pulmonary edema that you communicated to the county attorneys was also fentanyl?
Fentanyl can certainly be a cause of pulmonary edema. As I indicated earlier in previous questioning, it's confounded by the fact that Mr. Floyd had quite a bit of CPR, and so I find the pulmonary edema much less specific, given that he survived and made it to the hospital for a period of time.
Do you recall telling the county attorney's office that had you found Mr. Floyd under different circumstances, you would have determined this to be a fentanyl overdose?
So I don't recall specifically what I told the county attorney, but it almost certainly went something like this. Had Mr. Floyd been home alone in his locked residence with no evidence of trauma, and the only autopsy finding was that fentanyl level, then yes, I would certify his death as due to fentanyl toxicity. Again, interpretation of drug concentrations is very context dependent.
You then were also interviewed by the Federal Bureau of Investigation on or about July 8th of 2020?
I believe it was the Federal Bureau of Investigation and or the U.S. Attorney. A lot of these took place over video calls, and I wasn't entirely sure who was who at all times, but I believe it was those two groups, yes.
And that occurred on July 8th of 2020, correct?
To the best of my recollection, yes.
Right. Were you asked but-for type questions?
I was.
And were you able to form an opinion on but-for the involvement of law officers, whether Mr. Floyd would have died under these circumstances?
Objection, Your Honor, has been stated legal standard.
Overruled. This is not the legal standard, simply his diagnosis. We can go forward on that basis.
So I'll answer the question, Counselor. As I mentioned earlier, there were multiple people on these video calls, and at some point there was more than one person asking questions at a time. I don't normally think of things in the but-for paradigm. Perhaps that's a legal thing, but it's not normally how I think as a forensic pathologist. So what I clarified for the U.S. Attorney and the Federal Bureau of Investigation was my opinion as to what happened to Mr. Floyd, and that is he experienced a cardiopulmonary arrest in the context of law enforcement's dual restraint and neck compression. It was the stress of that interaction that tipped him over the edge, given his underlying heart disease and his toxicological status. That was also clarified in a letter from the Hennepin County Attorney to the U.S. Attorney, I want to say within a few days of that meeting, because of the confusion around how that meeting was run and the way those questions were asked.
Fair enough. Thank you. Again, the labeling this death as a homicide, that is a medical determination that you made, correct?
Correct.
It is not the same standard as the legal standard. Agreed?
I don't even know what the legal standard is, but there are two different worlds.
Now, in terms of your, again, involvement in this case, you have actually testified twice in connection with other proceedings, right?
Yes.
Regarding the death of Mr. Floyd, right?
Yes.
And the first of those testimonies occurred 20th of August, 2020?
Yes.
You understand that those were transcribed and under oath, correct?
Correct.
And you have had an opportunity to review those transcripts?
I have.
All right. The first time you testified in connection with the death of Mr. Floyd, at any point do you recall saying that I have to defer to some other specialty?
I believe I said that multiple times.
The first time you testified or the second time you testified?
I recall it was much more frequent the second time. I don't recall how often it happened the first time, if at all.
In terms of the placement of Mr. Chauvin's knee, would that explain anatomically why Mr. Floyd, would that anatomically cut off Mr. Floyd's airway?
In my opinion, it would not.
Do you testify extensively about the significance of the coronary arteries and the heart disease?
I'm not sure what you mean by the word extensively, Counselor. If we need to pull out the transcript, we can. I'm not sure what the word extensively means in this context.
Okay. You talked about the issues surrounding Mr. Floyd's death involving his coronary arteries, right?
Again, I can't quote you the grand jury transcript, but if you'd like to pull it out, I'd be happy to refresh my memory. Sure. I'm almost certain it had to have come up. May
I approach the witness, Your Honor?
What purpose?
To refresh his recollection as he requested.
Let's lay the foundation for refreshing first.
In this proceeding, did you recall testifying about how the coronary arteries work relevant to providing the heart with blood?
I'm almost certain that I would have. I can't imagine that I didn't, but I don't recall how extensively that took place without looking at the transcript again.
Would looking at the transcript refresh your recollection about your testimony in that connection?
Sure.
May I approach? Dates 44314. Page 26.
What date?
26. Now it's going to be awkward.
It does.
So what was the problem with the coronary arteries in this context?
I believe it's essentially the same answer I gave the jury earlier, which is because of the degree of narrowing of Mr. Floyd's coronary arteries, they have a limited ability to supply extra blood and oxygen to his heart muscle when he needs it. On top of that, he's got a larger heart than a man his stature would normally have because he's hypertensive, and so that heart is going to need more oxygen, which those coronaries have a limited ability to deliver.
And how do you think the introduction of methamphetamine to that scenario impacts?
Again, I can only give that a high-level answer as a forensic pathologist. I don't treat living people who have methamphetamine toxicity, but my understanding is methamphetamine is hard on the heart. It is going to increase heart rate. It's going to increase the work of the heart because it's a stimulant.
And in the circumstances of this particular case, in terms of a person with an enlarged heart, narrowing of the arteries, right, and how does the introduction of methamphetamine affect that?
And as I just said, it increases the heart rate, it increases the work of the heart. It's not something that I, as a forensic pathologist, would want to see in the blood of someone that has heart disease.
Did you describe it as a multifactorial process, the death of Mr. Floyd?
That certainly sounds like something I would have said, yes.
And then you testified a second time, correct?
To the federal grand jury?
Yes.
Yes, I did.
And that was in February of 2021?
Yes.
And ultimately, you deferred to experts far more extensively in that second testimony than the first, correct?
So the short answer to that is yes. The long answer is I believe I deferred to a pulmonologist repeatedly because there were so many questions about things like gradations of chest wall movement and would this, that, or the other thing impair a person's ability to breathe. And at some point, I clearly said, look, this is outside the scope of my expertise as a forensic pathologist. I think a pulmonologist would be better equipped to answer that question. I'm going to say I said the word pulmonologist at least a half dozen times in that testimony.
Do you recall deferring also to emergency medical doctors?
Again, it would depend on the context of the question, but I know I did reference emergency medicine doctors because some of the questions were like, when do you think Mr. Floyd really died?
How about cardiologists?
Yes, if the question was specific to an area that would clearly be a cardiologist's expertise, I'm quite sure I would have referred to them as well.
Thank you, Your Honor. I have nothing further.
Mr. Blackwell.
Dr. Baker, I'm going to be brief. So if we could look up, Brett, the section on cause of death. So, Dr. Baker, take into account the entire exchange you had with Mr. Nelson on Mr. Floyd's medical conditions, on whatever testimony you gave, wherever you gave it. I want to bring our attention back to what's reflected in Exhibit 193. And taking all of that into account, what today remains your opinion as to the cause of death for Mr. Floyd?
So my opinion remains unchanged. It's what I put on the death certificate last June. That's cardiopulmonary arrest complicating law enforcement subdual restraint and neck compression. That was my top line then. It would stay my top line now.
And so if we look at the other contributing conditions, those other contributing conditions are not conditions that you consider direct causes. Is that true?
They are not direct causes of Mr. Floyd's death, that's true. They're contributing causes.
And in terms of manner of death, you found then, and do you stand by today, that the manner of death for Mr. Floyd was, as you would call it, homicide?
Yes, I would still classify it as a homicide today.
Thank you, Dr. Baker. No further questions.
Anything further? Counsel, sidebar. Sometimes old-fashioned sign language is best. We're going to take a 15-minute break.
Thanks for continuing to join our stream on the Derek Chauvin trial. We are not live inside the courtroom. We are getting the feed from the court. Apologies for the upstream difficulties, some glitching happening. There is sort of some clouds and stormy weather a little bit downtown. I believe it seemed to have possibly passed. That might be the cause. We are unsure. We're trying to keep on top of it. Make sure you all continue to have the stream. Again, this is Nico from Unicorn Riot. Thank you, thank you. We have Alex on the tweets, and I'll show you our Twitter feed just to understand, just so you can understand that we do have the Twitter feed with a lot more information. If you have been missing out on certain portions of what's happening, you can go to our Twitter, UR_ninja, and from there you will see different tweets that are detailing updates from the trial. So check that out there. Also go to the front page of our website and you will find the Derek Chauvin trial landing page. Access to that is up there. Click on the graphic. If you want more on the reporter reflections of the George Floyd uprising and more information about George Floyd, click on the George Floyd uprising in the middle. And then we also have a lot of other topics that we cover. We have a full Discord leaks, one of the largest databases of white supremacist chats from their organizers, as well as a lot of coverage on Line 3 resistance. Line 3 is oil pipeline that's getting put, tar sands oil. It's getting placed in northern Minnesota. You see a live stream, video archive, and documentary archive. Check that out as well, and other articles. So go to our website, look around if you want to see. If you don't know about us, we are Unicorn Riot. We are a 501c3 nonprofit organization, and we are dedicated to bringing you context around social and environmental struggles. We are a small group. We are horizontally organized and have no bosses, and we also implore you to try to figure out a horizontal living structure yourself, or I do anyway. I implore that. There's a lot more people with a lot more ideas than just a vertical structure of society. So anyways, that's a side note. This is the Derek Chauvin trial. George Floyd was killed, obviously, by Derek Chauvin, May 25th, 2020, leading to probably the biggest, leading to the biggest movement in human history against racism and police killings. What I'm going to do right now is if you stick with us through this break, in about 7 minutes or so, we'll bring you more court updates from inside the court. Once the pool reporters, there are two pool reporters inside the courtroom. It takes them a little bit to get the pool report out to the public, or out to the other pool reporters, to the media pool, and once that happens, we'll try to read you some of the information from that. We'll also do an update at the end of the court today, so if you stick around after court, we'll probably play a video and then wait for a little bit of time to get the pool reports again, and then give you more of an update on what some of the jurors are doing. Again, real quick, Derek Chauvin has somebody sitting in his family seat for the first time, and that is possibly his wife. Is a woman of Asian descent, and she has a wedding ring on. So that is something that's happening. We're gonna play right now about, how long is this? 3 minutes and a half video of one of the first witnesses that we saw in this trial, who was actually a witness, and the voice of the narration of the video behind Darnella's viral video. And this will be Donald Williams. You saw him on the stand last Monday or Tuesday, I think. And this is his account, May 26th, at a vigil right outside of Cup Foods, very close to where George Floyd was killed. And this is the words of Donald Williams that night. We're going to roll that, be back with some more information on the trial and inside the courtroom as we get the pool reports. Again, thank you all for tuning in. This is Nico from Unicorn Riot. We will be back briefly.
If you watch the video,
Y'all heard a brother in the video commenting, telling the police that what they were doing was wrong. Y'all remember that? Yeah. He was trying to hold it down? Yeah. Well, this is the brother right here. Let's give him some love.
Yo, how y'all doing, my peoples? How y'all doing? Hey, yo, this is tough for me, man. This is really tough for me. You know, it was a, hey man, chill, let me talk, please, let me talk, please, let me talk. I mean, a lot of people know me as NFL, I'm Northside for life. I'm D-Will too. You know, this is really tough for me, man. I tell you, as I'm looking at my peoples, like, I felt like this was me out here, you know what I'm saying? Like I felt like, hey, chill out, chill, bro, now. Hey, so I felt like this was me out here. We're gonna bump him out the way right now, you know what I mean? Because this is a real message for everybody in our community. My little peoples, my grown peoples, my elders. You guys need to start listening to some of these people, because some of this stuff that I just seen in my face, my eyes at 32 years old, is real, bro. It's real out here, bro. I thought that was me on the ground screaming for my breath. He's talking about he need to breathe, bro. I walked over here, I'm like, damn, what's going on? This gotta be unreal. It gotta be unreal. I walk over here, I look at the man, bro. He's on the ground. He's screaming for his life. He's trying to breathe, bro. I'm a provider, bro. I know what chokes is. I know what a blood choke is. I know what ruthlessness is, bro. I didn't work with Minneapolis police so much downtown at Pichaluches. Y'all look at my face, I've been at Pichaluches for a long time. At the front door, you know what I'm saying? A lot of people respect me, bro. What I seen the other day, last night, was nothing a human. He was not a human. He was like a dog to them, bro. My man, his eyes, he didn't care nothing for his breath. Nothing for how he felt. Nothing at all. Y'all need to open your eyes, bro. My man needs justice. I don't even know him. This is not even my community, but I felt like I needed to step up. Like I said, I'm a Northsider, bro. This is different from me, bro. This is different from me, bro. But I know everybody need to come together. We need to rise, and we need to make this happen. Because them cops, I didn't know it was 4 of them, bro. I didn't know it was 4 of them. In the video, I only seen 2. You know how many videos or pictures I got this morning with 4 of them choking my man out? They didn't want me off the curb for a reason, bro. They didn't want me off the curb for a reason, bro. But you guys, we all need to come together, bro. I'm not worried about the threats. I'm not worried about what's coming next for it, bro. Y'all shouldn't be worried at all. But as Minnesota, and as a community, and as our black people, and as the people that want to follow with us, fucking stand up, bro. In a peaceful manner. Stand up, bro. You understand that? Black lives matter. All fucking lives matter. And they shouldn't treat us like we're fucking dogs. I've been there. I'm 32 years old. I grew up on the north side. I know how the police are, bro. They're ruthless. Is there good ones out there? No disrespect. No. There's some good ones out there, bro. There's some good ones out there, but there's some terrible ones out there, bro. There's some terrible ones, and they need to be weeded the fuck out, bro. They need to be weeded the fuck out.
So that was Donald Williams, you saw and heard from. Donald took the stand, I believe, last Monday or Tuesday. And if you missed that, you could go back to our streams on our website, unicornriot.ninja, or on YouTube or Facebook or Twitter, and check that out. We also have a Twitter thread, which is detailing a whole bunch of the court's proceedings. And that also has information of Donald Williams' testimony. So I'm going to read you some of the things that we see inside the pool reports. Again, thank you all for tuning in. This is Nico from Unicorn Riot. We have Alex on the Twitter today. And we are reading pool reports. So just a quick update from the court. We're looking at a live feed. They're on afternoon break. We heard from Dr. Lindsay Thomas earlier today and Dr. Baker just now. Dr. Andrew Baker was the medical examiner who did the autopsy. We also heard a new one that Nelson brought up, the defense attorney Nelson. He brought into the fact, well, he talks about gunfights a lot. He's talked about rectal drug use, and now he brought up the tropical disease. And so it's been interesting to see where he goes with some of these things. And also it was interesting to see that Dr. Baker, who, you know, a lot of people had questions about what his testimony would be, when he clarified how many times that although he had said that George Floyd had underlying health conditions, it was the police interaction that killed him. And so I felt like that was a pretty important moment. Me personally felt that way. So we'll bring in Adrian Florido from NPR is doing some pool reporting today. And Adrian said that there was, you know, that break. So there was that little break, a little 10-minute break around 2 p.m., 2:20 p.m. And basically, this is from Adrian. After Blackwell finished the questioning of Dr. Baker, you remember that? And then they gave the 10-minute recess for Nelson to get his notes together and stuff. When the defense team left the courtroom, Blackwell and Ellison remained, and Dr. Baker was called into the judge's chambers, and he emerged a few minutes later and asked Blackwell and Ellison some questions or talked to them. And then he asked Blackwell, who's the special prosecutor in this case, who you see questioning him, what his day job is. And Blackwell responded, complex civil matter focusing on medical devices. And so then they chatted amicably for several more minutes, according to the pool report. Also, there was a moment of levity when the door that the jury uses to enter and exit opened during the break. Everyone in the courtroom stood because that's the proper thing. You stand for the jurors and the judge. But it wasn't the jury. It was a stenographer. So everybody laughed, and the stenographer said, I'll start using the other door. So that's just some, you know, from inside the court. Again, the stenographer is the person who's writing all of the transcripts of everybody's words. So everybody that makes a statement on the witness stand, or the questioning attorneys, or the judge, they write it all up. Let's see if we have any more from Holly Bailey from the Washington Post. She said after the lunch break, or during the lunch break, the woman in Chauvin's seat returned to the courtroom alone at 1:24. You know, they came back from lunch at about 1:30. Right now they're on break supposedly until I think 3:45ish or 3:40, 3 something, maybe 3:50ish. Right now we're watching the live court feed from the courtroom. You can see if anything moves, their audio is on. So once they come in, you will hear them, and I will promptly be quiet. So I just got word that today is National Unicorn Day. That's pretty interesting and cool. So National Unicorn Day. We are Unicorn Riot. We were created 6 years ago in March 20, incorporated in the state of Minnesota as a 501c3, and we are a media organization that focuses on bringing context to social and environmental struggles and allowing the community to have a platform. So It's a National Unicorn Day, so we are celebrating. Hopefully you all are as well. You know, you have to have some kind of celebration amidst tragedy and trauma. Today, the woman is in Chauvin's seat, as we said, and that's possibly his wife. And Phalonis is Floyd's brother, now occupying the seat in the afternoon. I think it was Rodney earlier. And so there's a family room where they're all able to be and watch the proceedings. Only one of them is able to be in court per time. I'm going to try to find if there's any more about the jury in the notes real quick. Bear with me. They just came in, so it seems like the jury is, a lot of them were taking notes as Baker explained what he meant by using the term complicated in Floyd's autopsy during the cross-examination. Jurors 5 and 8 were... Oh, be quiet.
Members of the jury, we have one more witness who's a medical doctor, and by best estimates we would not be done by 4:30, and all the parties agree that you've had enough. We're going to send you home and come back on Monday. So we would probably be here past 5 o'clock if we go to the next witness, and it's been a long week for everybody, so let's all go home, have a good weekend, don't talk to anybody about the case, and don't read any media, and we'll see you Monday. Let's shoot for 9:15. Actually, it's going to be at least 9:30, so because we have legal issues to talk about before that. But so it'll be 9:30, but you can do your usual routine. Thank you.
Well, you heard it. They've called it for the day. I was sort of wondering why they, or if they were going to do that. In a way, it's already 3:50. They were coming back from their break. There still is another witness. You saw 2 witnesses today, and it looks like they're going to be done for the week. Obviously, we say that it's going to be resuming around 9 a.m. Although the jury, it sounds like they'll be in at 9:30. We will probably be resuming our coverage about 9ish. And also, it sounds like there might be some other motions and stuff to be heard. So, again, thank you for tuning in to Unicorn Riot for the Derek Chauvin trial. I will continue to read off some of these jury notes, and then we'll probably play a video and call it a day. Give me a second to find them. In the meantime, we see that there, I think, is going to be a few more medical witnesses. We heard them say that there's going to be at least one more. Basically, what we know is that other people were anticipating that Chauvin's past victims or victims of past interactions with Derek Chauvin were going to testify. That does not seem to be the case at this point. It seems like that is not admissible according to the judge in a prior ruling. And so in the past, Derek Chauvin had a few dozen complaints and had killed Wayne Reyes, as well as participated in the killing of a few others. We're going to take this feed off. We'll try not to get you hit with the loud sound. Give me a second. All right. So as you see, today there was two witnesses that we heard from. I'm going to read real quick a little bit more from the pool reports, and then we'll probably play a video and then call it a day, as I said. So there was people that were engaged. Jurors, at least three jurors were engaged when Dr. Baker was saying that in his response to the question from Nelson that Mr. Floyd had been locked into his room with no other factors but the fentanyl in the system, that he might have come to the determination that drugs cause his death. So you heard a lot of maneuvers from Nelson to get through different questionings, and that was very interesting to watch the way he comes to these questions. I'm going to try to get one more. That was from Adrian Florido. And then I'll read a little bit more of Holly Bailey's. Again, thank you all for bearing with me right now. These are pool notes that just came in, and so just didn't really even have a chance to check them out first. And I don't just want to read them for verbatim. It's a lot, and it's just, that would be ridiculous. So several jurors, again, were taking notes when Baker was explaining what he meant by the word complicated. Also, extensive notes were taken when Baker was talking about the details of the blockage of Floyd's arteries, because, you know, he went into how his heart had different blockages in it. This makes note, you know, when Nelson is drawing on his pad, you can sort of see him at some points like draw huge X's. And so there was one point when Nelson appeared to be flipping through a large binder of questions, and when Baker said he had viewed police body camera and other footage as part of his investigation but was not provided with witness accounts of other evidence, Nelson drew a huge X through a page of questions and flipped to another page. So it just shows you some of the preparation that these lawyers and attorneys have to deal with and deal with. I can't imagine they get much sleep after this. The preparation behind getting the questions, developing the rubric for questioning seems to be pretty dramatic, or dramatic, not traumatic. Seems to be a lot of work, and it take a lot of time. So try to read a few more if I can find them. Again, thank you all. This is Nico. Check out our Twitter feed, UR_Ninja, for more of the details from today's proceedings. Go to our website, unicornriot.ninja. Yeah, I might have called them jury notes. I apologize. I keep mixing jury notes and pool notes. They are pool notes from reactions inside the court. Here we go with some more real quick. When Nelson asked Bakers about his statements about fentanyl to Hennepin County prosecutors, almost no juror was taking notes. Same when he was asked about his statements to the FBI. Jurors are listening, but no one appeared to be taking notes at that point. You heard that questioning go on where he was seemingly questioning him about the interviews. Mr. Baker was being questioned by Eric Nelson about the interviews that he had with the FBI and other authorities while discussing the autopsy and what his findings were. And it sounded like also the questioning from the authority side was really trying to get at the defense of George Floyd being killed by the police, trying to find other reasons that besides 9 minutes of Derek Chauvin's knee on his neck. Asked if the placement of Chauvin's knee would be anatomically cut off Floyd's airway, if that would anatomically cut off Floyd's airway. And when Baker said, in my opinion, it would not, several jurors did note that, including juror 11, who had not been taking many notes. And juror 11, again, was a juror this morning who was sort of questioned as to if they are having specific conversations with other people. So here's a brand new update from Adrian Florido. Again, thank you all for tuning in. These are brand new updates that are just coming in right now. And I'll just read this in full. This is Adrian Florido, NPR. Toward the end of the 15-minute break, so this is just what happened. You know, they went into the 15-minute break. We thought they were coming back, but they didn't. Instead, they came back and said, you know, we're going to have the whole weekend off now, and we're going to come back Monday. Towards the end of the 15-minute break, this is according to Adrian Florido, all of the attorneys head into the judge's chamber. Left in the courtroom was Mr. Chauvin, his family representative, a sheriff's deputy, and the media folks. Chauvin's family representative glanced briefly at him, but he does not look over at her. The judge and attorneys returned from the chambers. The judge told the jury, "We're ending early today." The jury seemed surprised, but grateful. I noticed several smiles appearing to form under their face masks. It's been a long week. That's what Adrian Florido said. Everyone packed up and left the courtroom. As Chauvin walked out, he and Jerry Blackwell made eye contact again. We talked about earlier, before one of the breaks, Jerry Blackwell walked by him, smiled and nodded, and Chauvin nodded. This time, Jerry Blackwell made eye contact again, and Blackwell said, "Have a nice weekend." Chauvin nodded his head once. So that's what's happening on the inside. That's a lot of times you look at some of these prosecutors and some of these attorneys and the judges, they all play golf together. You know, I'm not saying that Jerry Blackwell plays golf with Derek Chauvin. I'm just saying that a lot of these people, you know, they know each other, and they're in the same line of things, same line of work. And if you're in the same line of work, most of the time you might have went to school together, you might know, have a close friend within that. And so it's always interesting to see some of these relationships play out. But that is right there what's happening with Jerry Blackwell saying hi, or basically nodding, saying have a good weekend to Derek Chauvin after also doing that earlier. Blackwell was the main prosecutor today for the state and the prosecuting team asking the questions. So that is the update from the pool reporting. And let's see if there's any more that came in. Okay, let's read the last one from Holly Bailey, and then we'll play a video and call it a night. Holly Bailey said that the woman in Chauvin's seat entered alone after that break and began doing some extensive stretching. Chauvin followed in a minute later, and he walked with stiff, perfect posture back to his seat at the defense table. This is a word of Holly Bailey. He's wearing a light gray suit with the jacket buttoned, and it seemed to be about one size too small. Nelson and prosecutors were called back into the chambers for a quick meeting, and then when Cahill emerged and said they were ending early, a medical doctor slated to testify for the prosecution, and that will be pushed back to Monday, as we heard. They recessed at 3:52. It was 10 minutes ago. So, and then Chauvin wrote something on a Post-it note and gave it to Nelson, who passed it to Cahill's clerk, and they exited, followed soon by the prosecutors. That's always interesting. So, like, Chauvin wrote something on a Post-it note and gave it to Nelson, who passed it to Cahill's clerk. Anyways, again, thank you for joining. This is Nico from Unicorn Riot. We have Alex and Chris also helping out. Alex was doing the tweets. Check that out on our Twitter feed. And just want to, again, reiterate, there's a lot of ability for one to get support if you are local and you want to get support. There's quite a few options. If you are not local, you got to reach out in your own places. I think I'm going to show you a quick website of one of the local organizations putting in some good work that you can check out if you're local and you want to get some support during these trying times. They have, I believe, every Thursday a specific support group. Again, Black Table Arts, they're a Black Artist Collect cooperative. They have a bookstore, and they do a lot of really good work. There's Kino on the left and some other folks, Arthur on the right. I forget the other name. I apologize. But yeah, check them out, because literally every Thursday, they don't have it written up here on their front page of their website, but they've been doing, Asia Washington. I apologize. That's Kino, Alfred, and Asia. But they've been doing, Thursday night healings, and so again, check them out. Check out support groups if you need. This is trying times. Thank you all for being really polite in the chat and for building a community with each other. Facebook and YouTube, and thank you for joining over there in the Twitter world. And you know what, we're just gonna bring it out off of that one. No, we'll play a really sort of a light one, something to go off into the afternoon with, to go off into the evening with, to the weekend. The Caldwells are a very prolific artist, father and son combination in Minneapolis, and they took part in painting the Black Lives Matter mural on the north side off of Plymouth and Penn this summer. And we're going to show you that. This was in direct correlation to George Floyd's murder. This was spurred by the murder, and this was the community coming forward. This was artists gathering together in front of the only Black History Museum in Minnesota, and that is that's also a special that we've done. So go check out our website, Minnesota's only Black History Museum. We've profiled them with a couple videos showcasing what they're talking about, what they're doing over there as well. And this we're going to show you is the Caldwells, and this is them talking about what brought them out to take part in the painting of the historical Black Lives Matter mural on the north side in the summer of 2020. After this, we'll come back with a brief outro and close out for the weekend. Thank you all again for joining our Chauvin Trial coverage, and the trial coverage resumes Monday around 9. Sounds like the jury will be back in at 9:30. You all take care of yourselves if you dip off right now. Otherwise, stick around. We have one more video that we're going to show you, and we'll be back with an outro.
Hi, I'm Charles Caldwell, Northside resident, artist, participating in the historical Black Lives Matter mural. This is a one-day project, started out at 10 o'clock this morning. Finishing deadline was 5 o'clock, and it looks like everybody's done, and we all completed the process here. My son, Kenneth Caldwell, and myself, Charles Caldwell, completed the letter R. And I'm real excited to be on the end of this thing because it's a continuation of what's yet to come. Great opportunity, great experience, and so happy to be had the opportunity to be a part of this. Grew up in this community as a kid, and just great to see something so profound and so powerful being stated on Plymouth and Penn Avenue. Plymouth Avenue is a historical avenue where in the 60s where the riots took place in this Black community. There used to be businesses up and down the street here. Transitioned from a Jewish community to an African-American community. At this time, it's a multi-diverse, multicultural community. Certainly, gentrification is taking place in all of our Black communities across the country, so that's certainly taking place in this community. We're gonna not deny ourselves the opportunity to stand up and speak about how significant, how important the Black lives are. We can contribute to everything that takes place in the world, even from the beginning. You know, we built this country, and we're continuing to do that. A change needs to take place, and so this is a part of the steps in that change. My son may want to say a few things here. This is my son, Kenneth Caldwell. He allowed me to be a part of his project today. Thank you, son.
No, Pops, thank you for helping me out here. I am Kenneth Caldwell, native of Minneapolis, Minnesota here, north side. The piece I painted is called Daydreamer. And what it is, it's a self-portrait and a portrait of my son, all in one. And what it represents to me is the reality of youth seeing the image and then creating what they see. So it's the creation and the image from a child's perspective. As a child, I looked up to my dad and was inspired by the arts from watching him, and I bring my son to the studio a lot with me, and he was in the studio and he wanted to paint. He had picked up the paintbrushes, and I was like, let me capture this moment. So I had him take the photo, and that's the birth of Daydreamer. And it's a self-portrait. I call it a self-portrait because it's also how I see myself. Not letting the inner child in me die, and always being hungry to try new things with the arts, and just being excited about the newness in the creation process. So that's pretty much why I call it a self-portrait, but it's also a tribute to him because I learned so much through watching my kids, just being patient, watching their excitement when they learn something new, when they see something new, and just teaching them and having them being able to receive it. That's a blessing when you can teach your child something or show your child something and they're excited about learning the gift that you're giving them. So Daydreamer is a perfect title for the piece. He loves seeing himself in paintings too. As soon as I finished it, he was like, "Dad, can I have it?" I said, "You got it, son. It's yours." So it's hanging up in his room now.
Can you talk about art in general? It's such a means of expression, and it seems like you and your father are incredible at capturing emotions within art and just like the scene. Can you describe just what your approach to art is?
So my approach, again, watching my dad, I would watch him go through magazines and take images or take pages from magazines. And I was always wonder what he was doing. And finally, I just kind of watched and I asked him and he was like, "These are references." And I didn't understand what that meant at the time. I was, 6, 7, 8 years old. And I would see the way he would take a couple of photos and put them all into one. So as I became an adult artist, I would do the same thing, collect references, take my own images and put them together. Things that I would see, images that I would see, people that I would see in the community, I would want to capture those images and bring them to life and give it back to the community. So what I'm seeing, what the community is giving me, I'm creating it in my paintings and giving it back. So that's my process.
What was it like today? It's super hot today, first of all.
You see me sitting down. I'm exhausted. I got lightheaded a few times, but the energy was I mean, you can't even put words on the amount of energy from the other artists and the people that were out here. It's I mean, again, you can't put words to it. It was something you can't. I wouldn't have wanted to miss this opportunity. I'm glad to be a part of this. I ended up getting the last letter. I was late. I was so busy with art stuff, paintings and framing up stuff, and so I responded to the email late and I got the last letter. And I didn't think I was gonna finish on time, but with the grace of God, I was able to finish. But I overheard somebody say I either want the B or the R because it's the first thing they see or the last thing they see. So I guess I kind of, again, that's God's favor right there. Ended up getting one or the other, so.
We're 2 blocks away from the 4th precinct. 5 years ago, there was an 18-day occupation for justice for Jamar Clark, who was shot in the face by police, unarmed. And his family received no justice. We have the George Floyd case that is just reverberated throughout the world.
The world, yeah.
And can you talk about maybe where you feel like we are right now as a country, and maybe even just Northside Minneapolis?
I think in every storm, at the end of every storm, there's beauty that comes from it. I mean, it's kind of being able. You got to be able to look through the murkiness, the dirty side of it, and be able to come out on the other side clean. And it's sad that people have to lose their lives, but on the back end, you get a whole community coming together. You get people from different races, different ethnicities coming together and realizing that there is something wrong and doing something about it. We got projects like this, and it's giving the artists an opportunity to speak through their visual paintings, through their poetry, through their whatever medium that they have, and it's our chance to speak. It's our chance to do it creatively. So I think that's the plus side of it. The downside of it is that the injustice and people are losing their lives in order for this to happen. So we need this to happen without people losing their lives, without black people losing their lives. People in general, but right now the focus is black people, minorities, and that's the biggest thing. So yeah, after the storm, you gotta wait for the fruit to flourish and see all the beautiful things that come out of it.
You sort of expressed it, but what does it feel like to even get invited to this?
it happened so organically. I got tagged on a Facebook page, and I was like, yeah, that'll be dope to do. I'm down, you know. And I responded, and maybe a week later, the ball was rolling, and here we are. And a lot of these artists I had never met before. So it's kind of tough for artists to see other artists and connect and get together and build like this. So this opportunity for me to meet other artists and see their work is incredible. I mean, there's a lot of talent out here, For a while, you know, I mean, there's the names we have, the Takumbas and the Seitus and Chris Dean, Christopher Harris. I mean, there's a lot of, you know, older artists that have made their mark, but to see these young artists out here, like myself included, coming up under my dad, Charles Caldwell, I mean, that's a big thing to be able to see these artists come up and flourish and be able to say what they need to say through their work. So that was dope.
So that was the Caldwells, Charles and Kenneth Caldwell, very prolific artists here in Minneapolis, mostly on the north side, I believe. Thank you all for joining. This was Friday broadcast, day 22, I think day 9 or 10, inside the courtroom with a full jury. There's 14 jurors again, 12 are being used, 2 are alternatives in case something happens to one. One thing, there's been 2 juror side sort of pieces where the judge has called in specific jurors and asked them about specific things that they might have seen or gotten in texts or whatnot. And neither of those has resulted in the juror getting excluded from the case or getting kicked off. So continue to follow. We have an update going on the Chauvin website. You can check that out at our at unicornriot.ninja and go into the front page. You can click on the Derek Chauvin Trial graphic up at the top and get into the web page that shows a lot of the happenings in the trial, and all of the live streams are there. So again, thank you all for joining. Thank you everybody out there for your support, your viewership, sharing our work. Thank you Jadzia out there helping out. Thanks Alex and Chris. Thank you all for supporting. Again, we are Unicorn Riot. We are a 501c3 educational nonprofit organization, and anything that you donate is tax deductible. You can donate by going to unicornriot.ninja/donate. You all have a great weekend. Stay safe, and we will see you Monday morning.